अपूर्व सर हम स्टार्ट कर सकते हैं।
Yeah, you can stream live.
Yes sir, we are live now.
Good evening, everybody. This is Dr. Apurv Mehra, and I welcome all of you on behalf of the Cerebellum family for this specific session about the recall of the FMG Jan 2025 exam. The exam has been conducted today, and we are here to discuss with our students, right, some of the important things. And the initial feeling of the exam is this, that the exam had decent amount of image-based questions. The second feeling is that always is there. Some people do feel a minor proportion feels it was a very easy exam. That's a very minor proportion. This feeling is going to change by tomorrow morning, I am very sure, right? But the majority of the students feel that it was moderate, right, to hard. That's the feeling that they have.
Exactly.
All right. I'll just welcome Dr. Sparsh Gupta sir and Dr. Anand Bhatia sir. They are on the screens with me. And Dr. Sparsh sir, I will take up my questions after I have a quick input that you have been one of the pioneers taking up the specific section, right, along with NEET, PG, and INI-CT. I rate you very, very high when it comes to FMG students because you have been very close to them and you have been there. And actually, it you have been talking almost always them because the love and the respect they give us is quite a different level. So हमारे शेर हमारी शेरनियाँ सारे जो FMG के बच्चे हैं वो एग्जाम दे के आए हैं and I'm very sure they will like to listen from you, right? What are your initial points about the exam today?
Yeah, absolutely. Hi, good evening, everyone. I think first thing first, I would really appreciate the fact that most of you did have the courage to appear in the exam and you have tried to appear in the exam with your best level of preparation. Right now, the feedback that I could get from after interacting with students was that yes, after the first paper, they were not so happy because of the fact that one, the number of images, as Apurv sir did make a mention of, were like really high this time around. And second, even though the questions were asked from the topics which are usually there, but they were tweaked to a very large extent. So just a feeling that people had that no way it was easy for sure. I mean, even in exams जहाँ पे हमें लगता है कि पेपर बहुत easy होता है, by the time we realize what are the actual answers and what were the small tweaks which were given, तब वो subsequently मुश्किल हो जाता है. But this time around, people genuinely felt that it was a bit way too higher. Of course, we are going to be talking about a couple of questions which were not expected in the exam at all. So please don't worry about those genes and those associations that they asked you this time around. But let's keep our fingers crossed that the paper two, which was relatively easy with the buzzwords, would definitely help us scale through the exam.
All right. So I will just start rolling the ball, right? I will like to take up the orthopedic question. And I have divided into two simple slides. I have put up the questions. I've got 7 of them right now till now. And thankfully they've been there from the areas which I usually ask in orthopedics. This is I'm just with the permission of everybody sharing the screen. And is my screen visible to everybody? Can all my teachers?
Yeah, absolutely visible.
Right.
Pretty
So,
clearly visible, sir.
so this is these are the questions which I could figure out from orthopedics. So I have taken up the first question. Normally, there is a question that's an image-based question that comes to you from a periosteal reaction in orthopedics, or as I said yesterday, an osteochondroma. But this time, the question that came to you was based upon the history of an individual with sun ray appearance. So sun ray appearance, the moment it comes, this is going to be osteosarcoma. Some students did mention in different groups that they thought it was Ewing sarcoma, but majority of the students, they feel that it was osteosarcoma. So this was the first question which was there. The second question, which we predicted yesterday, as people said, out of the 5 things which I said, that they always love the ulnar nerve, and their love for ulnar nerve is never dying in FMG exams. So they had spoken about the fourth and fifth ray clawing, and they had asked which nerve will be involved. So the answer is going to be ulnar nerve. This was the second question. The types of epiphyses are always something which are asked, right? And joint forming epiphyses. I have two group of students. One group of students says they just asked about the head of radius as a joint. So the pressure epiphyses. Some students say the lower end of fibula image was there. So they had asked, but basically the question that they had asked was, if there's a joint forming end of a bone, it's going to be the pressure epiphyses. So they had asked this pressure epiphyses. And now the last two are doubtful. Some students say there was a question on radial nerve. Some students say there was a question on the median nerve. Anybody who can tell me? These are non-image based questions. Anybody? I've got three more, but anybody with the radial or median nerve question who feels in the chat on the YouTube if they can mention? So this is clear. Pressure epiphyses lower end fibula was there. People are saying Radhe Radhe to Anand sir, right? And saying hello to Sparsh sir. So here in this group at this point of time, right? So Dr. Abid says there was a question on the radial nerve. Any idea what was the question on the radial nerve? All right. So everybody says there was a question on the radial nerve. Was it on a clinical presentation about the wrist drop or about the splint? All right. So there was a question on the radial nerve. So these were four questions which were right. And some people say, right, and there's somebody mentioning in numbness of the thumb, index, and middle finger. So that's going to be median nerve. That's carpal tunnel syndrome. All right. And some people say dorsum of the hand sensation loss, that radial nerve. So basically all the three nerves have been asked. So we'll keep on going about this. So next is the three questions that came as image based, right? So the first one was they had shown a clinical image of a shoulder dislocation. And if they had shown you, right, if they had shown you an image of abducted arm, that's going to be anterior dislocation. And if the arm was by the side of the body, it's going to be posterior dislocation. All right, that is one. The second question that they had shown was they had shown low calcium, low phosphate, and shown you bowed legs. That's going to be rickets, vitamin D deficiency. All right. And the third question that everybody is writing down, there was an image of a bed-like splint, right? That was Bowler-Braun splint. So these are the questions which have been there. All right. And now the two things, if they had mentioned about the index, the thumb, index, and middle finger, the three sensi laws, it's going to be carpal tunnel syndrome, the median nerve. And if they have shown you the dorsum, it's going to be radial nerve. All right. So these are the questions about ortho. I'm repeating again. Osteosarcoma, ulnar nerve, pressure epiphyses, right? If the dorsum of the hand, the radial nerve, if the first 3.5 fingers, the median nerve, carpal tunnel syndrome, rickets, image ways with low calcium and phosphate, shoulder dislocation, most likely anterior, all right? And then they had Bowler-Braun splint. I will be getting more questions. I'll be framing it into a proper presentation, and I will be coming back to all of you, right, with the discussion, and we will release it in the app. So this is what I have to speak from the orthopedic point of view. If I just become a little biased. So for me, right, these were the questions these are the standard topics. I'm just talking about orthopedics at present. These are the standard topics along with the standard images that you expect to come. All right. So there is nothing that I have seen apart from the standard deviations coming in orthopedics. But yes, there are certain subjects where this feeling is there. So please do not link me या मेरे को इसके अंदर सजा मत देना कि सर आपने तो बोला वही आया, ऐसा नहीं है. I'm just speaking about my subject. So now I will request my senior, the legend, Dr. Sparsh Gupta, to take on the stage and carry on. Thank you
I
very much.
think I think that is the only saving grace for the day, sir, because getting a feedback from the students after the first paper, it is really tough, and extracting those questions out is going to remain a challenge for the next few days. So do excuse me for whatever shortfall that we face with respect to the exact wording of the questions or the options, but certain things which you can obviously help me recall over here. So Yeah, so I'll start off with a question. So you got a question in the exam in which they talked about the pattern of inheritance, where it was made a mention of the fact that definitely there is a mother to child transmission of particular disease. And that's what we have made a mention of is going to be seen as a feature of mitochondrial disorders, right? So starting off with that one to ease your nerves. Then we got a question in which the question was asked about the genomic imprinting, wherein the smart thing this time around was not asking you about directly the micro deletion that is taking place on the paternal chromosome. They did make a mention of the clinical manifestation of a child having mental retardation. The child was having short stature. The child was obese. And then it was made a mention of the fact that on genetic analysis, micro deletion of the paternal gene the gene on the paternal chromosome was observed. So that was known to majority of you. That was Prader-Willi. Yeah. Second one. The third one was a bit tricky in the sense that we have talked about the diagnosis of myocardial infarction, and we have also made a mention of the fact that there is something called as interaction between a stain, triphenyl tetrazolium chloride, and the lactate dehydrogenase, right? But the trick in the question this time around was the timing, I believe, was asked. So there was no unanimous consensus on what exactly were the options. But I'll just share a simple fact with you, knowing by what the data shows. You see, if you just read your Robbins well, and if you just watch the videos carefully, less than 12 hours on the gross examination of the heart, it's very difficult to predict whether the person has suffered from a myocardial infarction or not. But talking about a line which can help, and if you can just let me know the exact options, it makes a mention of the fact that if the infarct is more than 3 years of old, then you can visualize the infarcted area in the myocardium with the help of triphenyl tetrazolium chloride. So I was given it, in fact, more than four options. So somebody said 1 hour, 2 hour, 3 hour, 4 hour. But this statement is going to be very clinching. Less than 3 hours, you are not able to make a diagnosis on the gross, but more than 3 hours, if you are going to be applying the stain, that's going to be useful for making a diagnosis. And of course, everybody knew about the Geomerilal thing, but of course, the timeline was something which was a trick point over here. So if it was 2 to 3 hours, of course, we would be going in for that as the answer of choice. So beyond 3 hours, you are going to be picking up the gross diagnosis of myocardial infarction, right? Talking about the fourth one, this was some interaction people said that we had when we were talking about the quick revision discussion towards the last lab, when we talked about the platelet disorders and interaction between von Willebrand factor on the endothelial cell and the glycoprotein 1b present on the platelets. I'm yet to figure out the question, but somebody just did send a message कि सर आपने जो पढ़ाया था वो आ गया. वो क्या पढ़ाया था भेजने वाले को भी नहीं पता, मुझे भी अभी तक क्लियर नहीं है. Interaction between von Willebrand factor and glycoprotein 1b is all I know, right? There's a question that we have, in fact, as a very beautiful image given in our, quick revision book as well. This was pertaining to the esophageal motility disorders. And this question was talking about a guy who was having a dysphagia. He was having the presence of a diagnosis of eclasia cardia. They tweaked the question. They asked you about the radiological association. What exactly is the filling defect that you see in the patient? Is it going to be a irregular filling defect? Is it going to be a rat tail appearance? Is it going to be an example of a regular tapering? So we all know that the bird beak appearance is going to be because of a regular tapering, right? So just interacting and the interlinking what was asked in the exam. Of course, certain tweak questions were there. I mean, just as a joke, as we said, that once you finish your exam, you're going to be celebrating your Valentine's Day well. Microbiology madam, Dr. Devyani is also there. So, I mean, she would also be talking about the fact, I think the Rose Gardner's disease, Porothrix question was there. Uh, then there's a standard question, which was pertaining to a gene, the c-Myc gene. We talked about that African child, jaw mass, and it was a straightforward question talking about Burkitt's lymphoma, which was caused by associated with the c-Myc gene. There's a question which talked about the tumor marker, elevated levels of alpha fetoproteins. Even though we know that it can be seen in case of neural tube defects, it can be seen in case of hepatitis, it can be seen in case of other tumors. But you were given questions, options like stomach cancer, lung cancer. But the most plausible option that people recalled was yolk sac tumor, which we did make a mention of in association with the Schiller double body as well, if you recall, right? Then we had one question on hemolytic uremic syndrome. I would be really happy if you can just let me know exactly, was this a clinical question or what they were asking about the causative organism, or was it about the presence of the angiopathic hemolytic anemia that you see in this condition? A thyroid cancer question was very much expected, but none could recall the exact image because that is where the ultimate diagnosis would be, whether they asked you about the papillary cancer or they asked you about the medullary or the follicular one. This just said eosinophilic tha sir, kuch pink pink tha. but there can be too many pings as you understand in path, and it would be really great if you can share that image so that we can make a better diagnosis. One question which troubled a lot of people, and people were literally, very critical of the paper setters, was the hand-foot syndrome, and perhaps there was some homeobox gene which was asked in the exam. So let me just reassure you that such questions are given just so that nobody gets a perfect 300 on 300. Don't worry about such questions. They are neither going to be repeated in the exam, nor do they make any sense. Just take it with a pinch of salt that this question was unfortunately given in your exam. We had a repeat question on one of the images that was asked as a skin tumor, which showed the presence of palisading. And this was a straightforward question on basal cell carcinoma, right? One question which was easy, perhaps the first, one of the few things that we talk about in a discussion of the presence of the basophilic appearance. So that was on an elderly patient who was having the presence of a headache. There was an increased intracranial tension, and the question did make a mention of the histopathology showed you presence of semoma bodies. So once you're thinking about a patient having a brain tumor having semoma bodies, of course, you would think in terms of a tumor like meningioma. That is what I would like you to recall over here. Another question was about the characteristic findings of irreversible injury. So not too many options over here. Bleb formation, I believe, mitochondrial densities, nuclear condensation was mentioned as one of the options, right? So can you, if you just can let me know exactly what were the other options, right? Yeah, they were. Was there a mention of the word pearls as well? Okay. Yeah, so meningioma, everybody recalls that, right? So easy ones, of course, we are very much clear of, but of course, there were some which were not so good. But trust me, we are going to be doing the effort from our side, and as and when we get more support from your side, talking about the exact recall and the options, I think we'll be in a better position to provide you with exact answers and the exact options, right? Okay, carrier access was there. No orphan NAI, I know that orphan NAI nahi tha, so that was also heartbreaking stuff, but considering that whatever has been asked in the exam, so we'll restrict ourselves to that discussion only, right? So those were the 13 questions that I could recall, 12 or 13 that I could recall as of now. And definitely we are going to be coming up with a discussion, detailed discussion pretty shortly on the app as well.
Shall I start off with mine?
For sure, sir. Life is beautiful. And you have on screen Dr. Anand Bhatia, who's going to be discussing his questions with you. Thank you so much for joining in.
Thank you so much. Good evening and regards. My name is Dr. Anand. Let's just come back to the main slot, the FMG recall question 2025. Make sure these are the recall questions. And the questions were pretty good enough. The first question we have had over here, which sir just now repeated, patient with developmental delay, obesity, and paternal gene is deleted. Paternal gene is deleted. We had done in our classes also that one of the examples for uniparental disomy, Angelman, Prader-Willi, Russell-Silver syndrome. So developmental delay, obesity, and paternal gene deleted. One junior had said that which chromosome involved question aaya tha. So chromosome number 15 is involved in this question. The next one junior said regarding the zinc problem, the acrodermatitis enteropathica. उसने बोला कि नीचे वाला picture आया था exam में. So this baby who is suffering from a problem known as acrodermatitis enteropathica, and the question was regarding कि किस चीज का deficiency है. So the deficiency of zinc was the answer for this question. The next question we had over here, मुझे एक junior ने बोला कि exactly steeple sign ये वाला photo आया था. So this is, we all know, it's nothing but steeple sign, which is seen in a case of group, and a 5-year-old child came with complaints of fast breathing and distress. The image is shown below, and this was the image as my junior had said. So this, the answer for this condition is group. Okay, these are the recall questions, my dear family, and recall questions. Yeah, the one question had come regarding the Shakir tape. One student had said, sir, mid upper arm circumference was given roughly around 10.5. So that was the Shakir tape question they had given. So to diagnose severe acute malnutrition, what is the mid upper arm circumference required for Shakir tape? So if your Shakir tape mid upper arm circumference was less than 11.5, it is severe acute malnutrition. Less than 12.5, moderate acute malnutrition, and more than 12.5 is normal. Then one question had come regarding this one, chronic malnutrition, which parameter has affected? These questions multiple times back to back we have done in our classes, online, offline, everywhere we have done this. So the following parameters affected affected in chronic malnutrition is height for age. This question had come. One question had come same regarding the upper segment lower segment ratio. One junior had said कि upper segment lower segment ratio दिया गया था. The only thing was there was an increase upper segment lower segment ratio. So top three examples of increase upper segment lower segment ratio are nothing but rickets, hypothyroidism, and achondroplasia. And achondroplasia was in the option. That's what they had said regarding this. Then one question simple tha. Someone had said कि one X-ray was there and bowing of legs was there. A 2-year-old child with bowing of legs and widening of wrist. So simple, happy answer. Rickets is the best answer for this question. Acha, this was a question regarding pneumonia. Again, I told you pneumonia, severe pneumonia are the very favorite exam questions. So a 2-year-old child came with complaints of fast breathing with respiratory rate more than around 48 per minute. This is definitely fast breathing with no chest retraction. So what is the diagnosis? So what is pneumonia? Fast breathing with or without chest indrawing is known as pneumonia. So fast breathing is there with or without chest indrawing, that is known as pneumonia, and the answer for this question was nothing but pneumonia. So life is beautiful. Thank you so much for the participation. These were the recall questions which I could able to get it, and now I'll stop sharing and I'll tell our next faculty. Hello ma'am, good evening. You can continue. Thank you so much ma'am.
Can I share my screen?
Yes ma'am, you can. Thank you.
Thank you. Share my screen.
No problem, take your time. Try to share it.
I'm able to share it with this.
You can verbally also continue speaking the questions.
Ma'am, if you wish to share any images, I mean, we can just try it out after a few minutes.
Yeah. We can. I think somebody else can go. I can just maybe try again.
For sure.
Can I do my questions now?
Yes, sir.
All right, thank you, Devyani.
Share it with this. No
All
issue.
right.
You can verbally also continue speaking the question.
Ma'am, if you wish to share any images, I mean, we can just try it out after a few minutes.
Yeah. We can. I think somebody else can go. I can just maybe try again.
Praveen sir, I think there's some
Can I do my
device
questions now?
activity over
Yes,
it.
sir.
मेरा स्क्रीन दिख रहा है और
हाँ जी आपकी स्क्रीन विजिबल है सर, आपका शायद एक पैरेलल वीडियो भी चल रहा है, उसको थोड़ा म्यूट कर लीजिएगा.
if you wish to share any images, I mean, we can just try it out after a few minutes.
Yeah. We can.
Okay, is it okay now?
Absolutely fine sir. आपके तो सारे predicted वाले आ गए सर, as you were
हाँ सर, मैं
hitting
तो
a bullseye.
साइकियाट्री तो सिंपल आया है. सिंपल तो नहीं, मतलब एटलीस्ट पीवाईटी उसमें से आ गया है. All right. So students, good evening. Let us talk about the questions that were asked quickly. So the first question was a pretty simple question. 24-year-old male diagnosed with psychiatric disorder, and now he has become aggressive, speaking rapidly, sleeping less, and hyperactive. Right? So these were the questions. These were the lines of the question or the clinical vignette. So it's a very simple answer that all of these are symptoms suggestive of manic episode. Right? So the answer was option B, bipolar mania. Okay. ठीक है. Second question. Now this question comes every single time in every single exam. 45-year-old man comes to you with auditory hallucinations, inability to recognize family members, which means he's disoriented, and there is history of alcohol intake. He stopped taking alcohol 2 days back. The answer is as simple as it gets. The answer is delirium tremens. In fact, yesterday when we were predicting questions, this was the first question that I predicted, and I mean, no medals for me because this question comes every time. Students, are you able to listen and see me?
Absolutely sir. वो
ठीक है, तो मेरा चैट में आता, चलो ठीक है. Third thing, a young female reports episodes of binge eating followed by self-induced vomiting. So probably the diagnosis is bulimia, and what was asked was acid-base disturbance. So we know that in bulimia there would be alkalosis because there is loss of acid, and this would be of course metabolic alkalosis. ठीक है. Acha, this question there is some controversy. So there's a doctor who is asking a patient about the age, and most of the students are saying that after talking about all these things, she told that her age was around 32, and some are saying that the age was not mentioned. So अच्छा हाँ, अभिनंदन सेइंग स्नेक क्रॉलिंग था ना, ठीक है. सो इसमें हम लोग स्नेक क्रॉलिंग डाल देंगे. कोई नहीं, स्नेक क्रॉल कर रहा है कि नहीं कर रहा कोई फर्क नहीं पड़ता. हेलुसिनेशन हो रही है ना, दैट्स इनफ. ठीक है. In this question, was the answer given? What was the age given in the question sentence? It was. So if it was given, in that case, it becomes circumstantiality because the patient is not giving the answer directly. She's talking about the random things, but finally she's giving the age. Age was 38. Okay, let's make it 38. Answer is circumstantiality. What kind of symptom does the term affective flattening imply? We have done this question. It is a negative symptom, of course. Answer is B, negative symptom. Lady presents to the hospital after having a fight with husband. She is not able to speak. All the examination is normal. She does not seem concerned about her health status. Can anybody tell me what was the D option? What was the fourth option? What was the fourth option? What was the fourth option? ये बता दो मुझे. चलिए एज का देख लेंगे बाद में, but tell me what was the fourth option here? Labile indifference, malingering, somatic symptom disorder. What was the fourth option? General anxiety disorder. ठीक है. So somebody is saying GAD. चलिए, whatever it is, this was a pretty simple question. I'm sure all of you must have gotten it correct. Labile indifference. We have talked it hundreds of times. And lastly, again, a simple question. 28-year-old woman diagnosed with case compliant with medication, which is olanzapine, and she discontinued the treatment. What is the likely reason? We have again studied this multiple times that clozapine and olanzapine are the antipsychotics associated with weight gain. The answer is weight gain. So these are the 7 questions, and I'm pretty sure that you must have gotten 6th, 7th, 5th, and 3rd, 2nd, and 1st correct. Regarding the age, if the age was given, the answer is circumstantiality. If not given, then probably tangentiality. But otherwise, straightforward question. That's it from psychiatry. Thank you, Sparsh sir.
You're welcome, sir. We can just try out Devyani ma'am now again, if she can possibly connect with it.
Yes, sir. Just a second. Is it visible, sir? In the screen?
Definitely not, ma'am. It just makes a mention of the fact that you have started screen sharing, but we are not able to see your screen.
You are not able to see the screen. I don't know what is the issue. Just a second.
Yeah, ma'am. Yeah, it became visible just for a transient moment.
मैम आपको सिर्फ पीपीटी वाला स्क्रीन शेयर करना है, आपका डेस्कटॉप दिख रहा था.
हाँ जी, sir. That is what I'm doing. I have allowed it. I'm not sure why it's still not showing.
बच्चे स्क्रीनशॉट
I'm connecting it via the iPad.
फिर मीम्स बना देंगे.
I'm connecting it via the iPad. I'm not sure why is it not showing.
So what we can do, ma'am, as of now, you can just talk about the questions, and perhaps you can just
ठीक है.
images subsequent if it is
ठीक
possible.
है. That's okay, sir. हाँ. So, students, the FMG exam, I think all the questions that I've been able to get from microbiology, I believe it was quite a direct kind of a question. And most of the things were covered in the topics that were already taught. So I think the first question that was there was the most common question that comes in FMG all the time. It was the rose thorn prick history, and I believe there were three options: chromoblastomycosis, porothrix schenki, and nocardia. And we all know rose gardener's disease. Most commonly, the answer is going to be yours, porothrix schenki, right? Then there was a history of a patient who had TB symptoms, and you were asked what was the media used for the isolation. And the most common media that we have is the Lowenstein-Jensen media, which is the LJ media, right? Then there was another question, which was question number 3, where there was a history of an elderly patient, I believe 60 years of age, and a new heart murmur was given. Then a history of prosthetic valve was given. I think this has been a very controversial question in terms of if they had not mentioned if it was an early onset prosthetic valve endocarditis or if it was late, because both the answers that are there for early and late were given in the options. So I believe that this is a little bit controversial question. I believe we need more data on this. So if it was an early that was mentioned, then it is going to be staph epidermidis. And if it was a late one, then it is going to be Streptococcus viridans, right? Then there was a history of a Chinese fried rice consumption. Patient had vomiting and diarrhea after the consumption of Chinese fried rice. And we all know that the most common organism associated with the consumption of Chinese fried rice is Bacillus cereus, right? So Bacillus cereus was the answer here. There were other organisms like Staphylococcus aureus that also cause food poisoning, but Chinese fried rice is very, very specific to Bacillus cereus. Time wasn't mentioned. Okay, there is another question in which I think a smoking history was given. Patient was intubated. He had inhaled the smoke, and an oxidase positive organism was given, and you were given a media which had a greenish colored organism on it, right? There was a green colored pigmented organism on it, and I believe in the options you were given Pseudomonas aeruginosa as one of the options. So that is definitely going to be the answer, which is Pseudomonas aeruginosa. There was a picture of a nutrient agar that had the greenish pigment color, right? Okay. Gram-positive cocci is also Staphylococcus, right? So that cannot differentiate between Staphylococcus aureus and Streptococcus epidermidis, right? Then we had a question on chorioretinitis. Chorioretinitis with patent ductal arteriosus and hearing loss. This triad was given to you, and you were asked what is the diagnosis. So for these, you had options like congenital toxoplasma, congenital rubella syndrome, right? And congenital CMV. So if it was all this triad, it has to be congenital rubella. That is going to be the answer here. Then question number 8 that I had, I'm not sure of this question. Somebody had just mentioned about the typhoid antigens that was asked. So if anybody can help me regarding this. Yes, there was also another question on toxoplasma. I'll come to that. Were there any questions on typhoid antigens? Can anybody help me with that? Okay, typhoid antigens was there or not? Because I believe one person had mentioned and then no options were given, no exact question was given. No? Okay, I'll just cross this question then. There were some students are saying there were 2 separate questions on toxoplasma and rubella. OH was given for typhoid antigens. OH were given and you were asked what? S typhi more than one. Were they asking you the titer? They have mentioned Vidal test also. Okay. All the antigens were given and you had to mark Vidal test. Okay, so they had given all the different types, O, H, AH and all, and you had to guess how to test this. Vidal was the answer, I believe. That was the kind of question that was there. Okay, great. Okay. 1:120, I think, was given. For rubella, salt, pepper, skull was there. Okay, I'll go to the next question. For toxoplasma, was there a second kind of question separate from rubella? Okay, there was no separate question for toxoplasma. So if there was a triad of chororetinitis, PDA, and hearing loss, I would go for congenital rubella and not toxoplasma. Okay, then there was another question of a male with upper respiratory tract infections and all the antibodies were missing. It was a male child, I believe. And in the options, there was Brutton's disease. There was a question on Brutton's disease also, where there was a child with upper respiratory tract infections and all the antibodies were missing. If you can confirm, then I can go on that. Malaria positive, typhoid. Bretton's question was there. Okay, so that has to be there. All the male child with upper respiratory tract infections and all the antibodies were missing is going to be the Bretton's disease. Intracerebral calcifications, okay. Okay, there's confusion if it is rubella or toxoplasma. I'll have to get back on that. I think in India Inc. was one of the questions in which CSF sample was taken and India Inc. was performed, and you were asked what is the organism. I think in the options you had Cryptococcus neoformans. That is going to be the answer here. Most commonly we use Cryptococcus neoformans, right? So that is going to be the answer. Then there was another question on the rice pottery stool. Somebody said there was question on rice pottery stool, but there was no Vibrio cholerae in that. Is that true? Okay, so there was a rice pottery stool question, organism was asked. There was no Vibrio cholerae in that. So please help me with the options if you can. There were two questions on India Inc. Okay. Okay. So if rice pottery stool was there, my answer is going to be Vibrio cholerae as one of the answers. Then there was a question on Clostridium botulinum toxin, and you were asked the mechanism of action. We all know that Clostridium botulinum acts on the acetylcholine receptors, inhibiting it. So the answer is going to be inhibition of the acetylcholine receptors. Leptospirosis, I will take up the questions. No questions on rice pottery stool. Okay. Food poisoning ka tha. Okay. There were any other questions? Chinese fried rice we have discussed. HIV patient showing India Inc. we have discussed. It's Cryptococcus, Leptospira, microscopic agglutination test for lepto. Okay. Shigella, they had asked hemolytic uremic syndrome. Okay. I think that is it from my side. We can take up the other questions. If you have anything else, please message me. So I think I'm done with the micro questions. So, Dr. Amrit, I think you can go next. Thank you.
Sir, Dr. Vivek sir can go after that. You can come.
Okay.
Thank you.
Thank you so much, sir. Okay, friends, I'll be looking at the YouTube Connect right now. And what I've got through till now is 25 questions. All 25, I'm sure you must have attempted correctly. I need 7 to 8 more questions. Let's quickly go through this. This was the first question, which is the nodal ministry for disaster management. We know the answer. Ministry of Home Affairs. Could you please help me complete the choices? One was Ministry of Health. What were the other choices, friends? Besides Ministry of Health, could you please help? What were the other choices? I'm also leaving my WhatsApp number. In case we miss something here, please add to that. Okay, Ministry of Environment and Climate Change, that is Forest, Environment and Climate Change. Okay, great. Good. Dr. Karthik, Dr. Neha, Dr. Moses. Okay, let's move to the next question then. Mascot we have seen at least 3 times in the mission classes, ENDs, revision sessions, marathon session. So everyone has marked this correctly that this is definitely SAPNA, National Leprosy Eradication Program. Was name SAPNA mentioned in the question? Was name SAPNA mentioned in the question? Or they ask name in the choices also, friends? National Leprosy Eradication Program. She herself, as we discussed in the last session, a cured case, now healthy, and she is to spread awareness. Okay, TB was there in the choice. Okay, great. And what else was in the choice? If you remember, HIV, malaria, anything? The National Health Program related to? I'll complete the questions later and share with you. They have asked what exactly the picture is telling them. Okay, cured case, now healthy, and used for spreading awareness that it is a curable disease and there is no stigma attached to leprosy. Okay, so they have asked the National Health Program name in the choice, or what exactly the image is telling them. Okay, one program was HIV, good. What was the other one? Okay, vector-borne, great. Right, so let us move forward quickly. Tell me, was it only the identification, or what was exactly Sapna doing in leprosy? Dr. Vikrant, Sapna was mentioned in question or choices. This is the thing that I'm unable to get from the students. Name of the National Health Program. Okay, this one. Okay. And one was, we are saying mental health. Okay, let's do it. Okay, let's go further. There is a question on history of tuberculosis. I think Dr. Devyani has covered LJ medium. Can you tell me the other choices which were available to see whether it was a PSM question or a micro question? Okay, Sapna was mentioned in the question. I'll make note of that. Only program curable was mentioned. Okay, good. Curable. Okay, history of tuberculosis, culture medium. Okay, particle size also I'll write down. So that makes it question number 26. This was 0.5 to 3 micron. Okay, another was Loeffler. Okay. Okay, I'll come to all these questions which you are saying secondary attack rate question. There's a question on case fatality rate. Can you tell me case fatality rate? What was the exact question? So particle size was for pneumoconiosis. Good. If this was not given as we discussed in the class, less than 5 will also become correct. Yes. Okay, good, Dr. Tokyo, Dr. Vikrant. Case fatality rate, can you tell me the exact question? Did they ask the formula, calculation, or did they ask is it a rate ratio proportion or case fatality rate of any particular disease they asked? Case fatality rate of, okay, they mentioned there are 12 deaths. What were the number of cases? Anyone remember? Because CFR is fatality, that is deaths upon cases into 100. So were the total number of cases? How many? 60. If it is 60, then it becomes 20%. Okay, Dr. Kashif Siddiqui has confirmed that. So case fatality rate is 20%. I'll presume other choices were 10, 30 and 50 maybe. Okay, Dr. Mohit has made it correct. 60 में से 12 मर गए. Out of 60, 12 have died. So 1/5 or 20% is the case fatality rate. Wonderful, Dr. Mohit. Okay, in a normal distribution, mean value was given. Standard deviation is 1.5. Can you tell me the mean value which was there? And then we were asked to calculate the range of two standard deviation. Formula is mean plus minus 2. Standard deviation covers 95% of values. So can you tell me what was the mean value in which standard deviation was 1.5? Mean value in which the standard deviation was 1.5. Can you tell me, friends? Quickly, I'm looking at the chat box. Tell me, friends, quickly. That I will come to. That I will come to. Okay, 82, wonderful. So we can say 82 plus minus 2 into 1.5, 82 plus minus 3. So that will make it 82 plus minus 3. So that will make it 79 to 85 as the answer. I presume other choices were based on 1 standard deviation calculation and 3 standard deviation calculation, right? So 79 to 85. If they're asking 2 standard deviations, Out of 95, if they're asking one side, then 79 to 82 or 82 to 85 will also become correct. Thank you, Dr. Anjali, for confirming the question. What was the question on secondary attack rate? It always comes on measles. We know the formula. Secondary attack rate is number of secondary cases upon susceptibles in close contact into 100. Okay, here they are directly asked 95%. So this will become 79 to 85. Okay, so in measles, can you tell me, friends, if you remember the values, out of 100 students they must have given in a class, they must have told there is a case of measles, then how many were susceptible, how many were infected? Can you help me with this particular? Let's quickly go through this question. Okay, you are saying 60% was one option. Thank you, Dr. Jayashri Krishna. But anyone remembers, okay, let us say there are 100 students in a class. Out of them, let us say 80 were susceptible. I'm sure they must have asked this only. 80 susceptible, right? Yes or no? Okay, 12 affected. 80% were immunized. That's even better. 80% were immunized. 75 campers. 80% were immunized. Okay. Okay, friends, let's then move forward. What I will do is, I'm telling you the formula. Out of the total students, exclude the primary case. Rest will become susceptibles only if they have not been immunized. So out of 75, if 80% were immunized, 80% of 75, that will be immunized. So they will not be susceptible. Subtract them. So roughly, let's say 60. 15 are in the denominator. Out of them, how many become secondary cases? Out of them become secondary cases. Then that will be the secondary attack rate. Right? So I'll share detailed calculation later, but you are right if you have calculated it this way. So that may actually come 12 by 15 according to. Okay, there was a question. Was there a question on ASHA worker today? Because one student is saying yes, another was saying no. So please help me clarify. Please clarify, friends. ASHA worker population norm was there. Yes, Dr. Jay Maheshwari, depending on the choices. Okay, then Dr. Saif Ali Khan, if you say there were total 90, out of 90, 75 were immunized, one became primary case. So 15 were left. Out of 15, one is primary case. So he cannot become a secondary case. So total 14 were susceptible, 12 became secondary cases. This will become the answer. Okay, urban area. Okay, urban area we have discussed. In urban area, ASHA worker has been replaced by USHA worker. So that will be, we have discussed many times in our classes, 1000 to 2500 population. Are all the four choices correct that I have mentioned on the screen? If all the four choices are correct, please have a look. So ASHA worker meant for rural area. When urban area was launched, it was replaced with ASHA worker is not about urban population, but USHA worker when it came for 1000 to 2500. So I'm sure this must have been given in the choices. Kindly confirm 1000 to 2500. Yes, it was given urban. Okay, fine. I told you accredited social health activist. Sister in urban area is urban social health activist, right? So the name has been changed, right? Urban ASHA, you can say. Very right. Okay, there is a question on this test. Kindly confirm the values. A total of 2000 patients, 200 were positive diagnosed. ELISA 260 positive, only 130 had the disease. What is the specificity of the test? So friends, what is the best thing is quickly make a table of screening test like this. Now we know total population is 2000 and 200 are having the disease. So this is 200 having the disease, not having the disease are 1800. If number is this, then ELISA positive, negative. Here we know HIV positive, negative. ELISA 260 came positive. Out of 260, only 130 had disease. So 130 were without disease. Now you can calculate C will become 70 and this will become 1670. Right? Okay. Now you have to calculate specificity. So D upon B plus D into 100. So this is okay. What were the choices? 35, 55, 96. Okay. So now we can calculate 1670 upon 1800 into 100. So this will become your answer, friends, right? So that we can calculate. So more than 90%, whichever the choice was, will become the correct answer. Will become the correct answer. Right, friends? Okay. Okay, let's move further. Which vaccine is contraindicated in pregnancy? We have discussed multiple times. Immunocompromised state, mother is at risk. Live vaccines are contraindicated. So varicella is contraindicated. It is a live attenuated vaccine. I'm sure 100% of you have attempted this correctly. Let's move to the next question. Okay, 86 here also was in the choices. I'll add that. Okay. Identify A and B in the image. Was it given like this? Exactly the same image. Look at the image. Was it the same image of larva? Right? So A is resting parallel to water surface. B is at an angle. So A has to be anopheles, B is culex. This is correct, friends. I'm sure you have marked this. A has no siphon tube, anopheles has no siphon tube. Right? Okay. So till now, all questions you have marked correctly. I'm sure. Okay, let's move further. Students were saying there were 2 questions on behavior change communication. So please share the questions with me. Did they ask the steps? Pre-contemplative stage, contemplative stage was a question related to that. Did they give you a diagram of behavior change communication cycle? Did they ask you about the sequence of steps in behavior change communication? Yes, I'll come to that question, Dr. Saif. I've kept it in the today's presentation. So this is my WhatsApp number. So any question I'm unable to construct because we have other teachers lined up. So I'm just going it through rapid. Okay. National Deworming Day. I told you if they ask you a single answer, it is on 10th of February every year. Can you help me complete the other choices? Second round is on 10th of August. If they ask you every month, it is 10th date on every month. 10th date. Okay. Okay, there was one question on work sampling. Good. That also I looked at. Sequence of steps in behavior change communication. Okay, I'll look at that. Okay, let's go through these questions. What you're writing in the chat box, I'm coming with those questions. Okay, 10th March and 10th August. Okay, if they give you choice 10th February and 10th August, was there a diagram or image in this question of National Deworming Day? Was there a diagram in this National Deworming Day where 10th February and 10th August both were given in this? Then you will definitely. Okay, hand wash sequence. Okay, that we will cover. Was there any diagram in National Deworming Day question? No. Okay, no diagram. I'll write that. Okay, it was a simple question. So 1st Feb and 1st August was another choice. Okay, great. Great. Thank you, friends. Let's move further. Identify the deficiency image shown. Can you confirm? Was the image asked 1, which we have seen in all our classes, or image 2 or some other image? Was the image given first or the image second or any other? Sapna, we have discussed National Appreciation Eradication Program. Can you please confirm image was 1 or 2? Quickly write in the chat box. All of us know we are talking of acrodermatitis enteropathica. That is zinc deficiency. Okay, some other image. That was an image of a child. Can you help me build other choices also? Okay, perineal image. Okay, good. Then I think this question can go into dermatology maybe. But can you help me complete the choices? Okay, perianal image of a child downside. Okay, wonderful. Can you tell me the other choices? Other choices besides zinc deficiency, which they asked. Okay, image I'll change. Image I'll change. Image I'll change. Besides zinc, Dr. Tokyo. Okay, copper. Okay, there was like a diaper rash. Okay, good. Vitamin A. Okay, vitamin C. Okay, this we have discussed in PSM. So I'll look at the image and definitely you have marked correctly. I'm 100% sure. Zinc deficiency. Formula of sensitivity was asked in the paper. Formula of sensitivity. Were the choices given as true positive, true negative, or A upon A plus C, A upon A plus B? Can you mark the answer, friends? Can you quickly mark the answer? Okay, then that question will go into dermatology. Formula of sensitivity was asked. No, there was no question on formula of sensitivity. So should I delete this question? Okay, delete this question. Okay, let's move further. Case control study, there was a question. There was a question on case control study, but students are not able to tell me what was the question. I'm sure they may have asked you the two groups. This is one possibility. They may have given you a case control study design and asked which two groups should be used. Disaster management, we have discussed. Ministry of Home Affairs. Specificity numerical, we have discussed. Okay, there was no question on case control. They were on cohort. Let's move further. In a study based in Delhi, doctors followed 100 people who did exercise for a year and later they checked all who had developed coronary heart disease. So this is going in a forward direction. It is a cohort study. Students told me cohort was what not mentioned. All of us have discussed. Cohort is mainly a prospective, forward-looking cause to effect study. So this was the exact question, friends. This was the exact question. Okay, there was one question on. Okay, that I will come. That question is a repeat question, Dr. Isra Khan. I'll come to that later. I've written that. Okay, one question was on family cycle. So I think we have crossed already 30 questions. So one question on family cycle. Okay, great. Urban area Asha worker is Usha, 1 per 1000 to 2500. Fractionated IPV dose schedule was asked. Could you please confirm? The choices were given like this because all of us know the answer. Its dose 1 is given at 6 weeks. 10th week dose is not given. 14th week second dose and third dose is given at 9 months of age. Could you please confirm fractionated IPV immunization schedule was asked in the National Immunization Schedule of India? Right? So this was asked. Okay. In the cohort study, you're saying 2012 to 2022. Okay. That makes it more specific. And yes, it was based in Delhi. Okay. So this was the question. Fractionated IPV, I'm sure 100% has marked correctly. Okay. There was one question you are saying on tourist or guide. What was the question? Could you please tell me? Tourist guide question I'm hearing for the first time today in today's paper. Okay, same question. Okay, then let us move further. Okay, there was one question on reason of IPV over OPV. That was a second question, friends. Second question, if its reason was asked, all of us know the reason. Now we are close to eradication of polio from this planet. India is already polio-free status. So IPV is preferred because IPV is not associated with vaccine-associated paralytic polio, which is the major problem associated. Okay, when the tourist guide type question came, were the choices given like herd, mob, crowd, something like this? Band. Okay. Okay, good. We'll go through this question. When you look at these type of questions, mob is generally very emotional and angry. Crowd is generally having no leader. So herd is having a leader, band is having a leader, right? So herd appears to be more correct because they follow the instructions of the guide. But I'll check the exact language. Thank you so much for completing the question. Okay, so could you please confirm? IPV, there were two questions. One was the scheduling One was the use of IPV over OPV. Reason was asked. Can you please confirm two different questions were there from fractionated IPV schedule? Okay. 2002 family started. Now families expanding and family cycle was asked. So we have discussed 6 stages. I'm sure you have marked the correct answer. Okay, two questions. Very nice. There was a question on management of HIV positive patient with dog bite. Management of rabies was asked. So all of us know vaccine plus immunoglobulin plus wound management. Can you tell me what were the other choices? See, rabies case, you have to give vaccine, you have to give immunoglobulin, HIV positive patient, you have to give. Otherwise also. And there is multiple dog bites. One student mentioned, okay, there were multiple dog bites. Poster wala question kaun sa tha? Every students are saying there was a poster wala question. Could you please confirm? I'll reconstruct the question. Punctured wound, okay. Punctured wound, okay. Definitely it is going transdermal. So if it is going into group 3, category 3 bites, then definitely it will penetrating wound, category 3 bite if it is going. Yes, you have to give immunoglobulin, no doubt. Okay, there was a one question on child with measles and he was having vitamin A deficiency, bite or spot. What was the question asked, friend? What was the question asked? If a child is having measles and vitamin A deficiency occurs. Okay, one was vaccine plus wound, but correct answer is immunoglobulin also has to be given. Multiple punctured wound, okay, that is correct, okay. No, vaccine, Dr. Shubham, we have to give because rabies is a killed vaccine. Immunocompromised state don't make a difference. Rabies is a 100% fatal disease. We have to give the vaccine. Okay, public poster question they were asking that is it for individual basis, mass basis? Can you tell me what were the other choices? What were the other choices? Can you tell me? Okay, इसमें ये पूछना था. Okay, what will you do? So one choice was isolation with, I'm sorry, discussing multiple questions together because we have to complete red spurts with white dot spots. Yes, डेनिश वाले पे मैं भी आता हूँ, वो ब्लाइंडनेस ही होगा अगर आपके पास डेनिडा पूछा था तो. Sapna question, National Leprosy Eradication Program. She indicates that leprosy is a curable disease. She herself has been cured with leprosy. Okay, I'm coming to that question. Can you tell me what was the exact question from network analysis? Students were saying that there was a diagram. Was it related to some machinery installation? Okay. इसमें one of the choice was aspirin also. Okay, there was a calculation of sensitivity नहीं था, वो specificity था. Students have told me. Okay, exact image from PSM book. Okay, so Park books, I'll check the image. Critical path was asked. Longest path according to duration, not the number of activities. And at the bifurcation of option and at end, there was machinery installation. Okay. But मुझे ना, I have not understood what exactly were the choices. Did they ask you to identify the critical path? They mentioned it as A, B, or C. Okay, factory machine installation and worker training related to that. Okay. Were we asked to identify the critical path or the name of the diagram? Only name were given in the choices. Could you please confirm? worker or manpower training. Okay. Okay, I'm coming to your question, Doctor, is asked very soon. I have written that. Okay. Machinery installation was with 12 months, all other 3 months. Then machinery installation will become the critical path. Machinery installation will become the critical path. Asha worker we have discussed. Urban areas is Usha worker 1 per 1000 to 2500. A person's father had colonic cancer. He was having bloody stool. He just came for the checkup before he had not undergone any screening. He was recommended to undergo colonoscopy. Screening is which level of prevention? If it is exactly this question, screening is always for detection. So secondary level of prevention we have discussed in the classes. Screening as well as diagnosis, all of them are secondary level of prevention, right? Secondary level of prevention. So I hope every one of you has marked this correct. Okay, wonderful, Dr. Komal. Let's move forward. This was the diagram. Could you please confirm? Primary, secondary, tertiary. This was the diagram. Then they asked a question, correct arrangement about levels of healthcare. So all of us have discussed this with almost same diagram, and in levels I've made a table also, if you remember, that primary level is subcenter and PHC, secondary level is CHC, tertiary level is medical colleges and hospitals. Okay, exact same diagram was there. So I am believing Dr. Kiran, Dr. Kashif Siddiqui, you have marked 100% correct answer. PSM has been quite easy so far, if you have seen, right? So we have covered 21 questions, almost, no, sorry, not 21, 2 you rejected, 19 questions, all were correct. All I'm sure you have attempted correct, right? Okay. Okay. We move further. Danida, Danish International. So all of us know Danida is Danish International Development Agency. So we have discussed in our international health topic many times. SIDA is supporting tuberculosis. Danida is supporting. Danida is supporting. Can you please confirm? Danida is supporting. Yes, blindness control program of India. Third agency I told you, UNFPA is supporting RCH family program. Right? Okay. Okay, this was the question we have discussed. So this is a repeat question. I'll just use it to correct the language. There was a question on ICDS. Could you please confirm, friends, what was the exact question on ICDS? Because no student was able to tell me the choices for this question. Could you please confirm ICDS? I can tell you what they may have asked. They may have asked ministry. They may have asked Anganwadi center is the heart of ICDS. They may have asked, okay, there was one choice on vector-borne disease here. Okay. ICDS, what was the question? Can anyone please tell me? Okay. Okay. ICDS, friends. What was the exact question in ICDS? Could anyone tell me? There was no question, so should I reject? IDSP tha. Okay, that is even better. IDSP, they may have asked you active surveillance, sentinel surveillance, periodic surveillance diseases, or they can ask you P form, S form, L form. So what was the exact question in integrated disease surveillance program? Could you please tell me? IDSP, Dr. Vansh Rathod is saying there was a question. Sentinel surveillance. Okay. Did they ask the disease? Sentinel surveillance covers 5 diseases. HIV, hepatitis B, hepatitis C, air quality, water quality. In the revision session also we have discussed this. So did they ask the disease? Or if they ask the meaning of sentinel surveillance, it is to identify hidden or missing cases. Or if they asked forms, there are three forms: S form, P form, L form. S form is by health worker. P form is generally asked in the paper by the doctor or the medical officer. And L form is by the lab staff. These are sentinel. Other common diseases are in regular surveillance. Regular surveillance. So regular surveillance में malaria, dengue, TB, respiratory infections like URI, waterborne diseases, typhoid, cholera, leptospirosis, rabies, viral hemorrhagic fevers, yellow fever, plague. All of them are in regular surveillance. Option A was HIV and hepatitis B. Good. So HIV and hepatitis B both are included in sentinel surveillance. This will become the answer if they are asking the diseases. Was there any question on forms S, P form and L form in sentinel surveillance? HIV is not there. Haemophilus influenza B is not there. Yes, this is correct. HIV, I've told you 5 diseases are covered in IDSP program of India. So form, S form, P form, L form was not asked. If you confirm, I will delete it from the screen. S form, P form, L form was not asked, right, friends? Yes, Home Ministry for Disaster Management. Okay, it was not asked, so I'm removing. Good, wonderful. So this question is also correct for you. Good to see. Then there was a question on adoption of an idea or a practice. Right? These were the choices. Did they ask you to arrange in correct chronological sequence? Did they ask you to arrange them in correct chronological sequence? Just now a student has dropped this message that there was a question on this. Okay, food adulteration. Can you tell me the question meanwhile? Okay, this question was there. Adoption of idea. So we have discussed the mnemonic also. Anyone remembers the mnemonic we discussed in the sessions? What was the mnemonic? Anyone remembers the mnemonic? Okay, wonderful. Arrangement was asked. So that was a repeat question, friends. It was not difficult. ITA is the mnemonic, right? So these are the 5. They asked you to arrange the steps in sequence, right? So awareness, interest, evaluation, trial, adoption. Okay, good. Dr. Humaira has remembered the mnemonic correctly, ITA. Can you tell me what was the question in food adulteration? What was the question in food adulteration? Which disease is not a food adulteration? So which choices were given? We know the food adulteration diseases: letharism, epidemic dropsy, endemic ascites, ergotism, and aflatoxicosis. Fluorosis. Okay. So remember, I always quote this question in the class. Is fluorosis a food adulteration disease? You mentioned no because it is a natural phenomena. So examiner was listening to our class, it seems. So for the first time, he has asked the same question, fluorosis. Letharism, dropsy. Letharism is, no doubt. Dropsy is, right. Okay, wonderful. So fluorosis becomes the answer. Wonderful. So everyone has marked questions correctly. Now, friends, quickly, let's wrap up the session. Can you tell me if there was any question on any other vaccine, any contraceptive? Okay, there was one question on vasectomy. How much we advise under the RCS program should be abstinence? It is for 3 months. Can you tell me the other choices for vasectomy? Can you tell me the other choices for vasectomy? Okay, one was aflatoxicosis here. 5 minutes, we are wrapping up this session, friends. Okay, vasectomy 3 months question was there. What were the other choices? I believe they must be 1 week, 3 week, 1 month, 3 months. Can you tell me the choices, Dr. Neha Sunil, please? Okay, 3 months is the answer. 4 months, okay. 7 days, okay. There was one question on OCP protective for. Protective means how long duration was asked? Okay, 6 months was another choice, is good. Okay, there was a question I missed in between. Myrena use, there was a question. Okay, that will go into obs gynae. Myrena, we don't use the name in India. Shakir's tape, can you tell me what was the question on Shakir's tape? What was the question on Shakir's tape? Okay, OCP is not protective for. Okay, see, we generally know combined oral contraceptive pills are used or protective against benign ovarian disease, malignant ovarian disease, benign breast disease, iron deficiency, anemia. They have a protective role, right? I believe these sort of choices must be there. Least protective, not protective, that is fine. Okay, this was one question. Anything else? Okay, 1 month was the choice here. Okay, severe acute malnutrition. If we go by WHO guidelines, then we have discussed in the class, it is less than 11.5 centimeters for severe malnutrition. IPV preferred generally because of no vaccine associated paralytic polio, but depends on the other choices also. Okay, 10.5 centimeter on Shakir's tape. This was the question. Okay. Here there was a carcinoma endometrium, carcinoma breast in the choices, colonic ovarian. Okay. Friends, any question came from sustainable development goals? Any question came from health planning committees? Any question came from any other national health program? Any question? So what I'm doing is I'm leaving my number with you. Please drop a WhatsApp. You can record an audio message also if you don't want to type. I will try to complete all the questions tonight and share with all the answers as early as possible. Right? Mid upper arm circumference. Okay. Chronic malnutrition. What was the question, friends, on chronic malnutrition? Okay, paralytic polio was in the choice. Good. Pneumoconiosis particle size 0.5 to 3 micron, not in the choice, less than 5 micron. 110, then it will become severe acute, right? Okay, friends, let's wrap up the session. I think Dr. Amrit sir is waiting. Thank you, Dr. Amrit sir, for waiting so patiently. Thank you so much, students, for helping me out. I'll try to reconstruct the questions and share today itself or tomorrow morning. Thank you so much. Thank you, Amrit sir. You may take over.
Thank you, sir. So, hope you guys are happy with the surgery questions. They were not that difficult, and quite a few were repeat questions. So I will quickly go through them, and in some questions I don't have the options, so don't worry about the options. I think they were quite straightforward, like you can manage without the options also. There were about 15-20 questions which I have gotten so far in surgery. Some you may have overlap in forensic, in radiology. So let's start. This was the repeat question. They had given an X-ray of a free gas under the diaphragm. This has come in the previous paper also. So it was a hollow viscous perforation, or some students said the option was perforative peritonitis. Doesn't matter. It was a free air under diaphragm image, right? So that was a straightforward question. Okay. This actually is not very ambiguous, but I will tell you the logic behind this question. They had explained the scenario of achalasia. You know, always say young patient with a dysphagia, initially more to liquids. So they had given a scenario of achalasia, and they had asked what will be seen on barium swallow. Rat tail, smooth filling defect, irregular filling defect, or corkscrew esophagus. Now, irregular filling defect will be seen in cancer. Corkscrew esophagus will be seen in diffuse esophageal spasm. Most students are saying smooth filling defect. That is not the answer. Answer is going to be rat tail. Okay, rat tail or bird beak are both okay. Bird beak was not there in the option. Rat tail was there. That is still the answer. Smooth filling defect will be seen in benign tumors. Okay, smooth filling defect will be seen in benign tumors of the esophagus, like a leiomyoma. Right? So that was the next question. This was another normal expected question. We have done it many times. Patient presents with absolute constipation, means he is having obstruction. X-ray was shown, and the X-ray was like that typical coffee bean appearance. So coffee bean appearance is going to be sigmoid volvulus. Other options I don't think you need, but they were also in context of other types of intestinal obstruction only. So this was straightforward, sigmoid volvulus. Again, a repeat question. This has come 3-4 times. They gave the classical history where patient had alcohol and then he had epigastric pain radiating to back. I don't know if they had given any more pictures, any more findings, but it was something of this type only. So this is going to be acute pancreatitis. Not this pic, but it was a similar pic. It was coffee bean only, and patient had absolute constipation. So coffee bean is going to be sigmoid volvulus. Paralytic ileus, they won't ask you unless they give history of a previous surgery. Okay, if they ask test, that will be amylase lipase, no problem. They didn't ask diagnosis, they had asked the test, it will be lipase amylase, fine. But normal question, right? Means it's not something where you had to think too much. Right? It was amylase lipase. They were talking about diagnosing pancreatitis. Correct? Okay. this is again kind of overlapping between surgery and anatomy, and some structure was marked in the Callat's triangle. Now there are two answers here. Some students are saying it was this big structure. Some were saying it is a smaller structure. It was either the cystic artery or it was the right hepatic artery. It was one of them. Now you have to see, is it entering the gallbladder? If it is entering the gallbladder, it is cystic artery. But most students were saying, sir, cystic artery nahi thi. It was a much bigger artery. So the one which is going into the liver is going to be right hepatic. So this answer is based on what was actually asked. Either it will be right hepatic or cystic artery. If it is going in the gallbladder, it is going to be the cystic artery. If it was going into the liver, it was a right hepatic artery. Correct? Okay. This again, they have asked many times. That is, identify the device. It was Very's needle. No doubt about this, I hope. No doubt about it. So this was Very's needle. Again, this question, many times it has come similar, and one of the typical things. Patient after head trauma, he is opening eyes to verbal commands, which means his verbal eye opening is going to be eye opening 3. Localizing pain means motor response is 5. He is confused. Confused means verbal response is 4. So the GCS calculation was asked, and this was 12. Okay, 3 plus 4 plus 5. Right? Easy question. Okay, so people told me the answer also directly. Then I had to make it retrograde. All right. This very famous question, a lot of people gave this same. A male bartender following a fight had breathlessness, and on evaluation, breath sounds were absent, and typically he had a tracheal deviation. So this is going to be a pneumothorax. I don't know what the other options were. Yeah, but no. Options 5, 10, 12, 15, that becomes even easier. Then you don't even need to calculate if it's 5, 10, 12, 15. That is even easier, because if you look at the scenario, it is not 50 and it can't be 5. All right. You can let me know the options in the chat. That is, what were the other options? But as I got the recall, it was sounding like a pneumothorax. Okay, you can correct me if there was anything else. Okay, so there was pneumothorax, collapsed lung, and consolidation. Wonderful. So pneumothorax, they ask every time. So I don't think you made a mistake in it. It is one of the pet questions, GCS. So I believe surgery was very manageable, no? Not that hard. Again, they had given the image. I don't know if it was a child or an adult. Okay, I don't know if it was a child or an adult, but they are asked calculate the bone surface area. Correct. And these were the choices, and students conspicuously told me that, sir, there was no choice where it was 30 to 40. So these were the choices that they had given. And burns was basically involving the chest, little bit of the abdomen, little bit of the axilla, if I'm not mistaken. So best from the way it has been described, it is going to be if it's a child, it should be 20 to 30%. Realistically, from the description that I got from the students, it's not going to be 40 to 50% if it's only on the front side, because front is 50, back is 50. So it was not the entire front half of the body. So it can't be 40 to 50%. Leg thoda, little bit of leg, mainly some part of chest. It was a similar image, if I'm not mistaken. And face was not much involved. So in my opinion, answer should be 20 to 30%. If the full leg is affected, it's a different thing. But it won't be on the back side of the leg. Now you see common sense. Front half of the body is 50%, no? So it was definitely not the entire first half, means not full face, chest, abdomen, upper limb. ऐसा तो नहीं था. So 20 to 30% sounds more logical. Okay. Here I don't know the other options, but I know the correct answer. Patient presented, they had given an image of varicose veins involving the entire from the foot, calf till the thigh. And they had asked which of these is the correct statement. Okay, which of these was the correct statement? Please correct me if this was the question. And what the correct option was, laser ablation can be used. Okay, laser ablation can be used. That becomes the answer. All right, I don't know what the other options were, but laser ablation can be used for treatment. You know, endovenous laser ablation is one of the treatment. Okay. Then students told me they had given, yeah, so C6 will not be, C6 is active ulcer, so it won't be C6. So obviously that is incorrect. The stage is C6. It is C6 as per CEAP is not going to be correct. Right? Fasciotomy will not be done again. Trendelenburg is contraindicated was in the options. No, Trendelenburg is not contraindicated. You can do Trendelenburg surgery. So that was, I feel, if laser ablation can be done, is definitely correct. No doubt about it. EVLA is the treatment. Right. Now, they had given a photo of an ulcer and they had marked the different areas. They had marked it like this. A is base, B is floor, C is edge, D is margin, where one of it was incorrectly marked. Okay, one labeling was incorrect, if I'm not mistaken. So these are the different parts of the ulcer. Whether floor is what you can see, base is what is below the floor, this is the edge, and margin is the border. And they had asked the correct marking or the incorrect marking. They had asked the labeling, that which is correctly labeled. Am I right? Identify the correct label. So this what I've shown you is the correct labeling. Huh? Correct pucha tha, okay. Means they had put other things in these areas. Okay. Wonderful. So easy question. This question I'm not very sure of. Okay, I'm not very sure of that a woman few months after delivering a baby has a bloody discharge from the nipple. Was this question correct? And what is the diagnosis? Okay, edge is right, fine. You have all the markings in that image, so you know what is going to be correct. I've told you all the markings. What is the diagnosis? If this is the correct question, then the answer is going to be ductal papilloma. Papilloma presents with a bloody discharge in young women. Okay, papilloma. Ectasia will normally present with greenish discharge and it will be seen in smokers, and galactosale will present with milk discharge. Redness nahi hona chahiye. I mean, I don't know what option will go with redness. If there is redness and tenderness, then it should be mastitis or breast abscess, but I don't think any of those options were there. Papilloma, there should not be any tenderness. I know it had many points. The recall could not be given properly. But if it's tender and there is redness, then there should be no bloody discharge unless it is a breast abscess or it is an inflammatory breast cancer, which will not be seen in a young woman. Mondos disease only presents with a dilated vein, tender vein. So tender vein will also not lead with bloody discharge. Okay, fine. Hot red. Okay, there were two different questions. Fine. So let me get the two different questions. If it was just bloody nipple discharge, then it is going to be papilloma. Mondos disease will not present with hot, tender, red breast. No, it will only present with a dilated vein. That's it. Okay. Then this question we have discussed in class many times. Okay. History of injury to perineum. Patient has urge to urinate but is unable to urinate. Blood is seen at meatus. And what is the site of the injury? This was bulbar urethral rupture. We have discussed this many times in class. Okay, bulbar urethral rupture. So no problem in this question, I hope. So I wrote posterior. Posterior and membranous are the same. Okay, Acha, they are given the word astride injury. Wonderful. That is if they give that word, life becomes very easy. Fall astride injury. Wonderful. That straight away bulbar urethral rupture. No doubt in this. This again, maybe it will be discussed in radiology also. Membranous and posterior are the same. That they had given some image. Some students said it looked like a KUB and some said it looked like an IVU and they were not sure what it was. But what I feel, what they would have put would be an image like this, where there would have been a catheter going into the ureter and the entire ureter and the pelvis would have been seen. if I'm not mistaken. So I feel it would be a retrograde pyelogram. If you are seeing the contrast, if there was an option called retrograde pyelogram, that would be the answer. It is usually one side only. If it is a double J stent, then you only see the stent. That is the PYQ. If only stent was there, ureteric stent and double J stent are the same. Ureteric stent is double J stent only. They are the same. So if unilateral tube and unilateral kidney, by kidney I mean the renal pelvis, if it is visible, it is a retrograde pyelogram. It is not a DJ stent. In DJ stent, you only see the stent. You won't see it. Student clearly told me that you can see the renal pelvis. It looked like a claw, if I'm not mistaken, right? Nephrogram was one option and catheter was not entered. It's only one kidney. Usually it can be done in only one kidney. That's right. So that would be a better answer, a retrograde pyelogram, if this option was there, where you see only one kidney. Okay. Kidney नहीं दिखती है, सिर्फ उसका ये दिखता है. You can only see the renal pelvis because the contrast is going from below to up. Right? Okay, fine. This is another PYQ. Prostate cancer will spread to lumbar vertebra via. This is going to be Bateson's venous plexus. Okay, so this is Bateson's venous plexus. So normal question. And some of you are giving me a question on scrotal tumor with hydrocele with lymph node involvement. It will be biopsy. If it's a scrotal tumor, it's a biopsy. Testicular tumor, don't do biopsy. If it's testicular tumor, you do tumor markers and you do high inguinal orchidectomy. So different for scrotal tumor, different for testicular tumor. Okay? So yeah, local spread is nahi hoga isme. Direct or local, it is going to be venous spread. Bateson's plexus of vein. This is a PYQ. This has come before. No, not lymphatic. Lymphatic will give you lymph nodes to the abdomen. Okay? So that is my surgery recall. I hope you could manage it. I will get some more questions which I will upload on the app. And now I will hand it over to Dr. Jhanvi for her anesthesia questions. Thank you, guys.
Hello, everyone, and welcome to the anesthesia recall. Now, these were really simple questions. You didn't even need to look at the rest of the options or rule out anything. Some of the things were like absolutely easy to answer. The first question was on diagnosing malignant hyperthermia. So there was a case scenario that was given that a patient is undergoing a hernia surgery and the patient has been given succinylcholine. And after that, the patient is having muscle rigidity, increase in temperature, increase in the EtCO2 levels. And what is the treatment for the same? So classic question, you are giving succinylcholine. We know that when you get muscle rigidity and hyperthermia after succinylcholine, that means it's malignant hyperthermia. And the treatment of choice for malignant hyperthermia is dantrolene sodium. So that was the answer. Then the second thing, yesterday I told you that from the CPR topic, from ACLS guidelines, from AHA guidelines, they will be asking you one question, and that is exactly what was asked. So the question was this: what is the sixth link added to the chain of survival as per AHA or American Heart Association? So this is the chain of survival, like I had taught you all. Salman Khan has that bracelet chain that he wears, and this bracelet chain looks just like that. It has one steel link that when you join together, it forms a chain. Okay, so the newest link that has been added as per 2020 guidelines is this, that is recovery. Recovery is the newest link that has been added. Some people say that they had given pictures. So if they had given pictures of this, then this is one man holding the other. This recovery basically means that you are giving your patient post-cardiac arrest care, not just immediate, but also long term. Okay, so this one that is there, it is immediate taking care of the patient, but long term care like psychological evaluation of the patient, cardiac rehabilitation, helping the patient cope over the fact that he had a heart attack. So that is the newly added link to the chain of survival. Okay, and question number 3. Now, it was not when is aspirin to be stopped prior to surgery. So I just got this question exactly from someone, and they had said that there is a patient who is posted for surgery, and which of these drugs need to be modified prior to surgery. Okay. So when we talk about drug modification, the first option over there was that aspirin needs to be stopped. Now remember, aspirin in a prophylactic dose of 75 mg can be continued. So no, that is not the correct option. Second was to increase the dose of aspirin as it acts as a painkiller. That is absolutely not true. We don't increase the dose of aspirin prior to surgery. Third is that metoprolol should be stopped. Now, metoprolol is nothing but a beta blocker. I have discussed this with you all, that all antihypertensives except ACE inhibitors and ARBs need to be continued on the day of surgery. So you don't need to stop metoprolol. No, not at all. And option number D was that enalapril needs to be stopped. So that's absolutely correct. As I told you, enalapril, as I told you, ACE inhibitors and ARBs need to be stopped. So as a result of this, enalapril falling in that category needs to be stopped, and that was the correct option. Okay. Now, there was a question about intubation, but I'm not very sure. I didn't get this question very right. So it was something like a child was intubated and you could hear breath sounds only on one side. So if that was the case, if you are intubating a child and you can hear breath sounds only on one side, that means only one lung is getting ventilated. So you have done an endobronchial intubation. You have gone beyond the trachea into the bronchus. But then there was a whole other class of people who were saying that child was intubated and after 1 week, child was unable to breathe and some issues were happening. So I did not get this question completely. Yeah, so that was a weird question. So hopefully we'll be, if it is relevant to anesthesia, I will cover it in the main FMG recall videos. Beyond that, these 3 questions of anesthesia are very easy, very straightforward, and I hope that you all got it correct. Thank you so much.
Hi, I think I'm next. Thank you, Dr. Jhanvi. And let me just share what I have. Okay, so Obs and Gynae, as usual, a lot of questions come from Obs and Gynae. And I have around 26, 27 questions in total. So let's start. The first question, I think Obs and Gynae was easy for most of you. We've covered, I think, everything in the classes. The first question was endometrial hyperplasia without atypia. So without atypia, the treatment option is you're going to give her progesterone, and the progesterone of choice is by putting a LNG IUS, a levonorgestrel intrauterine system, that is Mirena. The next question, 2 questions from diagnosis of pregnancy, and I always start the class with this topic. This is the Chadwick's sign, blue vagina, which is the Chadwick sign, and this is bimanual palpation. This is Hagar's sign. So 2 easy questions. I'm sure all of you got them right. Then there was an laparoscopic image, and what most people are telling me is this was the exact image. I've just enlarged it for you so you can see, and here you can see the fallopian tubes are kissing each other. This is the kissing fallopian tube sign, and this is seen in genital tuberculosis. I don't know the other options, but this is very clear. And if this was the same question, this is the same picture. This is definitely genital TB, where the most common site of affliction is the fallopian tube, and it causes salpingitis. There are many signs. One of them is this. This is the kissing fallopian tube sign. Earlier sign of pregnancy on a transvaginal scan is, of course, the gestational sac. First, the gestational sac comes, then the yolk sac, then the fetal pole with cardiac activity. So this is, again, easy question. Vaccine not safe in pregnancy. I think the fourth option, if I'm not mistaken, was yellow fever, but I'm not sure. Just let me know. The option here, so live vaccines are contraindicated, we know. So varicella, that is chickenpox, is contraindicated. Remember, the inactivated flu vaccine is completely safe. Rabies is a killed vaccine. It's completely safe. It should be given. If the last choice was yellow fever, then yellow fever is the only live vaccine which can be given in pregnancy. So the answer here is varicella. Then there were 2 or 3 questions on PCOS. The first question was the image. So there are a lot of images from Obs and Gynae. I think half the questions had an image. This is the very clear-cut PCOS, no doubts in this at all. The ultrasound, very, very suggestive history of hirsutism given. Okay. Next question, a 25-year, okay, hydrosalpinx was the other option in this. Let me just add it here so I don't forget. Hydrosalpinx. This is not hydrosalpinx too, because hydrosalpinxes would be enlarged tubes. Then we have again a question on PCOS. What is the first line treatment? So the options were, I mean, the scenario was irregular periods, acne, excessive hair growth. So 2 out of 3 of Rotterdam. This is PCOS. The first line treatment, I've told you this time and again, always lifestyle. Before giving any drug, always counsel the patient that diet and exercise is the prime treatment in PCOS. Then there's an image on the placenta. There was an image on the placenta. Okay, please do keep adding the options which I'm missing out on and the question in its entirety. That will help us when we compile the questions later on. Okay, so placental image, this was fetal. This is the fetal side of the placenta because this is where the umbilical cord comes. The other side is the dirty looking side, the cotyledons. That is the maternal side. So this is the fetal side of the placenta. Okay, and what are the other options? If you could just add that, it would be very helpful. Okay, decidual side would also be the maternal side. Decidual side, decidual plate, basal side. Okay, all 3 mean the same thing, the maternal side. Okay. Then there's a question on complete mole. I do not know the clinical scenario, but what I got to know that the karyotype was given diploid and P57 KIP2, which is the immunohistochemistry marker, was negative. So this is a complete mole. Okay. So if there is anything else was given, the clinical scenario, was anything else mentioned, but this itself is very, very clear to answer. Anything else, do let me know. It was a long question. Okay, all right. But the main points were these 2, right? Diploid and P57 negative. Okay. Then there was a question on a patient who had a forceps delivery and then had pain in the perineum. On examination, the episiotomy stitch site had turned blue and there was a bulge also. Okay, one option was choriocarcinoma. 1 second. Okay, so this was a question. There was hypotension and tachycardia. What should we not do was asked, right? So what should we not do was asked, and the options were these. So this is basically a vulval hematoma. This is a picture of a vulval hematoma where immediately the patient should be resuscitated. Blood should be transfused. Of course, inform the senior and shift to the OT. We don't repair a vulval hematoma in the ward. Okay, on the labor room, because we have to see how deep it's gone and we have to obliterate the dead space. So this is best sutured in the operation theater. Repair in ward should not be done unless maybe a small hematoma, but this patient is in shock. So it has to be done in the OT. Okay, so where is this instrument contraindicated? So the picture, there's an image of a forceps. I don't know which forceps was asked, but irrespective of whichever forceps was asked, we all know that a forceps is never used when there is obstructed labor or cephalopelvic disproportion. Okay, TD was the 4th option. So this is contraindicated in obstructed labor. Cesarean section, we sometimes very commonly, in fact, if you've seen my cesareans, I very often use a forceps to deliver a mobile floating head. Breech, after coming ahead of breech, we use the Piper's forceps. Occipito-posterior, face to pubis, I think this was direct occipito-posterior. Again, we can easily use a forceps if there is a difficult delivery. Obstructed labor, we never use a forceps. Obstructed labor means cesarean section. Okay, which of the following cancer is not protective by oral contraceptive pills? And I keep telling you this, the CEO mnemonic. CEO is it protects against CEO, that is colorectal, endometrial, and ovarian. Remember, estrogen is bad for the breast. So it causes, it's a risk factor for breast cancer. Then I'm not sure if this was a question. Ovarian drilling or laparoscopic ovarian drilling was done. Was this a question? Was this a question? Let me know in the comment section. I'm not sure if this was a question. A little bit doubt. Okay, so this was not a question. No question. Okay, so no question on ovarian drilling. Okay, so the following is contraindicated in pregnancy. Very easy question. We all know that ACE inhibitors and angiotensin receptor blockers are absolutely contraindicated. They should not be given. So enalapril is the correct answer. Then there was a question on the most favorite topic of obs and gynae is shoulder dystocia. इस पे question आना ही आना होता है. What is the definition of shoulder dystocia? When there is a difference, when there's a delay in delivery of head to delivery of shoulders, and that is more than 60 seconds. That is the theoretical definition. The practical definition is if any maneuver is needed to deliver the shoulder, it doesn't come out easily. A maneuver which is required to deliver the shoulders, it becomes shoulder dystocia. So you have 60 seconds of the theoretical definition. A more practical definition is when you have to use maneuvers to deliver the shoulders. Then a very easy question. I'm not sure about the other options. Home-based UPT detects which hormone, but the beta subunit is what the home-based urine pregnancy test is going to determine. Just a second. Some problem with my internet, I think. Procedure, I wanted to know if there was anything else given in this except for this image, and what were the other options. Was it a scenario given that there is postpartum hemorrhage happening and this is an intrauterine balloon tamponade? The most common, we can do this with a Bakri tube, or we can do this with a condom catheter. So this is how an intrauterine balloon tamponade looks like. Endometrial ablation looks very, very similar. Okay, but I would need to know what the scenario was given. Was there any other scenario given in this, or just the image was asked? Just the image was asked, then it is more likely to be intrauterine balloon tamponade. Okay. Image on CTG. This was given. Anything else given? I'm not sure, but what I'm not sure if this was the image. What most students have told me ki ma'am early deceleration stay. Early deceleration means that the nadir, the bottommost point of the deceleration was corresponding to the peak of the contraction. Some students told me it was a normal CTG, but some were very sure it was early decelerations. It was a hand drawn image, I think. Na somebody ne haath se banaya tha. So I think it was early, or was it normal? D option is normal. No image. Okay. Okay. I am normal finding was one more option that I've put. Normal CTG tha? Acha, theek hai. Okay. So if anybody can send me the picture of what was drawn, that would be really good. You can just send it to me on my WhatsApp number, and then we'll see. Okay, which is an abnormal heart sound during pregnancy. Remember that soft systolic, S3, loud S1 are all normal. Any diastolic murmur is not normal. So always when we auscultate a patient who comes to us in pregnancy, we are always worried when we hear a diastolic murmur. That is a sign of an underlying heart disease. Okay, so normal aaya tha, theek hai. So diastolic murmur is the abnormal heart sound in pregnancy, which requires further evaluation. The correct characteristic feature in ectopic pregnancy. So there was a question given ki ultrasound, what will you see in imaging in an ectopic pregnancy? And I think this was the correct answer, but I need to know what was the fourth option, because I'm getting again a bit of mixed response here. And was it only ectopic, or was it ruptured ectopic pregnancy? because this fluid you will see in a ruptured ectopic pregnancy. So do let me know also in the comment section, what was the fourth option? Okay, it was just the image, nothing else. Okay, got that. Okay, so in this question, only ectopic was asked, so it was not a ruptured. Okay, and was the fourth option without fluid? Empty uterus with adnexal mass tha? Was this the fourth option? ओके सो इसमें और इसमें इसलिए डाउट था कि फ्लूइड अगर है पॉइंट्स टू रप्चर्ड ectopic but both are seen in a simple ectopic pregnancy. That's why I'm having this confusion. What was the fourth option? Bulged ovary was also an option. Okay, so I need more clarification on this bulged ovary. Okay, let me know. Okay, let me know separately. Add in the comment section. I'll have a look. A patient with a history of difficult labor and cesarean section presents with dribbling of urine through the vagina on the 7th day. So this is most likely what has happened is a vesicovaginal fistula has happened. This happens because of an obstructed labor. The head is jammed against the pelvis for a long time. That leads to bladder necrosis. And if you don't keep the catheter for a prolonged time, we usually keep the catheter for 2 to 3 weeks post a difficult cesarean. And many times, if it's not kept, it can end up leading to a vesicovaginal fistula. Okay. In cervical cancer, with radiotherapy, what is given? So with radiotherapy, what is given in cervical cancer? So we give cisplatin, right? Cisplatin, and this is a previous year question. They've just asked it in a different way. Cisplatin is platinum-based chemotherapy. So that is what is given in cervical cancer along with radiotherapy. Okay, there was another question on ureter is safe in which type of hysterectomy? Something like this was asked. So whenever we do a hysterectomy, one of the main problems or main worries we have is ureteric injury. Now, ureteric injury can be seen with all types of hysterectomies. The highest risk is with laparoscopy. Okay, this has the highest risk. Okay, and the least risk is with a vaginal hysterectomy. Vaginal hysterectomy is the safest when it comes to ureteric injury. Okay, there was only one option with adnexal mass, Sampada, thank you. So that would be the option for ectopic pregnancy. So ureter is safest in a vaginal hysterectomy. Open laparotomy. So abdominal means the same thing. Open laparotomy basically means abdominal surgery. Okay, following vasectomy, the man is advised to use additional contraception till when? The answer is 3 months. After 3 months, he has to get a semen analysis. Only once azoospermia is confirmed can we say that he is sterile and doesn't require additional contraception. So 3 months ke baad, he has to get a semen test done, and then only he is, then you can advise him not to use additional contraception. Hormone responsible for this image. So the baby is suckling. This is basically milk ejection reflex, and this is because of oxytocin. So the baby suckles, and that causes oxytocin release, and that is the milk ejection hormone. So the answer here is oxytocin. So that was 26 questions from Obs and Gynae. I think it was like a very, very simple paper. Nothing out of the ordinary came. Everything was quite simple. And I'm sure all of you have, the messages I'm getting were very, I was very happy. Most of you have answered all, I think 85 to 90% correct. So I now hand over to Dr. Pooja. I think she is next in line. Thank you.
Okay. Hello, everyone. I think, please let me know if I'm audible and visible to you. Host, kindly allow me to share the screen. Okay. So let's start with the questions. Thankfully, everybody is pouring with the excitement that Ma never changes that came in the exam. I'm very, very happy, and I'm very, very proud that you guys remembered that. And my bachas remembering my mnemonics is one of the happiest thing which has happened today. So see over here. first question, let's talk about it. Yesterday, I told you that it is going to come, right? So ABG questions, always they tend to come, right? So the first question was arterial blood gas analysis was given, and the inference is asked. Over here, I told you always and always look at the pH first. So what is the normal pH? 7.35 to 7.45. You can see that the pH has been increased. So it is alkalosis, cannot be acidosis. And see over here, I told you that the bicarbonate, over here, the bicarbonate is the higher amount which has been given, and the mixed acidosis is not there in the option, right? And was it there? Kindly let me know that if the what was the amount of PCO2 was, sorry, it was 28. The student has told me it is correction over here. Student has told me that it is 28. PCO2 was given as 28. So it or 48. Let me know it was 28 or 48. All right. So okay. So it was 48. This was 28. Fine. So this is pretty clear that acid has been increased, but there is the pH also has been increased. So it cannot be respiratory acidosis. It is going to be metabolic alkalosis. Here is your favorite question. Muscle zone were given and the person is exercising. That means muscle is contracting. And while the muscle contracts, what is going to happen to the M band and A band? We learned that the M line and the A band never decrease, right? So Ma never change, right? So it is going to be I band which is going to decrease. I band, it is going to decrease. All right. So that is going to be there. Just give me a minute. All right. So everything is clear. Now the OHDC curve also came, right? Okay, thank you, Sakshi. It was 48. So it is pretty clear that it is going to be metabolic alkalosis itself. Now, the OHDC curve was given and the red wala graph has been asked. That means this solid curve was asked. Now, of course, it is a right shift. And I told you yesterday itself, thanks to Praveen sir, that he took that class, right tag. I told you, you have to put a right tag. What was tag? Increase in the temperature, increase in the acid, and increase in the 2,3 DPG, or increase in the glycolysis. So over here, less 2,3 BPG cannot be the answer. Hypocarbia and hypothermia is also not the answer. It is going to be acidosis and acidosis only. I hope you marked it correct. Now, we have learned in the cerebellum that there are 5 types of cell, and the largest cell and the only output cell is going to be Purkinje cell, right? You can see over here the molecular layer and granular cell layer was given. That means this layer must be the Purkinje cell layer, and the largest cell which is shown, it is going to be Purkinje and Purkinje. And I told you G for G. Remember, granular layer is going to contain granular cell as well as Golgi cells, right? The basket and the stellate, they are going to be in the molecular layer. All right. So, okay, Dinesh, both A and I band was decreased. No, see, A band anyhow is not going to decrease. Okay, I'll change that. But A band is not going to decrease. So that cannot be the answer. All right. So that is there. So this is the graph. Tell me, is it the similar diagram which came, or there was some extra thing which is also given? Only they ask you to identify the diagram, or something else was also given in the question. Please let me know in the comments. All right. So I'm moving forward. Let me know if there is anything given or any hint is given. Now, botulinum toxin. They have asked about the botulinum toxin mechanism of action. We all know, we have learned in the same slide, botulinum as well as tetanus in the CNS. Botulinum and the tetanus toxin both are going to affect the snare proteins. Snare proteins are going to be in the presynaptic terminal. So that's why it is going to inhibit the release of acetylcholine from the presynaptic terminal. It has nothing to do with the postsynaptic receptor, or it has nothing to do with the choline esterase, acetylcholine esterase, or it has nothing to do with the reuptake also, right? I hope the options were correct. Hypothermia. Okay. iOS 0. It is hypothermia was there in the OHDC curve, is it? All right. Okay. Fine. So next is JVP. They have given the JVP. Let me know if what was the frame of the question, right? They have asked, as far as I know from the recall, The JVP has been asked, and they asked about the A wave. We know atrial contraction is going to show the A wave, and JVP means it is nothing but the CVP, or you can call it as RAP also, right atrial pressure or central venous pressure. Of course, the answer is going to be right atrial contraction. See, if you can exclude it also, the relaxation and the filling, it's the same thing now. When the atria is going to relax, it is going to cause the filling of it, and tricuspid valve bulging is going to cause the C wave and not the A wave represent. Thank you, Sampada. All right, so repetitive movement. All right, sure. Can you give, Krishna, can you give me the options and frame of the question? Okay, so I'll come up with the proper question in the recall, right, in the cerebellum app. Now, which of the following is related to the release of bicarbonate in exchange of chloride in the RBC? That is going to happen as a chloride shift, right? There is a band 3 protein, or we can say that anion exchanger. I have told you anion exchanger. Anion exchanger means to maintain the electron neutrality, the RBCs, whenever they are going to reach towards the cells, they are going to go out of the RBCs, but we have to maintain the electron neutrality. So we are going to take the chloride inward, right? So that is nothing but the chloride shift. Please remember, Bohus effect and Halden's effect has nothing to do with the anions. It has to do with the gases. That is, it shows the affinity of hemoglobin with the carbon dioxide and oxygen. It has nothing to do with the chloride or bicarbonate like anions. All right. Excellent, Nikhil. Yes, it is the hamburger's phenomena or chloride shift. Okay. Let me know, hamburger was there in the option or the chloride shift. It means the same. Okay. Sure. Hamburger was there in the option. Okay, I'll change it there. Now, in a patient after giving noradrenaline injection, heart rate started to decrease. What is the reason behind it? Now, understand, whenever you give norad, what is going to happen? There is increase in the BP, which will be the resultant, right? And because of the increase in BP, what is going to happen? The baroreceptors are going to get activated. And tell me, baroreceptors are brake or accelerator? Baroreceptor acts as a brake to the BP. I told you that, right? And hence, what is going to happen? What is going to happen? Now the BP has been increased. The baroreceptor cannot decrease it because noradrenaline is already sitting on the receptor. So hence, what is going to happen? There's something known as reflex bradycardia. Reflex bradycardia is going to take place, right? So reflex bradycardia, and hence, so what is the reason behind it? The reason is the brakes. That is nothing but, yes, excellent. So it is going to be the stimulation of baroreceptor. Now, next question is, ADH act on which of the following site of the nephron? It is going to be cortical collecting duct. I told you, the end part of the nephron on which all of the changes are going to, final changes are going to occur. Change in the osmolarity, action of the aldosterone, action of the ADH is going to be maximum at the end. That is nothing but the cortical collecting duct, isn't it? All right. Let me know there were some different options or not. Medullary collecting duct. I don't know. I'm not sure whether the medullary collecting duct was there in the option or not. I'm sure that cortical collecting duct was specifically given. Let me know in the comments that whether it was there or not. Okay. Lokesh, about the BP, it was given in the options or in the question itself. Iska image tha beta? Okay. This has given as image. Okay, I'll add the image. All right. So image may collecting duct, have they shown the collecting duct pe 2 arrows or single arrow? Let me know in the comments. All right. Medullary collector duct was in the option. All right. Okay. Got it. Got it. All right. Next, the scenario was shown. The baby is suckling on the mother's breast. It is going to be the milk let down reflex. We have seen that in the positive feedback mechanism, right? So it is going to be milk ejection reflex or milk let down reflex. That is going to be the hormone responsible. It cannot be adrenaline, cortisol, or thyroxine. It is going to be oxytocin, all right? Oxytocin. Right. The next question was, dehydration is usually affects infants more than the adults. Which of the following is true statement? Okay. Now, some students told me it was given in the newborn. Some told me in the infants. Please clarify what was given in the question. Was it about infant or was it about newborn? No matter what was given, I hope these options were correct. And if I check the option, there are three more probable answers can come out, right? ECF equal to ICF, but it is going to be around 3 to 4 months. And that's why it is important if they have given in the child, infant or newborn. All right. And acetazolamide. Okay, acetazolamide, it is going to be the different question, right? Image was given in the acetazolamide. All right, fine. So I have not added that question. I'll add that question too, right? ECF is more than ICF. You can see the diagram over here. If I zoom it in, I hope you can see the zoom part over here. So you can see we have already learned that the total body water is more in the percentage as far as the body surface area of the newborn is concerned. But it is not going to be, of course, it is not going to be more than the adults. Right? So the content, the concentration is more, but not the content. Content-wise, it is going to be, of course, less. Right? As compared to adults, it is not going to be more. So the most appropriate answer over here becomes ECF more than the ICF. I tell you that usually what happens is as you grow, the cells are going to be more and more in numbers. And of course, and because of all the factory material is there inside the cell, it is going to be yes. Ratio tha option mein. Okay. ECF is to ICF ratio. Okay, was it ECF is to ICF or ICF is to ECF? Okay, ECF ICF ratio tha, then also ECF is going to be more. So ECF is first, then that ratio is going to be higher. All right, ECF is to ICF ratio is going to be more than 1 like that. All right, I'll change the option. Can you tell me about the option C? Was it option C? Option C was there in the option? Exam mein option C was there? And was it correct? Let me know. And if the recall have some bias, let me know. I'll check it and I'll correct it in the main video. All right. FSH is inhibited by, of course, we have learned that FSH is inhibited by inhibin, right? Not estrogen, not progesterone, not testosterone. All right. So FSH is going to be inhibited by inhibin. All right. Next question. The patient with the respiratory difficulty and had a history of chronic smoking. Chronic smoking hai, and they have shown that the FeV1% has been reduced. I told you, kisme hota hai FeV1% reduction. It is going to be in the old person, isn't it? I told you, remember that in the old person, what is going to happen? In the old people, the efficiency decreases, and old mein FeV1 percentage also decreases. It cannot be fibrosis or the interstitial lung disease because both are restrictive lung disease. They are not obstructive lung disease. Over here, obstructive lung disease are two, that is COPD and asthma. Asthma is acute one, right? And he has the history of chronic smoking and chronic respiratory difficulty. Let me know asthma was there in the option. Okay, asthma was not there in the option. What was the option D then? What was the option D? Let me know. Lokesh, what was the option D, beta? Okay, 50-year male, 30-year smoking history. Okay, thank you, Numan. Let me know what was the option D. Option D kya tha? TB was there. Okay, of course. Tuberculosis will also be, it is not related to smoking, no? So it is going to be, FeV1 percentage is going to be, all right, TB was there. Thank you, thank you. All right, so it is going to be, again, it is going to be COPD. Now, let me know, you have to help me out in this question, right? What was the language of the question? I got, as per the recall, that a hypertensive patient was given and he had the hypernatremia, hypokalemia, and alkalosis. We have seen all these diseases are going to, all these symptoms are going to meet with the probable diagnosis. That is nothing but the Conn's syndrome. We have discussed Conn's versus Addison's, right? Conn's versus Addison. In that, it was there. Okay. Cancer was there in the option B. Who? All right. Gentleman there. Okay, gentleman. कौन सा option नहीं था बेटा? Gentleman, sleep music, gentleman and barter. Okay. Fine. Gentleman and barter was there. I'll add that. Okay. ठीक है. All right. Let me know. Kindly frame the question and give me in the group, official group, or on my personal ID also. Right. A patient had a difficulty switching from one movement to other with uncontrollable hand movement, and it is going to be dysdiadochokinesis. All right. So please remember, it can be intentional tremor. I don't know. There was no whether it has given the. All right. RT wale option. RTA was also in the option. All right. Let me know the framing of the question, and then we will talk about it. Okay, fine. No hypertension. Okay. It was barter. All right. It was barter. Then kindly let me know what was the framing of the question. Okay. Image was not given, but it was given that the patient has difficulty in the switching from one movement to another, right? And some cerebellar disorder was given. So it is going to be dysdocokinesis. Same was there. Okay. Same was there. Then it's good. Okay. Retrograde nahi tha. This was question, yes or no? Please let me know. This dysdocokinesis, everybody has told me that this was the question. Ye tha. All right, good, good, good. All right, next. Biopsy was given, renal cell biopsy, and you can see that this is the glomerulus, right? This is the Bowman's capsule, and this over here is the glomerulus. And there is one tubular structure is coming, and they have marked these cells. Of course, I told you that you have to remember, as soon as we start the renal system, we see the arrangement of the JJ apparatus, right? And in that, we see that the macula densa cells, which are the cells of ascending limb of loop of Henle, the end of ascending limb of loop of Henle, or the beginning of DCT, we do have the macula densa cell. So the answer over here is going to be macula densa because it is outside of the JJ, outside of the Bowman's capsule, right? Outside of the glomerulus. All right. Thoda sa change tha. All right. Dobaria, JP Dobaria, which question has the change, beta? Let me know. Okay. ठीक है. Extraglomerular mesangial cells was the option. Okay. Extraglomerular mesangial cells are nothing but the Lassus cells. Okay. They are the same. But it is not the Lassus cell. Lassus cell, it is going to be outside, but it is not going to be in the tubule. You can see, if you see it carefully, it is the tubule. Inside the tubule, you have that. That means it is going to be macula densa cell. All right. So answer is going to be again macula densa. Right. So that is all from my side. Okay. Please let me know if there were more questions. Please let me know in the comments. And of course, in the 2 to 3 minutes, I'm going to be there. I'm taking the screenshot, right? And I'll do the changes accordingly, right? Relax now. And I'm handing over to the next faculty.
Yeah, Dr.
Madam, can I
Yeah.
share the okay. So that was a very detailed discussion, Pooja ma'am. Thank you so much. So just give me a second to connect. So how was dermatology from today's exam, dear students? I hope it was all good. Okay, so I hope my screen is visible. Please confirm, madam. Hello?
Yes, sir. Yes, sir. Your screen visible, sir.
Oh, great. Okay, okay. So yeah, dear students, okay. So these there were some questions which were asked from dermatology. So I need the help of you also in collecting the options. But I think overall dermatology was a doable type of paper, and most of the students were in the same opinion. And if there were any additional questions, please do let me know. And yeah, these were all the topics from which the questions were asked. So this was the first question which I received: treatment of the nodular acne. Yes, dear questions. Treatment. Yeah, more dermatology than expected. Yes, Ishan, you are right. Okay, okay. So treatment of nodular acne, was this question and the options the same, and was this image actually given or any other image was given? Please do let me know. And if this was the question which was asked, then the answer is going to be the option A, isotretinoin. So you have done great job since morning. You are doing all the tests and you are traveling. So I will not try to discuss much. So I will just give you the correct answer and we will move on. And if there are any more additions to be made in the options, then I will write them down here and I will make the change as necessary and post a video separately on the Cerebellum Academy app. नॉडुलोसिस्टिक था, अच्छा ओके, नॉडुलोसिस्टिक दिया था, ओके नॉडुलोसिस्टिक, ओके. Image was different, okay, but close. Image was having more acne. ठीक है. नॉडुलर सिस्टिक वाज मेंशन एंड क्या बैक का इमेज दिया था या चेस्ट का इमेज भी दिया था? So I hope all of you remember that in acne we have 4 grades, grade 1, 2, 3 and 4, and in the grade 1 acne we are going to use topical retinoid, whereas the extreme case, the severe case of acne, grade 4 acne, where nodules and cysts will be there, here we are going to use oral retinoid, which is isotretinoin, which is also called as 13-cis retinoic acid, 13-cis retinoic acid. Okay, yes. Oh, just this image, fine. Back was involved is mentioned, great. Okay, okay. So we'll move on to the next question. So this was a different question or it was not given. Please do let me know if this was not given. Treatment of comedonal acne, was it given today? Acha, history had 18-year-old boy. Okay, ठीक है, I will add that 18-year-old boy. Thank you so much. 18-year-old boy. ठीक है. Back acne was mentioned in the question. Okay, back acne was mentioned in the question. Okay, ठीक है. Thank you so much. Okay, this was not given. So if it was given, okay, topical retinoids would have been the correct answer. Right. So this is the next question. 50-year-old female is undergoing breast chemotherapy. Following this, there was diffuse hair loss noted. What is the most likely diagnosis? And this is a very simple question which we have discussed in our classes every time. In ENDs also we have discussed. So after chemotherapy, if there is a hair loss, always you must think of effluvium, which is anagen effluvium, and the answer is going to be option A. So I think, okay, there is no much difficulty in this particular question and all of you have marked this correct. Yes, dear students, is there anything to be added? Do you remember the option D which was given in the this question? Acha, photo was given. Acha, image was given. Okay, image और breast chemotherapy दोनों भी mention किया था. Hair loss with few hair. अच्छा, with few hairs. Okay, few hairs remaining. Scalp का दिया था. Derma was easy. हाँ, derma was easy. That's what many students told me. A few hairs remaining on the scalp. Okay. ठीक है. Thank you so much. Okay, so we are not going to go into the details of the other things. Okay. Image was there with old man having very less. अच्छा, old man. Okay. तो बहुत सारे images तो आए थे. No sir, they give scalp picture. Okay, scalp का picture. ठीक है. ओल्ड लेडी विथ फ्यू व्हाइट हेयर. अरे यार, लेडी अभी मेल लेडी बन गया. ठीक है, वट एवर इट इज. ओके, ब्रेस्ट कीमोथेरेपी मतलब फीमेल ही होगा शायद. बस ब्रेस्ट कीमोथेरेपी मेंशन्ड इन द क्वेश्चन. यस डियर स्टूडेंट्स, जस्ट टाइप यस और नो. हाँ भाई आएंगे. आनंद, सोरियासिस का क्वेश्चन भी दिख नहीं थी. एज्ड था पेशेंट, लाइट ग्रे हेयर थी. ओके, ब्रेस्ट कीमोथेरेपी मेंशन था या नहीं था? ओके, लेडी. ठीक है, इट्स ए फीमेल. ओके, ठीक है. Okay, breast cancer is mentioned. Chemotherapeutic agents, remember, it is going to be associated with anagen effluvium. So answer is going to be option A. So no doubt about it. Telogen effluvium, I hope all of you know there will be COVID infection or any typhoid, malaria, dengue, chikungunya, admission into the hospital, and cardiac surgery or myocardial infarction or any surgery, any stressful situation will be mentioned. After 3 months, there is going to be telogen effluvium. Okay, right. So next is this question. So this most of students might have answered it very, very easily. So there was a question, image which was given, which was showing, lesion which was erythematous, which is having silvery white scaling. So here, this is a psoriasis, very important topic, psoriasis. So they have mentioned what test we will do for this patient. Okay, I hope all of you have marked this correct. So answer is option A, Grattage test, which is also, which is a part of this Auspitz sign, where we are going to select a scaly lesion, take a glass slide, remove the scaling, and we are going to ultimately see the end point of pinpoint bleeding spots which is auspitz positivity, and this scraping off of the lesion, scaly lesion, is called as Grattage test. Okay. Okay, so not this image. What was the image? If you can get to know what was the image, and if you can post it, you can post in my Telegram group or in the Cerebellum Academy official group and tag me, so that I will make the changes and keep a more appropriate image which was given in the actual examination in the app. Image was different. Okay. Second pic, ये pic दिया था, image अलग थी थोड़ी but similar. Okay. So my question for all of you, were you able to diagnose it as psoriasis by looking at that particular image? अच्छा, only lower back का picture दिया था, only lower back. Okay. Grattage was not in the option. Acha, Grattage was not in the option. So, dear students, Grattage test is not there in the option. But what was the other option then? What was the other option? Acha, patch test was the other option. Okay. Nikolsky sign. Okay, Nikolsky sign. Grattage was not in the option. So, what was there in the option? Can you please tell me, dear students? पता चलना था. It was in the option, so some students are telling it was. So was auspit sign given in the question for those students who are telling that it was not there? First option was Grattage. Grattage tha. I think many students accept this. Grattage tha. Okay. Okay. Great. Thank you so much, students. So Nikolsky sign, it is associated with vesiculobullous disorders, जिसमें skin में acantholysis, we can see acantholysis, because of which the skin, if we try to apply tangential pressure, it will be peeling off from the underlying dermis. Okay. Okay, that is Nikolsky sign. Okay. So this was, I think, discussed in the pediatrics. Okay, this is integrated, so I don't want to go into the details of this. So diarrhea is there. There is erythematous scaly lesion, that is dermatitis, peri-orificial dermatitis. Okay, peri-orificial dermatitis, perineal lesion was given, and even alopecia may be mentioned. So in the question, so all these are pointing towards a diagnosis of acrodermatitis enteropathica. We have discussed this so many times. Very important question. Deficiency is zinc deficiency. So this is also, a very standard repeated question. Patient got a prick by rose thorn, and there is linear lesions noted along the lymphatics. What is the most likely diagnosis? So it is sporotrichosis, which is produced by the Sporothrix schenki, which is going to follow the lymphatics. So they are going to be lesions from the distal end, which are going to progress and involve more and more proximal areas. Okay. Third wala image tha. Okay. Acha. Okay. So can you please remember what were the other options given for this particular question? So was this question there? Schenki. Ha. Third image tha. Okay. Third image. Okay. Acrodermatitis enteropathica. Third image. Okay. Can you just help me out in telling what were the other options, if you can? So how was the paper? Okay. Okay. So yeah, I will just see the option, chat later on. So 30-year-old female presented with painful red granular lesion on the vulva and bilateral inguinal lymphadenopathy. What is the diagnosis? So this was the question. Okay, this was the question. So STD question is also very much, expected. So if you remember, we have discussed it in the form of a flow chart. So painful red, genital ulcer, if it is present, along with bilateral lymphadenopathy, what is the possibility you can think of? It is chancroid or it is herpes. And students told me that herpes was not there in the option. So here the answer is going to be option A, that is a chancroid. So was this a question, dear students? Chancroid, was herpes given in the options, or was the question mentioning anything else? So please do help me out. Had a photo. Acha, photo was there. Photo kiska hai bache? Yes, dear students. Can you tell me what was the image which was actually given? Lymphogranuloma venereum, painful genital ulcer is mentioned in the question. Okay, painless ulcer is going to be there in LGV, so it can't be LGV. Okay, 3-month diarrhea. Okay, no herpes. Okay, so I hope Jai Shri Krishna, your doubt is clear. No image. Acha, no image was given. Okay, ठीक है. So there is some discrepancy. So some students are telling image was not given. Okay, right. So this is basically a pathology and also dermatology integrated question. So students were giving me two types of scenarios here. So they told that a very elderly person came with the ulcer on the medial canthus. An ulcer had rolled out beaded margins, and histopathology was showing palisading pattern. What is the most likely diagnosis? We have discussed this in our classes also. Very important topic, which is basal cell carcinoma, where we are going to have a ulcer, which is rodent ulcer, which will have beaded margins, and on histopathology there is going to be palisading pattern. So this was also discussed by Sparsh Gupta sir also, I think, right? Okay, so this is BCC, and some students were telling me that there is another question where elderly person, same lesion on medial canthus, but histopath was showing keratin pearls. So if this was the question which was given, then the answer is going to be squamous cell carcinoma. Students, help me out. Was this question actually there in this today's test related to this keratin pulse? Was this there in this today's exam? Squamous cell carcinoma. So students are telling two questions on BCC. So the previous one was there, and do you think the other question was this, where keratin pearls was mentioned in the question? Acha, diagnosis was not asked. So can you tell what was asked if it was related to BCC? Some students are putting keratin. Acha, keratin pearls was in the one of the options. Okay. Yes, sir. My question was this. Okay. No keratin pearls. दोनों नूपुर दोनों क्वेश्चंस थे. Okay, please can you tell me what was one question was about diagnosis, so what was the other question regarding, and what was the question? It was in the option keratin pulse. अच्छा, keratin pulse was in the option. ठीक है, तो question क्या था? What was the description? What is the scenario which was given in the question? Can you please tell? Pearly nodules was there. अच्छा, BCC was not given in the option. ठीक है. Pearly keratin. Okay, keratin pearls. Okay, it is related to squamous cell carcinoma if the clinical scenario is looking like SCC, where we can see papillosquamous lesion in elderly individuals. Okay, then you can mark keratin pearls. If the question scenario is looking like a squamous cell carcinoma. Okay, we'll see what is the exact question in the app, most likely, because many versions are coming from many students. Okay, so this question, I hope it was there in the today's exam. Wrong dosage of leprosy medication in the adults. Okay, wrong dosage. I hope all of you know, we have also discussed this dosage. It was also a pharmacology and also dermatology integrated question, also SPM probably. Okay, so 300 mg clofazimine once a month. Yes, it is correct. 50 mg clofazimine daily. This is also correct. 100 mg dapsone. This is also absolutely correct. So the answer here is going to be 450 mg rifampicin once a month is not correct. So it should be 600 mg in the option for this option to be correct. Okay, option C is the wrong dosage for this leprosy related question. And they have received this question and these two options. So please help me out in this question. So the glans penis was showing some red lesion and there was a pigmentation on the chin and tongue. So this was a question which students gave me, and these were the options: lichen sclerosis and condylom acuminata. So was this the actual question, and is there any correction to be made in this question? And what were the other options, if you can remember? अच्छा, rifampicin weekly was given in the option. Sir, weekly. अच्छा, ठीक है. And was the dosage okay 450 mg given or 600 mg it was given? just I'm coming back to this question because some students told it was weekly which was given. Okay, image nahi thi sir, only description. Okay, but students were telling image tha. Peyronie's disease 450 mg was okay. ठीक है 450 ठीक है fine. Okay, fine. Done. Right. Okay. Next is okay. This students are telling okay. Peyronie's disease is given. Okay. And okay, what was the other option which was given? And okay, and was this mentioned that pigmentation is present in the chin and the tongue? Was this mentioned? Image tha, okay. Yes, 400 something. Okay, mostly glands per tha lesion. Okay, glands per tha. Okay, students, was it given that pigmentation on the chin and tongue is also, was it mentioned? Pigmentation on the chin and tongue? Fournier's gangrene, acha. Okay, pigmentation mentioned. Okay, so by ruling out of the options, you can rule out the condylom acuminata because it is going to present with wart. It's basically wart, anogenital wart. So rough surface lesion should be there, and also pigmentation does not explain this. And Fournier's gangrene is not the correct answer because I hope you know how it presents. Okay, it will mainly involve the scrotum and also the penis, where there is going to be a black scab or crust which is going to be produced. Okay, so Peyronie's disease also not correct. So the most likely correct answer has to be lichen sclerosis according to the version of the question and the options which the students have given me along with the image. So if we correlate all this, okay, lichen sclerosis has to be the correct answer. Where there can be, you know, this erythematous changes present over the genitalia, and also we can see the pigmentation, hypopigmentation over the chin and the tongue. Okay, so that could be possible correct answer, and depending upon what were the other options, the answer might change. So some students are telling syphilis was there in the options. Was syphilis? No, syphilis was it there in the options? Syphilis is in the option. Acha. Okay. If syphilis was there, then it is going to be interesting. Not Fournier. Okay, ठीक है. Not Fournier. It is syphilis which was given. ठीक है. Not tongue but oral part. Acha, oral part. Was it mentioned pigmentation in the oral cavity? It was an oral cavity. ठीक है. Syphilis, no syphilis. Oh my God. Okay, ठीक है. So I will leave this question for further discussion in the Telegram group, Cerebellum Academy official group, or my group is also there, Telegram, Crack Derma Dear MSD. So you can put whatever version you feel that was given in the exam in that group. We'll discuss and we'll brainstorm and we'll come up with the final version. I will post it in the Cerebellum Academy app. Okay. Okay, thank you so much. So these were the questions, and most of them were from actual, most important topics which were asked. So one or two, if they were Googlies, do not worry. So just be cool. And okay, that's it. From my side regarding dermatology. So I would like to hand it over to the next faculty. Yes, where is this? Stop sharing. So I think.
Hi, Srinivas.
Dr. Dilip, sir. Good evening, sir. Please.
Hi. One second, I'll just sharing. Are you able to see, guys? Yes. Then wait for some time. Wait outside. I'll come. Hi, guys. So I don't have much to discuss, honestly speaking, because I'm in the process of collecting the questions. But To some extent, whatever questions that we have predicted are the ones that have come in exams. If you are looking at the paper carefully, I think yesterday we predicted around like 10, 12 topics, and that around 8 or 9 topics came today. So, I mean, medicine questions were quite simple and easy and straightforward. I don't think there's any second thoughts in that. And apart from that, we have did something called as a marathon session, right? Recently in Cerebellum. So, and from the marathon session, if you see, we got around 25 to 28 questions. And if you look from the mission FMG classes, I think easily it's around like 30, 35 questions. So totally around 40 questions you could have answered easily. So no worries about that. Yes, to be honest, yes. So we have actually discussed a lot and most of the questions have come in the exam. So, but I do have like 15 to 16 questions as per what students have said. So it's not like medicine questions were less. Actually speaking, around like 30, 40 questions were basically from medicine from whatever we have discussed so far. So one of the questions that came is that ABG, that metabolic alkalosis thing. So I think we have discussed about that, the Rome criteria. So the pH was around 7.5 and the bicarbonate was around 32, 33. And I think the PCO2 was around 48, that as a compensation. So the answer for that question was basically metabolic alkalosis, if I'm not wrong. So then there was a question on atrial fibrillation and the patient was on shock, right? So whenever any tachyarrhythmia with a pulse, if the patient is in shock, you're going to shock the patient, as simple as that. So that was one easy question that we have been discussing. So for every now and then. And then the third one is going to be, as we predicted, it's from spirometry. So I think we had a straightforward question on COPD, a patient who's a smoker and had like FE1 of somewhere around like 60-50% and FE1 by FEC ratio was also low. So technically, so basically this was a case of what? COPD. So it was not ILD. So ILD wasn't one of the options. So it's basically COPD, nothing more than that. And then we did have a question on Guillain-Barré syndrome, a case scenario. So if you remember, so that, I mean, we discussed about the 3As in Guillain-Barré syndrome. I told you at the end, even in the marathon session. So what are the 3As? It's acute, ascending, areflexic. So I think all three were in the options: acute, ascending, areflexic. So that's basically a GBS case scenario. So then there was a question on nephrotic syndrome. This question I was not very sure about what exactly is it. Uh, Students were telling just massive proteinuria of more than 4 grams per day. And the patient did have anasarca and what's the treatment. So I'm not very sure about exactly what was the like light microscopic finding or whether they did give any immunofluorescence or electron microscopic finding. So in case if the light microscopy was normal, we take it as minimal change disease. In that case, it's going to be only steroids. But in case if it's going to be SLE related or something else, we are going to add cyclophosphamide. So I'm not very sure like what exactly the light microscopic finding or probably other findings were, but students were very sure that this is basically a nephrotic syndrome. So if that is the case, then definitely I'll be going towards like maybe steroids first. Okay, respiratory tract infection. So I'm not sure exactly like what you're talking about, like exactly. So if it's respiratory tract infection, then we can think in terms of maybe even IgA nephropathy, but what really was going on? So what was the light microscopic finding? That's what I'm asking. So that's going to tell you the answer most of the time. Anyways, fine. So they're asking about Von-Willebrand factor type 1. Do anyone know the options exactly? So what's the mechanism of Von-Willebrand disease type 1? So basically, Von-Willebrand disease type 1 is due to partial quantitative deficiency of Von-Willebrand factor, nothing more than that. So I'm not very sure exactly what are the options were, what are the language of the question was. Anyone was aware of that? So what was exactly given in this particular question? Type 1 von Willebrand disease. It's a partial quantitative defect of von Willebrand factor. Okay, all right. So then as we predicted, there was a question on tropical infections. So generally like one question from tropical infections and HIV TB is given in any FMG exam that was happening in the last few years. So they've asked a question on typhoid antigen, if I'm not wrong. So then they have given X-ray, I think, if I'm not wrong. So that was from pulmonary edema and it was a bad thing appearance. Then there was a question on seventh cranial palsy. I'm not very sure what exactly the question was, but I need to compile it. So we need to discuss about that later on as well. And then there was a question on diabetic drugs. I think two questions came from diabetes. So one, with regards to cardiorenal benefit, I think yesterday Goga sir, as well as myself, we predicted that from SGLT2 inhibitor. And if I'm not wrong, so that was the answer for that. Okay. So then there was another question on diabetes. So patient was already on metformin, 500 milligram BD, A1C came from 9% to 7.5%. Still, we need a A1C of less than 7%. So what to do next? So technically, we are going to increase the metformin dose to 1000 milligram 2 times a day, because we have discussed a number of times that the maximum dose of metformin is around 2 grams per day. So it's going to be around 1000 milligram 2 times a day. So that's something you can do. And then they have asked about something called as Chuvastexine, easy one. We have discussed so many times. It's basically hypocalcemia, nothing more than that. And I think they have asked about the treatment of acute bacterial meningitis. So, and the answer for that was ceftriaxone. So if it's going to be bacterial meningitis, the first line drug that we use is ceftriaxone. And of course, we do add vancomycin, but the first drug that we're going to add is often ceftriaxone. And there was a question on Pancoast tumor, and the patient is likely having Horner syndrome. So they asked about what is not seen. So answer is exophthalmos for that, because we know patients are going to have ptosis, meiosis, anhidrosis, loss of ciliospinal reflex, and apparent enophthalmos and not exophthalmos. I think this was the right answer for that question. And they asked a question on TB iris also, like that's immune reconstitution inflammatory syndrome, where patient had a history of tuberculosis, and after starting treatment, patient got worse. So that patient got bad. So what could be the reason for that? It's basically probably, I'm not sure, I need to know the exact question, but it's probably an immune reconstitution inflammatory syndrome, right? And if I'm not wrong, there was a question on Bartter and Gentleman syndrome as well. So I'm not sure exactly what question came on Bartter and Gentleman syndrome. I've been trying to collect the questions because it's too early, because it's not even around 4 hours after the exam got over anyway. So we are in the process of collecting the questions. Okay. So Bartter and Gentleman syndrome. So Mohit Sharma is telling ceftriaxone plus vancomycin and one of the option. Then that will be the right answer. That's correct. That's a kind of the empirical treatment. So ceftriaxone plus vancomycin will be kind of right answer if that is the case. That's correct. Okay. So that's all right. That's fine. No worries about that. And I feel there was a question on acrodermatitis enteropathica. I think I even saw Srinivas discussing about the same question. I'm not sure about exactly what question was said. And yes, there was a question on a child with a picture given zinc deficiency, acrodermatitis enteropathica, or probably like that zinc transporter defect. That's basically acrodermatitis enteropathica, right? So these are the 17 questions that I could collect at this point of time, honestly speaking. So we need to like go through a lot of options, and at the same time, I need to know the exact language of the question in which the examiner has been asking. So I need to know all those things. So then only I can come up with a better recall. So anyways, fine. So we'll be coming up with a full-blown recall. You can keep posting your questions in the Telegram group, and you can DM me also if you wish to. And hope you all like did the exam well. I mean, this kind of a not very difficult paper, to be honest. I think everyone should get 200, right? So I mean that's the target that we are looking for. So not just 150. Okay, so first degree. Mukul is asking about first degree heart block. Nice. Okay, so there's another ECG question. So I can say so that patient did have, yes, first degree AV block, right? So that question is also ticked off. So that's something that we have discussed a lot of times. It's just prolongation of the PR interval, nothing more. Okay, all right. So there was a first degree heart block or first degree AV block question as well. So 18 questions in total as of now. So, but I believe there is a lot more than this. Maybe if we dig in deeper, we might get more questions from this. Okay, all right. So thank you very much, guys. I think we can move on to the next speaker. Okay, PSVT treatment. Okay, all right. So it's atrial fibrillation in shock or PSVT. So which one came in the exam? It's PSVT for sure. Are you sure about that? Okay, all right. Thank you so much. My PSVT treatment. Okay, so fine. So my God, so then our prediction came very much well. All right. So no P wave, pulse irregularly irregular. That's basically atrial fibrillation. So was that a different question or it was the same question? Okay, PSVT treatment was there. Okay, all right. So both was there. Okay. Atrial fibrillation in shock treatment was asked. At the same time, there was, oh my God, there was a question on atrial fibrillation as well. Okay. Atrial fibrillation diagnosis. Was there another question on that? Cool. Okay. Okay. All right. AFib was there, not PSVT. So I can remove that PSVT off. Okay. So I don't know. So I removed the PSVT part. So maybe atrial fibrillation diagnosis was there and atrial fibrillation and shock, that treatment was also there. Okay, so two separate questions or only one question? What do you feel like? Okay, MR was also there. I'm not sure. I mean, I need to get into touch with more. I mean, other students. I need to collect more questions. I mean, 80-50 BP, definitely it is shock. Yeah, synchronous DC cardioversion. The BP is low, treatment is going to be synchronous DC cardioversion. There's no doubt about that. Okay, there was a question on Graham-Steele murmur. Okay, only one question. Then I can rub this and I say Graham-Steele murmur because some students is commenting on Graham-Steele murmur. Okay, no PSVT. So AF only one question. I've just changed that question. Yeah. So if there was a clinical stem and the patient was in shock, treatment will be shock. Graham-Steele murmur was there. Nice. So it's basically a PR murmur due to pulmonary hypertension. All right. So that was there. So still, yeah, I mean, that's pretty much good number of questions. Yeah. Graham-Steele murmur seen in which no pH was there. Okay, all right. But anyway, it's a PR, right? It's a pulmonary regurgitation murmur. Okay, all right. Okay, first let me discuss with other students and get back. Okay, all right, all right, all right. So fine. No worries. I think it's time for the next speaker to speak because otherwise it's going to take eternity for us, I know. So we need to come up with a better recall. We need to get the exact question. Okay, so water hammer pulse. Okay, pistol shot femorals. I don't know whether these are separate questions or let me post in the Telegram group so that you guys can comment on that. Okay, all right. So
Dr.
great.
Govind, sir, you can come, sir.
Yeah, I
Yeah.
think next Goga sir is.
Thank you, Dilip sir. Thanks a
Thank
lot.
you, sir. Thank you so much, sir. I mean, just stop the screen sharing 1 second. Thank you, sir.
Let me add the screen share.
Yes.
Hello, everyone. Hope you all have a good exam. So, guys, my screen is visible?
Yes, sir.
Yes, sir. Great. So, we can discuss pharma questions quickly. So, starting the first question, indomethacin should not be given with AC inhibitors because. Yeah, so we have 4 options. This question was there. Hi, Mashook Jalal. Was there a question like this? Please tell me quickly and please see the options also. Are these correct? It may increase the risk of hyperkalemia. It can decrease the antihypertensive effect of ACE inhibitors. It may increase the risk of acute kidney injury. It may cause severe hypotension. So please let me know quickly whether it is there or not. No, medico saying no. So this was not a question. I got this question in Telegram group. This is not a question. Should I delete it? Okay, so let's delete it. Question नहीं था. Okay, delete it. चलो, start. Which of the following drug is contraindicated for hypertension in pregnancy? So this was the question frequently repeated. हाँ सर, समर सिंह था, गार्गी आर्य नरसिंह था. So was that question there or not? ये वाला question was there. सत्यजीत सिंह question was there. ये था. Okay, if it is there, so AC inhibitors effect is reduced by indomethacin. Indomethacin decrease the antihypertensive effect. NSAID decrease the antihypertensive effect of AC inhibitors and diuretics. So they should not be given together. So both 1 and 2 are correct, but 2 is correct. That's why we do not use them. ठीक है, हाइपरकलेमिया का रिस्क नॉर्मल पर्सन में नहीं होता. ठीक है, चलो कमिंग टू दिस क्वेश्चन. Which drug is contraindicated for hypertension in pregnancy? Hypertension in pregnancy. Yes, everyone knows AC inhibitors, ARBs, prils and sartans are absolutely contraindicated. इसमें तो कोई डाउट ही नहीं है. Okay, prils and sartans are absolutely contraindicated in pregnancy. AMIM options are only hyperkalemia, hypoglycemia, vomiting, Okay. So question that तो हम दोबारा से आएंगे काशिफ, then we can discuss that question. चलो, here the answer is in Elapril. It's a simple question. Next question, adverse effect of bleomycin on which system can be worsened by radiation therapy? This question was there. Options are right. Let me know. Options are right. Adverse effect of bleomycin. ये भी नहीं था. मैं कोई और पेपर देके आया हूँ क्या? हाँ. Okay. Options are right. Options are right. That only answer is pulmonary. So pulmonary fibrosis risk is increased by bleomycin. Okay. Pulmonary fibrosis risk is increased when with radiation therapy. Okay. स्टैंडर्ड अपना कीमोमैन से 2 क्वेश्चन आए हैं. तो कीमोमैन इज दी जिंदाबाद. ओके, चलिए नेक्स्ट क्वेश्चन. विच ऑफ द फॉलोइंग एंटी डायबिटिक ड्रग इज प्रेफर्ड इन अ पेशेंट विद हार्ट एंड किडनी डिजीज? वाज देयर अ क्वेश्चन लाइक दिस? आए थे ये क्वेश्चन? ओके, गुड. ऑप्शंस वर आल्सो लाइक सिमिलर. सो आंसर इज SGLT2 इनहिबिटर्स. मैंने ये तो कल भी बताया था जब हम 5 क्वेश्चन डिस्कस कर रहे थे कि विच आर लाइकली टू बी आस्क्ड. दिलीप सर से बात हुई थी. सो दे सेड SGLT2 इनहिबिटर और DPP GLP-1 आएगा. मैंने कहा SGLT2 ही आएगा, है ना. तो SGLT2 इनहिबिटर्स, दैट वाज द क्वेश्चन. सेम क्वेश्चन वी डिस्कस यस्टरडे के आएगा ही आएगा. चलिए, कैटेगरी नहीं था मीन्स कार्डियो प्रोटेक्टिव था. कल के लाइव याद आया. कार्डियो प्रोटेक्टिव, हाँ यही वाला सेम क्वेश्चन है. चलो गुड. नेक्स्ट क्वेश्चन, मैकेनिज्म ऑफ N-acetylcysteine in paracetamol toxicity. N-acetylcysteine, it increases the production of glutathione. ठीक है, ग्लूटाथियोन के बड़ा NAPQI न्यूट्रलाइज ग्लूटाथियोन, ये ग्लूटाथियोन का लेवल इंक्रीज करता है. ऑप्शन इज ए, इट रिप्लेनिशेस ग्लूटाथियोन लेवल. डी वाज नॉट इन दी ऑप्शन. तो बता दो बेटा डी ऑप्शन क्या है सत्यजीत. सत्यजीत प्लीज टेल मी व्हाट इज द डी ऑप्शन. आई कैन चेंज इट. सल्फोनाइल यूरिया. अच्छा, इसमें इसमें कह रहे हो. ओके, इसमें सल्फोनाइल यूरिया कर देते हैं. ओके, सल्फोनाइल यूरिया. तो ग्लूटाथियोन की लाइन थोड़ी लंबी थी. मैं मतलब तो ये निकल रहा था ना बेटा. अच्छा, बाइगुआनाइड भी था ऑप्शन में. ओके, किसकी जगह बाइगुआनाइड कर दूं? इसकी जगह कर देते हैं बाइगुआनाइड्स. चलिए, ए भी नहीं था. ए भी नहीं था मीन्स. चलो, इट रिप्लेनिशेस ग्लूटाथियोन लेवल इनडायरेक्टली. जैसे भी दे मस्ट हैव फ्रेम्ड द क्वेश्चन, द आंसर विल बी पैरासिटामोल मैक्सिमम एक्ट इन 4 hours लाइक दैट गिवन. ओके, 4 hours. ठीक है, तो आंसर इज इट रिप्लेनिशेस ग्लूटाथियोन लेवल. ग्लूटाथियोन लेवल को रिप्लेनिश करेगा. ओके, चलिए नेक्स्ट क्वेश्चन. A person went for a trip on hills and developed difficulty breathing. Mountain sickness, basically a diuretic is given. The drug of choice for mountain sickness everyone knows is acetazolamide. So what is the site of action of acetazolamide? ऐसा क्वेश्चन था ना. So answer will be this place, proximal tubule. Proximal tubule पे एक्ट करेगा. Proximal tubule. ओके, चले आगे. Proximal tubule will be the answer है. Not in a question 4 hours. 4 hours नहीं था. वो हटा देंगे, कोई बात नहीं बेटा। तो बेसिकली यू अंडरस्टैंड ना कि किस तरह का क्वेश्चन आया था और क्या आंसर है। चलिए, कीमोमैन का सेकंड क्वेश्चन, कीमोमैन सेकंड क्वेश्चन, which of the following statement about anti-cancer drugs is correct? So we discussed, remember कीमोमैन, एवरीवन रिमेंबर? ठीक है, उसमें 3 सी बनती हैं, किडनी, माउथ एंड ईयर्स। सो सिस्प्लेटिन इज मोर नेफ्रोटॉक्सिक देन कार्बोप्लेटिन। सिस्प्लेटिन इज मोर नेफ्रोटॉक्सिक देन कार्बोप्लेटिन। सिस्प्लेटिन नेफ्रोटॉक्सिक है। ठीक है, चलिए नेक्स्ट। अच्छा, ये क्वेश्चन मुझे बताओ, इसमें आई हैव नॉट गॉट द कंप्लीट क्वेश्चन। पेशेंट वाज स्टार्टेड ऑन एंटी ट्यूबरकुलर थेरेपी एंड एंटी रेट्रोवायरल थेरेपी, सिम्टम्स वर्सन आफ्टर 2 months। वट वर दी सिम्टम्स, क्या वर्सन हुए, क्या चीज थी? बिकॉज एनी आंसर कैन बी पॉसिबल। सो प्लीज लेट मी कंप्लीट दिस क्वेश्चन। बताओ बेटा, क्वेश्चंस बताओ, इसके ऑप्शंस। पहले तो क्वेश्चन बताओ, वट वर दी एग्जैक्ट सिम्टम्स दैट वर वर्सनड? मोनिका सिंह एनएपी के नहीं था, कोई बात नहीं बेटा, हम वो चेंज कर देंगे, बट बेसिकली आंसर इज रिप्लेनिशमेंट ऑफ ग्लूटाथियोन, दैट वाज दिस इन प्लेस ऑफ सी, आल्सो लेस नेफ्रोटॉक्सिक ऑप्शन। ओके ठीक है सत्यजीत, ओके नो प्रॉब्लम। बस आप मतलब समझे ना, जज्बात समझो, एग्जामिनर क्या पूछना चाह रहा है। बस इतना ही था बेटा, इससे तो पॉसिबल नहीं है, बिकॉज सिम्टम्स तो कई तरह के हो सकते हैं ना। मस्ट बी समथिंग इन द क्वेश्चन, समथिंग इन द क्वेश्चन, मतलब ड्रग ड्रग इंटरेक्शन भी हो सकती है भाई। रितिका, दिस द सेम थिंग आई वांटेड टू आस्क, दैट व्हाट सिम्टम्स वर गिवन दैट गॉट वर्सेंड? यस, पीसीटीवी इज द आंसर बेटा। पेशेंट एटीटी पर है, एआरटी स्टार्ट की और 2 month बाद सिम्टम खराब हो गया। विच सिम्टम खराब हो गया? दैट वाज द क्वेश्चन आई वांट टू आस्क ना। ड्रग रेजिस्टेंस इंक्रीज्ड, ड्रग रेजिस्टेंस। ठीक है, अहिलेश कंप्लीटेड। 40-year-old patient with the TB was diagnosed with HIV plus ST. Yes. So if you are not able to recall completely, the answer must be immune reconstitution syndrome. So that's the precise reason why we are giving them at a difference. एक साथ नहीं देते हैं। तो पहले हम टीबी की ट्रीटमेंट स्टार्ट करते हैं, देन वी स्टार्ट द ट्रीटमेंट ऑफ एचआईवी टू प्रिवेंट द इम्यून रिकॉन्स्टिट्यूशन सिंड्रोम। अगर ठीक से नहीं दिया है तो ये आंसर आएगा। ठीक है, 99% वो यही पूछना चाह रहे हैं, इम्यून रिकॉन्स्टिट्यूशन सिंड्रोम। ओके चलो नेक्स्ट। Which of the following is best antibiotic choice for a patient with otitis media who is allergic to penicillins? ये क्वेश्चन था, सिम्टम दिया ही नहीं था, बोले सिम्टम वर्सन हुआ, so then it is immune reconstitution syndrome. No problem with that. Immune reconstitution syndrome आया। Clinical deterioration was seen, yes, then it is immune reconstitution syndrome. चलिए paradoxical immunity adjustment। So medicine and JP Dobaria is saying no. This question was not there. Azithromycin वाला Lokesh Dudi is saying yes. Symptoms था sir. Satyajit, yes sir. Not this question. That after 2 months there was no effect of ATT and ART. Okay, one option was that I will add. ठीक है, चलिए नेक्स्ट पे आते हैं, उसको छोड़ दो, उसको छोड़ दो। नेक्स्ट दिस क्वेश्चन बताओ। देयर वाज ऑटिटी मीडिया द क्वेश्चन, एंटीबायोटिक, एलर्जी टू पेनिसिलिन है तो नो बीटा लैक्टम कैन बी गिवन। ये तीनों बीटा लैक्टम्स है, कैन नॉट बी गिवन, आंसर इज एजिथ्रोमाइसिन। बीटा लैक्टम्स कैन नॉट बी गिवन, आंसर इज एजिथ्रोमाइसिन। ओके चलिए, ईयर प्रॉब्लम ओटाइटिस मीडिया कर दिया ना बेटा। ओके चलिए नेक्स्ट क्वेश्चन। ये हमने कल क्लास में डिस्कस किया ही था। आफ्टर गिविंग नॉर एड्रेनालिन आईवी इंजेक्शन देयर इज डिक्रीज इन हार्ट रेट, द रीजन। ठीक है, तो whenever the BP increases, noradrenaline stimulate alpha 1 which lead to increase in blood pressure. When blood pressure increases, reflex bradycardia occur due to baroreceptors. ठीक है ठीक है, ईयर प्रॉब्लम विद एलर्जी टू पेनिसिलिन हो गया, सो इट इज रिफ्लेक्स बैरोरिसेप्टर एक्टिवेशन, एवरीवन नोज दैट, रिफ्लेक्स बैरोरिसेप्टर एक्टिवेशन। इट इज टर, टर क्या होता है बेटा? ऑप्शन वाज अमिकासिन आल्सो, ओके, इसमें अमिकासिन कर देते हैं ऐड, किसकी जगह करनी है, इसकी जगह कर देते हैं एमिकासिन, ओके ओके, एमिकासिन कर दिया हमने। चलिए, सो दिस इज बैरोरिसेप्टर्स, एवरीवन नोज दैट बैरोरिसेप्टर में तो कोई प्रॉब्लम नहीं बेटा। एमिकासिन इज यूजुअली नॉट यूज्ड फॉर ओटाइटिस मीडिया, ओटाइटिस मीडिया मोस्टली कॉज्ड बाय ग्राम पॉजिटिव बैक्टीरिया, तो एजिथ्रोमाइसिन आंसर आएगा। ओके, अल्फा 1 कर दो बेटा, इसमें भी कोई दिक्कत नहीं, अगर अल्फा 1 होता तो भी आंसर विल रिमेन सेम, बिकॉज डिक्रीज इन हार्ट रेट इज ड्यू टू बैरोरिसेप्टर्स, बैरोरिसेप्टर्स। ओके, चलिए नेक्स्ट क्वेश्चन। हॉट मल्लिका सबको याद आ गया था एग्जाम में? बैरोरिसेप्टर नहीं था ऑप्शन में वरुण, एवरीवन वाज सेइंग बैरोरिसेप्टर था, अगर बैरोरिसेप्टर नहीं था फिर तो ऑब्वियसली अल्फा 1 हो जाएगा। प्लीज लेट मी नो बैरोरिसेप्टर था कि नहीं इसके ऑप्शन में, बैरोरिसेप्टर वाज देयर और नॉट? साइड इफेक्ट पूछा था कि ईयर डिफेक्ट करता है, ये तो आप क्वेश्चन ही चेंज कर रहे हो भाई टोटली। बैरोरिसेप्टर था ना, तो इसका आंसर बैरोरिसेप्टर आएगा। चलिए ये बताइए, इसमें ये तो नहीं था ना कि विच ड्रग इज कॉजिंग ईयर प्रॉब्लम, दिस इज, ठीक है चलो। हॉट मल्लिका सबको आता है, तो डायरेक्ट क्वेश्चन फ्रॉम हॉट मल्लिका, एपिलेप्टिक पेशेंट प्रेजेंटिंग विद गम हाइपरट्रॉफी एंड ब्लीडिंग, विच एंटी एपिलेप्टिक ड्रग इज लाइकली कॉज, तो आंसर इज फेनिटोइन, फेनिटोइन, यस फेनिटोइन। ओके, चलिए नेक्स्ट। तो वाज देयर सर, क्या किसकी बात करें, किसकी कह रहे हो कि कॉम्बिनेशन विद बिग बिग आंसर्स, इसकी बात कर रहे हो ना? ये तो बैरोरिसेप्टर्स ही आंसर आएगा, इसमें तो कोई डाउट नहीं। सो हाइपर गम हाइपरट्रॉफी एंड ब्लीडिंग आंसर इज फेनिटोइन, फेनिटोइन हॉट मल्लिका सबको याद है ना? माइग्रेन पे क्वेश्चन बता दो बेटा कौन सा था, वी विल ऐड एट द एंड। आई, इट वाज टर, टर क्या होता है बेटा हिलेश? आई कुड नॉट अंडरस्टैंड व्हाट इज द मीनिंग ऑफ टर, एंड व्हाट इज क्वेश्चन ऑफ सुमाट्रिप्टन माइग्रेन, आई विल ऐड हियर, वी विल डिस्कस एट द एंड माइग्रेन, विल डिस्कस एट द एंड। पहले हम ये क्वेश्चन डिस्कस कर लें जो सीक्वेंस में चल रहे हैं। ये हो गया, फेनिटोइन हो गया। चलो नेक्स्ट क्वेश्चन, कैट जी म्यूटेशन आया था, कैट जी इज आइसोनायाजिन, ठीक है, सो वी डिस्कस दैट थिंग आल्सो, हमने पढ़ा था अपने मिशन क्लासेस में ही, कैट जी एंड INHA म्यूटेशन इज फॉर आइसोनायाजिन, RPOB इज फॉर रिफेम्पिसिन, ठीक है, दो ही म्यूटेशन बताया था मैंने, आपको याद करना है, ठीक है। लिवो लेवेटिरस्टाम वाज इन द ऑप्शंस, ओके, किसकी जगह डाल दी है, इसकी जगह डाल दूं लेवेटिरस्टाम, ओके। क्रॉनिक माइग्रेन का ट्रीटमेंट पूछे, चलो माइग्रेन वाला बाद में आएंगे बेटा, लेट्स कंप्लीट दिस, ओके। ये नहीं आया था कि एंटी ट्यूबरकुलर का ईयर डिफेक्ट हो कौन सी ड्रग करती है, मिकासिन था, हेडेक इंप्रूव विद सुमाट्रिप्टन डायग्नोसिस, ओके। अच्छा, एक सुमाट्रिप्टन ये भी अलग से आया था फिर एमिकासिन, एंटी ट्यूबरकुलर विच कॉज ईयर डिफेक्ट्स, ATT which causes ear defects, amicus, that was one question, huh? Okay, लिवोफ्लोक्सासिन नॉट लेवेटिरासिटा, बेटा लिवोफ्लोक्सासिन किसमें आ गया, कहाँ थे हम, अच्छा ये लिवोफ्लोक्सासिन कह रहे हो आप यहाँ पे, हाँ सॉरी TB वाला है तो इसमें लिवोफ्लोक्सासिन ही बनता है, चलो माइग्रेन वाला बाद में करेंगे। चलो बोटुलिनम टॉक्सिन का मैकेनिज्म, डायरेक्ट क्वेश्चन। बोटुलिनम टॉक्सिन का डायरेक्ट क्वेश्चन एवरीवन नोस, ब्लॉक रिलीज ऑफ एसिटाइलकोलिन। बेटा सिस्प्लेटिन इज मोर नेफ्रोटॉक्सिक। बेटा कैटजी का हो गया हमारा, दिस इज द कैटजी क्वेश्चन, ओके। ये कैटजी क्वेश्चन हो गया नेहा। मैकेनिज्म ऑफ एक्शन ऑफ बोटुलिनम टॉक्सिन, पायराजिनामाइड था तो किसकी जगह था, लेवोफ्लोक्सासिन, इसकी जगह कर देते हैं। मॉक्सी भी था, किसकी जगह मॉक्सी करूं फिर मैं, अच्छा इसकी अरे ठीक है, किस कोई भी था आंसर, यू नो आइसोनायाजिड है, ओके। आइसोनायाजिड इज द आंसर। कार्बन पे था सर के। बेटा यू हैव ज्वाइंड लेट, आई थिंक वी हैव ऑलरेडी डिस्कस दैट क्वेश्चन। चलो आंसर इज आइसोनायाजिड, इससे चलते हैं नेक्स्ट। इट इनहिबिट द रिलीज ऑफ एसिटाइलकोलिन फ्रॉम प्री सिनेप्टिक टर्मिनल। आंसर इज आइसोनायाजिड टू दैट क्वेश्चन। चलिए नेक्स्ट चले आगे। कैट जी आइसोनायाजिड, यस, इट इनहिबिट द रिलीज ऑफ एसिटाइलकोलिन। बोटुलिनम टॉक्सिन इनहिबिट द रिलीज ऑफ एसिटाइलकोलिन, ओके। लिवो नहीं था, मॉक्सी था, ठीक है बेटा, आपको क्या फर्क पड़ता है, आंसर विल रिमेन सेम। चलिए नेक्स्ट क्वेश्चन। ये क्वेश्चन था, विच ऑफ द फॉलोइंग इज नॉट द करेक्ट डोज इन ट्रीटमेंट ऑफ मल्टीबैसिलरी लेप्रोसी, वाज दिस द क्वेश्चन। सॉरी, इसमें इन अडल्ट्स भी लिखना होना चाहिए, इन अडल्ट्स। अच्छा, ऑर्गेनोफॉस्फेट पे भी क्वेश्चन था कोई, मुझे बताना बेटा कौन सा था क्वेश्चन था। मैं फर्स्ट ऑफ ऑल कंप्लीट दिस क्वेश्चन। ऑर्गेनोफॉस्फेट पे क्वेश्चन था, हम ऐड कर लेते हैं, आई विल सी एट द एंड। ऑर्गेनोफॉस्फेट, फर्स्ट कंप्लीट दीज क्वेश्चंस। वीकली था ऑप्शन में, स्टार स्केयर्स किसका किस में वीकली लिखा हुआ था, इसमें रिफैम्पिसिन में। तो रिफैम्पिसिन 450 इज द रॉन्ग आंसर, वीकली अगर लिखा तो बिल्कुल ही रॉन्ग हो जाएगा, ओके। द डोज इज 600, तो हमने बहुत कम डोजेस पढ़ी थी, दिस इज वन ऑफ द डोजेस वी डिस्कस्ड इन द क्लास, है ना, ओके। चलिए नेक्स्ट क्वेश्चन। पेशेंट ऑफ शिजोफ्रेनिया वाज ऑन ओलेंजापिन थेरेपी। अच्छा जी, एट्रोपिन विच डज नॉट रिवर्स द सिम्टम आया था, मसल वीकनेस आया था क्वेश्चन, यस ये तो हमने पढ़ा था, ओके ग्रेट। चलिए पहले ये क्वेश्चन करते हैं, शिजोफ्रेनिया वाज ऑन ओलेंजापिन थेरेपी फॉर फ्यू मंथ्स, इफेक्टिव इन कंट्रोलिंग द सिम्टम, पेशेंट स्टॉप टेकिंग। ओलेंजापिन का साइड इफेक्ट पूछा बेसिकली, ओके। द क्वेश्चन आस्क्ड इज ओलेंजापिन साइड इफेक्ट, एवरीवन नोज, हमें पता है ना कि क्लोजापिन और ओलेंजापिन वेट गेन करते हैं, बट किसका वेट गेन नहीं होता, जल्दी से बता दो, किससे वेट गेन नहीं होता, जल्दी से बता दो, शिप्रा आंटी याद है सबको, अरे शिप्रा का तो वेट ही गेन नहीं हो रहा है ना, तो एरिपेप्राजोल एंड जिप्रासिडोन दे डू नॉट कॉज वेट गेन, इट कॉजेज वेट गेन, आंसर इज वेट गेन, ओके। अच्छा, जोलेंड्रोनिक में स्ट्रेट भी रहना, अरे बहुत सारे क्वेश्चन आए फार्मा के, आप कर रहे क्वेश्चन ही नहीं है। जोलेंड्रोनेट, जोलेंड्रोनेट remain straight, we will discuss that in the end, okay। अभी पहले हम पुरानी कर लेते हैं। हाँ, दिस इज वेट गेन। पिछले क्वेश्चन में सी सी टी भी था ऑप्शन में, पिछला क्वेश्चन मींस ये वाला, अच्छा उसमें सी सी टी में डायग्नोसिस बनाया होगा ना वो तो, चलो। ड्रग ऑफ चॉइस फॉर क्रिप्टोकोकल मेनिंजाइटिस, तो बेटा बताते रहो ड्रग ऑफ चॉइस जो जो पूछे थे मेरे को, वी विल कीप ऑन एडिंग। ड्रग ऑफ चॉइस फॉर ट्रीटमेंट ऑफ क्रिप्टोकोकल मेनिंजाइटिस, एवरीवन नोज दैट, क्रिप्टोकोकल मेनिंजाइटिस सबको पता है, यस, लाइपोसोमल एम्फोटेरिसिन बी, ओके, लाइपोसोमल एम्फोटेरिसिन बी, ग्रीन स्पुटम भी था, कहाँ गया ग्रीन स्पुटम? ग्रीन स्पुटम वो तो सिम्टम से डायग्नोज कर लिया होगा बेटा। अरे इसमें थोड़ी है, एक टीवी वाले में ऐड होगा, बाद में कर लेंगे चलो। एम्फो बी एंड फ्लूसाइटोसिन कॉम्बिनेशन में था। ओके दैट इज द बेस्ट आंसर, फिर तो और भी इजी। प्लस फ्लूसाइटोसिन, 5 फ्लूसाइटोसिन। सर मेनिंजाइटिस का क्वेश्चन में सिंपल नहीं था, वो बड़े क्वेश्चन विद डिटेल्ड हिस्ट्री। बेटा मेनिंजाइटिस का क्वेश्चन तो हमने ऐड ही नहीं किया कोई। ओके बाकी कोई और पेयर होंगे? आंसर इज लाइपोसोमल एम्फोटेरिसिन बी प्लस 5 फ्लूसाइटोसिन इज गिवन एट द स्टार्ट। ओके ओके सारे सारे कॉम्बिनेशंस थे, ये वाला बेस्ट आंसर है। ओके लाइपोसोमल एम्फोटेरिसिन बी प्लस 5 फ्लूसाइटोसिन। चलिए नेक्स्ट, मेलिग्नेंट हाइपरथर्मिया एवरीवन नोस। फ्लूकोनाजोल नहीं आएगा बेटा, फ्लूसाइटोसिन आएगा कॉम्बिनेशन में। दे आर नेवर गिवन इन कॉम्बिनेशन। एम्फोटेरिसिन बी इज गिवन विद 5 फ्लूसाइटोसिन। ठीक है, 5 फ्लूसाइटोसिन आएगा बेटा, फ्लूकोनाजोल नहीं आएगा, फ्लूकोनाजोल इज गिवन लेटर ऑन। चलिए ठीक है, अगर ये ऑप्शन है 5 फ्लूसाइटोसिन प्लस एम्फोटेरिसिन बी, दैट इज द आंसर। आपको सोचना नहीं है, यही आंसर है। दिस इज द आंसर। ओके दिस इज द आंसर। चलिए नेक्स्ट क्वेश्चन, मेलिग्नेंट हाइपरथर्मिया डेंट्रोलिन एवरीवन नोज, इसमें तो कोई सोचना ही नहीं है। ओके मेलिग्नेंट हाइपरथर्मिया डेंट्रोलिन, नथिंग टू थिंक अबाउट दिस। मेलिग्नेंट हाइपरथर्मिया डेंट्रोलिन। ओके बेटा फ्लूकोनाजोल प्लस एम्फोटेरिसिन बी आंसर नहीं होगा, इट इज 5 फ्लूसाइटोसिन प्लस एम्फोटेरिसिन बी। ओके चलिए, इंडोमेथासिन वाला हमने डिस्कस कर लिया कि द ऑप्शंस वर, you are saying the options were not like this. Options were hyperkalemia. Now please tell me what were the options in this question. इस क्वेश्चन को मेरे को प्लीज ऑप्शंस बता दो आप। AC inhibitors and indomethacin should not be given together because of risk of. Please give the options. Previously someone was telling सर एसिटाजोलम में पीसीटी इज नॉट इन द ऑप्शन, बट बेटा कहाँ पे एक्ट करेगा बता दो, अगर पीसीटी नहीं ऑप्शन में थे। पीसीटी इज नॉट इन द ऑप्शन, तो फिर कहाँ थे ऑप्शंस, क्या थे बेटा? हाइपोनेट्रीमिया, ओके सेकंड इज हाइपोनेट्रीमिया। इमेज था पीसीटी का, ऑब्वियसली इमेज की तो बात हो रही है। हाइपर यूरिसीमिया, ओके हाइपर यूरिसीमिया। और क्या हो रहा है क्या? डिसेंडिंग लूप ऑफ एनले, असेंडिंग लूप ऑफ एनले, डीसीटी एंड लास्ट क्या लिखा है? कलेक्टिंग डक्ट। एरो डिसेंडिंग लूप पे थी सर। नहीं यार डिसेंडिंग लूप पे कैसे हो सकती है? पाक किया था, वरुण ने आंसर किया है पीसीटी। बेटा वो पीसीटी होगा, थोड़ा सा नीचे लगा दिया होगा एरो ने, आपको पता तो है क्वेश्चन ऐसे ही होते हैं। वो डिसेंडिंग लूप पे लगा दिया होगा, थोड़ा सा ऊपर होगा वो। ठीक है चलो नेक्स्ट क्वेश्चन। हाँ ये ऐसा कोई क्वेश्चन था, यूटीआई वाला क्वेश्चन था जिसमें ड्रग पूछा था, ऐसा कोई क्वेश्चन? स्लाइटली एट जंक्शन कह रहे हो ना? हाँ भाई मैं कह रहा हूँ वो थोड़ा सा उन्होंने नीचे लगा दिया होगा एरो, ऐसे ही करते हैं इंडिया वाले। चलिए प्लीज टेल मी दिस क्वेश्चन, यूटीआई वाला क्वेश्चन प्लीज कंप्लीट इट, प्लीज टेल मी व्हाट इज द क्वेश्चन। बेटा सिप्रोफ्लॉक्सन लिखा था बट क्वेश्चन क्या था बेटा? प्रोस्टाग्लैंड एनालॉग वाला एंड में डिस्कस करेंगे, पहले ये कर लो प्लीज। मोहित आप मुझे एंड में याद करवा देना। क्लीन कैच मिड स्ट्रीम यूरिन, ठीक है। वो यूटीआई का सिम्टम्स बता दिया हमने, उसका ड्रग ऑफ चॉइस पूछा था। यूटीआई सिम्टम्स दिए हैं, मिड स्ट्रीम क्लीन कैच यूरिन में आ गया, ऑर्गेनिज्म आ गए। प्लीज टेल मी द ऑप्शंस। अच्छा यूरिन सैंपल कब लेंगे? डायग्नोसिस वाला था ये, तो देन आई विल रिमूव इट। ड्रग का नहीं था ये क्वेश्चन। फोकस बेटा बताओ, ये ड्रग का क्वेश्चन नहीं था। जल्दी प्लीज कंप्लीट दिस क्वेश्चन। सैंपल के बारे में था, तो लेट्स लीव इट। हाउ टू कलेक्ट, यस मिड स्ट्रीम क्लीन कैच सैंपल लेना होता है। सो दिस इज नॉट अ फार्मा क्वेश्चन, आई एम डिलीटिंग इट। ओके चलो माइग्रेन वाला क्वेश्चन पूछो। सिंपल डायग्नोसिस था, पेशेंट हैज हेडेक विच इज ट्रीटेड बाय सुमाट्रिप्टान। डायग्नोसिस ये क्वेश्चन था। ऑप्शंस क्या थे और माइग्रेन के अलावा? What were the options apart from migraine? Throbbing pain, okay. Throbbing pain. Photophobia, unilateral, okay. यूनिलेटरल भी है, विद फोटोफोबिया भी है, मतलब क्लासिकल सिम्टम्स ऑफ माइग्रेन है। टेंशन हेडेक था, ओके। बाकी ऑप्शंस वो हेडेक वाली बाकी होंगी, है ना? तो आंसर इज माइग्रेन, ओके। क्लस्टर हेडेक था, ओके। तो इट इज कैरेक्टरिस्टिक माइग्रेन, ओके। ओके चलो बहुत बढ़िया, बहुत बढ़िया। चलिए नेक्स्ट क्वेश्चन। विच एटीटी कॉजेज ईयर डिफेक्ट्स, अगर ये क्वेश्चन आया था, which ATT causes ear defects, was there such a question was there? Got it। माइग्रेन का हो गया बेटा, अब इस पे आ जाते हैं। which causes ear defects amikacin, was this the question? नहीं था। नेचर क्रिएशन इज सेइंग यस, देवाश्री सेइंग नो। आई वांट 3 more votes for yes, only then I will consider yes. लोकेश भार्गव are saying no, 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 okay, so this was not the question, delete it. Organophosphate poisoning, which symptom is not reversed by atropine? OP poisoning is not reversed by atropine. ये तो हमने बहुत बार डिस्कस कर लिया है ना। मसल वीकनेस, फोटो सेंसिटिव भी था, ठीक है वो सब हो जाएगा बेटा। ओके चलिए, ये तो मसल वीकनेस आंसर हो गया इसका। मसल वीकनेस वी नो निकोटिनिक सिम्टम्स आर नॉट रिवर्स्ड। जोलोंड्रेनिक एसिड लेते हैं तो व्हाई द पर्सन शुड रिमेन स्ट्रेट? ड्यू टू रिस्क ऑफ इसोफेजाइटिस। इसोफेजाइटिस। इसके बाकी ऑप्शन बता दो। प्रोस्टाग्लैंडिन एनालॉग वाला बताओ रितिका, व्हाट वाज द क्वेश्चन? So esophagitis was the direct answer. Can you tell other options? Nupur, please try to remember the prostaglandin analog question. Prostaglandin analog with UV-scleral outflow increase, I guess. Was that the question? Please tell me prostaglandin analog wala question. Was this the question? Hypercalcemia drug of choice. हाँ वो तो कर दिया बेटा, जोलेंड्रोनेट हो गया, जोलेंड्रोनेट वाला तो हो गया इसोफेजाइटिस. ट्रू अबाउट प्रोस्टाग्लैंडिन एनालॉग या मैकेनिज्म, क्या पूछा बेटा, क्वेश्चन तो बताओ. प्रोस्टाग्लैंडिन एनालॉग, व्हाट वाज द क्वेश्चन आस्क्ड एंड व्हाट वर द ऑप्शंस? ट्रू स्टेटमेंट ऑफ प्रोस्टाग्लैंडिन एनालॉग बताओ बेटा, ऑप्शंस तो बताओ. ट्रू. सेफ इन प्रेगनेंसी, ओके. सेफ इन प्रेगनेंसी तो रॉन्ग है. दे कैन कॉज अबॉर्शन. और क्या था ऑप्शंस? क्वेश्चन आस्क्ड वाज करेक्ट और इनकरेक्ट?
सर एक ऑप्शन था कि एक डिक्रीजेस एक्वस प्रोडक्शन.
ओह, थैंक यू सर, थैंक यू. डिक्रीजेस एक्वस प्रोडक्शन. अच्छा, ये ऑप्था का क्वेश्चन था क्या ये?
सर आप फार्मा वाले हो सर, हम तो ऑफ्था वाले, क्या सर फार्मा का क्वेश्चन है.
नहीं मतलब ये यूवेस्कुलर आउटफ्लो पे भी था क्या?
सर ऑफ्था में भी पूछा है, बच्चे ने बताया सर ये क्वेश्चन.
अच्छा, इंक्रीजेस यूवेस्कुलर आउटफ्लो भी था सर?
नहीं सर, वो बाकी चॉइसेस नहीं मिली मेरे को, दो ही चॉइसेस मिली, ए एंड बी जो मैंने बताई है, सेफ इन प्रेगनेंसी एंड
ओके.
डिक्रीज एक्वस प्रोडक्शन. डिक्रीज एक्वस प्रोडक्शन तो नहीं है.
हाँ, सेफ ही नहीं है
सेफ इन
प्रेगनेंसी.
प्रेगनेंसी, आई थिंक प्रेगनेंसी में कुछ ऐसा कॉन्ट्राइंडिकेशन तो नहीं है इसका. आई एम नेवर रेड एनीवेयर.
सर प्रोस्टाग्लैंडिन एनालॉग पूछना है इन जनरल, तो मिसोप्रोस्टल मतलब दे हैव नॉट मेंशन लेटानोप्रोस्ट ना.
नो, दे हैव नॉट मेंशन्ड
हाँ, तो
लेटानोप्रोस्ट.
मिसोप्रोस्टल इज कॉन्ट्राइंडिकेटेड ना सर.
अच्छा वैसे तो हाँ ठीक है, बिल्कुल सही है. मतलब मैं
हाँ.
ऑफ्था वाला तो ऑफ्था ही सोचूंगा सर.
हाँ. ये दोनों तो गलत हैं भाई. सेफ इन प्रेगनेंसी में सेफ नहीं है, एक्सो प्रोडक्शन भी डिक्रीज नहीं करते. यूवेस्कुलर फ्लो आया था, ही सेइंग इंक्रीज यूवेस्कुलर फ्लो भी है सर. डिक्रीज यू इंक्रीज आया था भाई.
यूवेस्कुलर आया था तो फिर वो ठीक हो जाएगा सर. इंक्रीज इन
हाँ,
यूवेस्कुलर आउटफ्लो, दैट
वही
इज
हो.
क्लियर, दैट इज द आंसर. ऑप्शन में लेटानोप्रोस करके, दे आर सेइंग ऑप्शन में लेटानोप्रोस करके.
अच्छा, ऑप्शन, अच्छा ये लिखा हुआ ना, लेटानोप्रोस इंक्रीजेज यूवेस्कुलर फ्लो, ऐसा होगा.
ओके.
ये वाला होगा, ओके.
या क्वेश्चन में सर जहाँ पीजे एनालॉग लिखा है वहां तो लेटानोप्रोस नहीं लिखा था.
ये मेरे ख्याल से ये होगा, मिसोप्रोस्टल सेफ इन प्रेगनेंसी, इस तरह से होगा, अलग अलग नाम दिए होंगे इन्होंने.
ठीक है.
ठीक है, और यहाँ पे लेटानोप्रोस्ट होगा या कोई और होगा, बेमेटोप्रोस्ट होगा, हो सकता है.
बच्चे कह रहे हैं कि हम उनको कंफ्यूज कर रहे हैं दोनों मिलके.
यूवीएस क्लियर वाला नहीं था ऑप्शन में, तो फिर बाकी ऑप्शन बताओ ना भाई.
कॉर्निया डिपोजिशन भी था, वन इज सेइंग कॉर्निया डिपोजिशन भी था. नहीं, कॉर्निया डिपोजिशन नहीं होता इसमें.
कॉर्नियल डिपोजिशन ऐड कर दे. तो ये क्वेश्चन यार, या तो ये ऑप्था का क्वेश्चन होगा या प्रोस्टाग्लैंडिन का होगा. दो दो ऑप्शन तो ऑप्था के देंगे नहीं, तीन तीन.
सर यूवेटिस फ्लो नहीं था. डॉक्टर रितिका इज सेइंग यूवेटिस फ्लो नहीं था.
नहीं था. चलो, चलो बेटा, इसका सही ऑप्शन मिलेंगे तभी आंसर बता पाएंगे, पहले दोनों गलत हैं बस.
प्रेगनेंसी नहीं था. पेरी ऑर्बिटल एट्रोफी.
ये क्या चीज लेंगे, ये मिक्स कर रहे हैं क्वेश्चंस. चलिए,
ठीक
आप ऑप्था में सर के साथ डिस्कस करना, ये मैं फार्मा खत्म करता हूँ जल्दी से.
है, डन सर. ओके.
तो आई थिंक मेरे हिसाब से फार्मा के हो गए. एनी वन रिमेंबर एनी अदर क्वेश्चन? एनी वन रिमेंबर एनी अदर क्वेश्चन? नहीं. चलिए फिर आई विल क्विकली फिनिश. लेट्स रिवाइज क्विकली, क्या क्या क्वेश्चंस आए थे, कितने सही होगा आपके, जल्दी जल्दी से. चलो, हाइपरटेंशन इन प्रेगनेंसी कॉन्ट्राइंडिकेटेड इन एनएलएप्रैल, सबका एक क्वेश्चन सही हो गया. ब्लियोमाइसिन पल्मोनरी फाइब्रोसिस, दो क्वेश्चन सही हो गए. ये तो बताना है SGLT2 इनहिबिटर तो हर बार आता है, तीन क्वेश्चन सही हो गए. ठीक है, NSL सिस्टीन रिप्लेनिश ग्लूटाथियोन लेवल्स, ये proximal tubule. Cisplatin is more nephrotoxic. Immune reconstitution syndrome आएगा दोनों को एक साथ देंगे तो. Azithromycin for otitis media. Baroreceptor activation noradrenaline वाला. Phenytoin hot malika. Isoniazid CATG mutation. ब्लॉक रिलीज ऑफ स्टाइलकोलिन टर्मिनल बोटुलिन टॉक्सिन. हर बार ही आता है ये क्वेश्चन तो. रिफेम्पिसिन 450 नहीं है, 600 मिलीग्राम मंथली है. वेट गेन, ठीक है. अरे शिप्रा सबको याद ही है. लाइपोसोमल एम्फेटेसिन बी प्लस 5 फ्लूसाइटोसिन. देन डेंट्रोलिन मेलग्ना हाइपरथर्मिया. इसमें हाइपरकैलिमिया करेंगे इंडोमेथासिन एसी इनहिबिटर टुगेदर कॉल हाइपरकैलिमिया. माइग्रेन क्लासिकल आंसर है. देन विच सिम्टम नॉट रिवर्स इज मसल वीकनेस. जुलेंट्रोनेट स्टेट रहना क्योंकि एसोफेजाइटिस करता है. एंड ये वाला तो हटा ही देते हैं, ऑप्था में ऐड कर लेना. ओके चलिए. सो आई थिंक मोस्टली क्वेश्चंस हमने ऑलरेडी पढ़े हुए थे. आई होप यू मस्ट हैव डन देम करेक्ट एंड ऑल द बेस्ट फॉर द एग्जाम्स. चलिए गौरव सर आप ले लीजिए माइक जल्दी से.
नहीं सर, अभी अतुल सर की बारी है. पहले अतुल सर लाइन में है, फिर मैं आऊंगा.
अतुल सर आप आ जाइए. नमस्कार
हाँ सर,
अतुल.
आपको पता है ना सर, उनका वो बंदूक पिस्तौल सब रहती है, वो लेके आ
हाँ
जाएंगे.
कैसे हो भेड़िया.
सर आपने कमाल कर दिया. आपने पूछा कि कौन सा बीएनएस आएगा, आज तक आया नहीं था. मैंने बोला 194
सर मैंने
196.
तो क्वेश्चन जनरल पूछा था, आपने पिन पॉइंट आंसर भी बता दिया. आप बता दिया करो, पेपर बनाते हैं तो.
ठीक है सर. मैं शेयर करता हूँ स्क्रीन.
ठीक है
ऑसम सर, ऑसम डॉक्टर सर, ऑसम.
और नमस्कार सर, गौरव सर क्या हाल है.
बढ़िया सर, ऑल गुड ऑल गुड. कैरी ऑन सर, स्टार्ट.
या मैं शेयर कर रहा हूँ मैं स्क्रीन. जस्ट इज माय स्क्रीन विजिबल.
नहीं सर अभी नहीं.
हाँ एक सेकंड, वो हो रहा है कनेक्ट बीच में. आई थिंक नाउ इट्स विजिबल.
यस सर, नाउ इट इज विजिबल.
ठीक है. मुझे लगता है कि लॉट ऑफ क्वेश्चंस केम फ्रॉम फोरेंसिक मेडिसिन and one of the question was very simple PYQ, that two people friends were working together at a construction site and a hammer fell from one friend's hand. So hammer will always lead to depressed fracture. So that was I think this question was correct. ऐसे ही क्वेश्चन आया था ना. This kind of question came. आधा डर फोरेंसिक का था. The question was correct or not, Neha? This was the question I think which came, where the image was shown and it was asked which kind of fractures, and the answer is yes. Answer will be depressed fracture. That is simple. Okay. Then there was the question which came here, which we discussed by chance yesterday in the 3 to 5 questions. They asked about the BNSS. BNSS, and here we know that because it's a case of dowry death, the inquest will be done by magistrate inquest, and the magistrate inquest is 196 BNSS, which earlier was called 176 CRPC. ठीक है. क्या बोल रहे हो सर, वहां कंप्यूटर स्क्रीन पे 10-10 लिंक के क्वेश्चन थे, 2-3 लाइन के नहीं थे. अच्छा फटके 4 हो गए थे, पता नहीं क्या लिख रहे हो. ठीक है. सो दिस वाज 196 BNSS विल बी दी आंसर. कल मैंने रैंडमली बोला था एंड दिस क्वेश्चन केम. चलो जिसने पढ़ सुना होगा तो उसका डेफिनेटली इट वुड हैव बीन करेक्ट. So all 4 questions, so I don't know, but this is wherever it was 196 BNSS, that will be the answer. ठीक है ना. I told this yesterday only. Then there was some question on the age of abrasion, and it was dark brown color was written. Am I right? What was the color of abrasion? What was the color of abrasion? Dark brown color. So dark brown color is seen between 4 to 7 days. It was not the question was not asked that when the scab formation occurs. The question was asked the dark brown color. For dark brown color, the answer will be 4 to 7 days. Okay. Then, in which condition the magistrate will do the inquest instead of police inquest? So the choice was red brown or dark brown. That will make the difference. It was red brown abrasion. Then the answer will be 2 to 3 days. If it was dark brown, then it will be 4 to 7 days. Black brown ho, yeah, dark brown. In these cases, black, brown, dark brown. Here the answer will be 4 to 7. So you are writing dark brown. So dark brown, my answer will be 4 to 7 days. Okay. Basically, dark color scab will occur in 4 to 7 days. Before that, it will be reddish. Then I think there was a question in which case the magistrate will do the inquest instead of police inquest. So here the answer will be, I think it's very simple, dowry death. पुलिस कस्टडी में डेथ this was the question. Magistrate inquest, no police firing, only firing, death by firing. This question was there or not? In which condition the magistrate will do the inquest? Magistrate inquest है ना, whatever were the fourth choice, whether the fourth choice was some murder or anything, the answer will be dowry death. Correct? अच्छा, वैसे पुलिस फायरिंग था या ओनली फायरिंग, that does not make any difference whether it was murder, firing, police firing. For magistrate inquest, if the choice of dowry death was given, that will be the answer. Whether murder was there or not, it will not make any difference. Okay, ठीक है. Custodial death. Custodial death was also the answer, choice में नहीं होगा. That cannot happen. Okay. Then leading question can be allowed in. Leading question can be allowed in. So we know leading question is allowed in cross examination. Cross examination. Correct? Leading question was allowed in cross examination. This was the question or not? Cross examination, yes. Murder of woman after 7 years of marriage. If the question was after 7 or before 7, if it is after 7 years, after 7 years of marriage, then it will not be dowry death. After 7 years of marriage, inquest will be by police inquest. Before 7 years, it will be magistrate inquest. So what was the choice? Before 7 or after 7? It was before 7 or after 7? Then a lady died under mysterious circumstances within 3 years of marriage. Who will do the inquest? Before 7 years, whether it was written 3 years or 6 years, maybe two questions were there. Anything before 7 years, that of a married woman, we all know it is a case of dowry death. And here the inquest is done by magistrate. So whether it is 3 years or 6 years, the main thing is before 7 years, it is a case of dowry death and the inquest will be done by magistrate. So it does not make any difference whether it was 3 years or 5 years or 6 years. The main thing is before 7 years, the answer will be magistrate inquest. That's it. Okay. Then 82 cephalic index question was asked. So we know that between 80 to 85, the cephalic index is mongoloid. Mongoloid. Okay. Between 80 to 85, the cephalic index is mongoloid. देखो इसमें ना मुझे कंफ्यूजन आ रहा है. somebody is asking before 7 years, after 7 years. I will need to know the exact question. I have told you the concept. Okay. So 80 to RN was in the choice, then also RN will not be the answer. 80 to 85 is mongoloid. Mongoloid was there or not? So answer will be mongoloid. 80 to 85, the answer is mongoloid. Okay. Dowry death में there is some confusion. Don't worry about it. We will select और questions धीरे ध्यान से सोच लेना. Then you can share with me. I think there will be 2-3 questions on dowry death. ऐसा लग रहा है मुझे. एक क्वेश्चन में 7 ईयर था डेथ, फिर उसके पेरेंट्स डाउरी वापस मांग रहे थे, उसका आईपीसी पूछा गया. आईपीसी तो नहीं पूछा गया था. आईपीसी तो स्टूडेंट्स हैव टोल्ड. People have asked about the section for inquest. Okay. Then doctors get two summon. One is for the criminal case and other is for the civil case. And both the case, the rank was same. Rank was same. So we know if the rank was same, then the doctor has to attend the criminal case, criminal court summon first. That was the question. This was the question where doctor attended two cases, criminal and civil. डाइंग डिक्लेरेशन का बाद में डिस्कस करेंगे. डाइंग डिक्लेरेशन का बाद में डिस्कस करेंगे. फर्स्ट यू टेल मी दिस. देयर वाज अ क्वेश्चन ऑन क्रिमिनल केस एंड सिविल केस where the rank was same, and which court will the patient attend? Sorry, the doctor will attend. Here option alag tha, so what were the option? You tell me the option. Option 10, tell me what were the option. Hey, इसमें से तो the answer comes out to be criminal court, but then you will need to tell me the options if the options were different. Send the document to civil and attend criminal option. Yeah, so you will what you send the no, we don't only sharing the document to civil will not help. No, medical evidence has to be the oral evidence. So doctor will go to the criminal court, sending to civil court. He will just have to inform that he cannot attend. He will have to inform that he cannot attend. So the person which came earlier is less important. Here, criminal case will be more important. Okay. Suppose the criminal case has priority over civil court. Please remember, even if the civil case someone came earlier, even if the civil case someone came earlier, the doctor will need to attend the criminal court. Suppose both the courts were of same type, same rank, only that is the last thing that you decide. Date which someone was received earlier, that is the last thing to be decided. Suppose the both were from the civil case or criminal case. In both the cases, ranking was same. Then you see that which someone was received earlier. Otherwise, whether which someone was received earlier is no is the last thing to be seen. It is the last thing to be seen. Okay. So here the criminal, if the rank is same, first thing is rank. If the rank was same, then the second thing that to be seen is criminal versus civil. Okay. You will have to attend the criminal case. So please remember, you will have to attend criminal court, and inform civil court that you can't attend, Okay. Attend the criminal court and inform the civil court that you can't attend. It's not about assault or negligence. The important thing is civil or criminal is important here. You attend the criminal court and inform the civil court that you can't attend. Sending any document is of no use. If you send the report or because medical evidence have to be always oral. So sending only document will not help. Doctor has to attend the court. So you can't attend both the courts together. So you attend criminal court and inform civil that you can't attend. Simple. Okay. So one option was to send notice to criminal court and go to civil. No. Even if civil court came, someone came earlier, the criminal court will be given priority. Please remember this. The which someone was received earlier is the last thing. Suppose both were of civil case or both were criminal case, then it became important that which someone was received earlier. Otherwise, even if civil court someone was received earlier, still the criminal court will be given priority. Okay. There was some question on, I don't know, there was some question on rigor mortis, body was called. I was not able to get the question. What was the question? If you can tell, some time since death was asked. This is what I know, but I was not able to get the question. If you can tell me the question, I don't know what exactly was the question over here. Something on that the body was cold, the dead body was having rigor mortis. What was the time since death? I am actually not able to get the question. Lividity sign was there. Lividity means post-mortem staining. Post-mortem staining starts after 1 hour itself. अच्छा, post-mortem staining was present on the whole body. If the post-mortem staining was present on the whole body, then the time since death will be more than 6 hours. Whole body was having rigor mortis. If the whole body was having rigor mortis, if the whole body was having post-mortem staining or rigor mortis. See, body was cold touching can occur within few hours. Okay, rigor mortis with whole body has rigor mortis, then the time since death will be more than 12 hours. If the whole body had rigor mortis, time since death will be more than 12 hours. A guy gets beaten up by 4 or 5 people and comes to hospital. He decides to undergo dying declaration. So in dying declaration, we know we don't have to take oath. Oath is not to be taken. We all know that. Okay. Dying declaration does not require oath. Okay. Dying declaration does not require oath. If rigor mortis was present everywhere, please remember, if rigor mortis was present in the whole body, then time since death will be more than at least 12 hours. Simple. Okay, 12 to 24 hours. Fixation also occurs after 12 hours. So here the answer will be oath not taken. Dying declaration does not require any oath. Oath. Okay. I don't know, was there any question on injection of toxic compound? I cannot get. So it seems that topic was same, but the choices were confusing. But students are not able to give me the right choices, so it will take time, I think. So don't worry, but it will take time. Corneal transplant. Corneal transplant के लिए it can be done up to 6 hours after death. It can be done up to 6 hours after death.
ये ऑफ्था का क्वेश्चन है।
ठीक है सर, आप आंसर करो। कब तक करते हैं सर? आप तो कभी भी कर सकते हो। Some question came on methanol poisoning. Some question came on methanol poisoning. Pesticide में तो one question was on organophosphate poisoning, which Dr. Goga discussed, that muscle weakness is not reversed by atropine. Muscle weakness is not reversed by atropine. That Dr. Goga has already discussed. I don't know what was exactly the question here. Stabbed in thigh. So that one question came from phosphine gas. अब phosphine gas में question क्या था, या तो मुझे बताओ. Phosphine gases causes inhibition of cytochrome C oxidase. So it is basically tissue hypoxia, histotoxic hypoxia. No, it does not cause hypoxic anemia. There is no anemia here. Because phosphine gas inhibits cytochrome C oxidase and causes oxidative stress. So its mechanism is little bit similar to cyanide poisoning. Like cyanide poisoning, okay? And what histotoxic hypoxia will be the answer. Histotoxic hypoxia will be the answer. Dimensions of cut was specified 3 centimeter into 1 centimeter into 5 centimeter. For phosphine gas, the answer will be histotoxic hypoxia. Of 3 into 1 into 5 centimeter, I need to know more details. It will be perforation is when it goes from one cavity to another cavity. If it is not passing through, 3 into 1, so small wound. So here most likely the answer will be penetration. So that means that the wound is not passing. I am assuming that the wound was not passing through and through. If some answer on stabbing was there, then the answer is stabbing, but I don't know. We don't have the proper choices here. Methanol poisoning, aldehyde बन जाएगा death का कारण. Methanol, if some question was on methanol poisoning, what was the question on methanol poisoning? methanol gets converted to formaldehyde, and formaldehyde to formic acid. Okay, but the main cause of death here is formic acid. Formaldehyde is less toxic. Formic acid is most toxic. Then some question was that after MI, the staining was done by triphenyl tetrazolium. So this is not something which is asked. It's a rare thing. So I don't teach this in the class. I have seen this kind of question for the first time, but I can say that I don't know whether it was discussed in pathology or not. So brick red color is a gross finding. Any gross finding can be seen only after 2 hours, at least 2 hours. Any gross finding cannot be seen before 2 hours. So the 2 to 3 hours was there, that will be the answer. So there was some question on delirium tremens that will be discussed in psychiatry. Paracetamol toxicity, mechanism of action that Dr. Goga would have discovered. Burn area would have discussed in the surgery. So I know there were some questions are still incomplete. We are still collecting the questions, but please share the questions with me and we can share more detailed answers. We can make more clean questions. Okay, and then share with you. So thank you. Thank you, everyone. So I think it will be now Dr. Gaurav. आप आएंगे अभी?
यस सर, आपके पीछे हम ही हैं, आपके पीछे पीछे.
Thank you, sir. Please.
जहाँ जहाँ आप वहाँ वहाँ हम. Thank you.
Thank you, sir. Thank you.
Thank you. Thank you जी. Thank you very much. I'll share my screen. I hope my screen is visible. Screen. Okay, is my screen visible? Can somebody just clarify? I hope it is.
Yes, sir.
Okay, thank you, thank you, thank you. So, off-tal questions, most of them, as I can gather, were from our previous year questions and काफी सारे हमने करे हुए थे. ठीक है? So, hello everyone. Let us discuss them. कुछ कुछ तो बाकी लोगों ने डिस्कस करने की कोशिश करी, जैसे डॉक्टर गोका सर ने भी एक क्वेश्चन डिस्कस करने की कोशिश करी पीजी प्रोस्टेट एनालॉग्स के ऊपर, और डॉक्टर अतुल सर ने भी एक क्वेश्चन करने की डिस्कस करी ऑन कॉलन ट्रांसप्लांटेशन. ठीक है, सो लेट अस स्टार्ट. एक तो ये दिस इज द एग्जैक्ट इमेज व्हिच आई हैव गैदर्ड हैड कम इन द, हाँ, आर डायलिसिस पे भी एक क्वेश्चन था. ठीक है, बट लेट अस टॉक अबाउट दिस. दिस वाज द क्वेश्चन. Was this the question? Carotid surgery patient developed and this image was given. Was this the question which was given? Here the answer is Irwin gas syndrome. I have told you. We have discussed this in class also. It happens. This is a cystoid macular edema. Remember this? This is a cystoid macular edema, CME. This occurs characteristically 4 to 6 weeks after. Yes, this occurs after 4 to 6 weeks. And I have told this in the class also that this is Irwin gas syndrome. This is Irwin gas syndrome and the treatment is steroids. Treatment is steroids. I believe the other options were Stargardt disease, Best disease. यही थे, यही options दिए हुए थे. कुछ और fourth option क्या था? Anybody can just let me help me complete this question. Fourth option. कोई anybody just can pitch in with the fourth option, तो मेरा ये question complete हो जाएगा. That is what I ask for help. If it is possible, then नहीं तो हम आगे चलते हैं. नहीं आया कोई जवाब, so let it be. Irwin gas syndrome वो था. एक क्वेश्चन दे. This is the next question. Difference in refractive power. Power दिया था +2 diopter right eye, -1 diopter left eye. है ना? और यही ऑप्शंस थे. यही ऑप्शंस थे. These were the, अच्छा, fourth option. Thank you for telling. Somebody is telling me Usher syndrome. चलो, I'll just write Usher syndrome here. And that completes my question. Thanks a lot, Dr. Pradeep. Thank you, Dr. Pooja. Thanks a lot. Very good. Thank you, Dr. Jackie Bagnani. Is that Jackie Bagnani? चलो चलो next question. Question number 2. Quickly, फटाफट. We have to do it. फटाफट करते हैं. Let us just complete फटाफट. Difference in reactive power. We all know difference in reactive power is anisotropia. This we have done a lot of time in our mixed astigmatism. एक अच्छा, एक था mixed astigmatism. मलिंगरी नहीं रहा होगा. एक था mixed astigmatism. पर भाई वो दोनों आई में नहीं होगा ना. ठीक है. Mixed astigmatism, it has to be in the same eye. ठीक है. तो here the answer is going to be anisometropia. Here the answer is going to be anisometropia. ठीक है. तो मिक्स्ड astigmatism में एक आंसर ऑप्शन था different eye. Yes. So the correct answer anisometropia. Next. एक क्वेश्चन था which I believe Dr. दिलीप सर must have talked to you कि पैनकोस ट्यूमर दिया हुआ था, है ना, लंग ट्यूमर, लंग वो. We all know that वहां पर हमारा क्या जाता है, there is a sympathetic fibers that are passing there, sympathetic fibers that are passing there, and वो अगर compress हो जाते हैं it leads to Horner syndrome. Horner syndrome. Horner syndrome को tried at ptosis, meiosis, anhidrosis, and exophthalmos is not seen. ठीक है, except question था ना, तो it is not exophthalmos, it is anophthalmos. What happens there is anophthalmos. We have done this. Horner syndrome में ये तीनों चीज मिलती हैं and anophthalmos होता है sympathetic fiber. Very good. अच्छा, NIC कोनिया था एक. ओके, सरफेक्टिव एरर भी नहीं था. दिस इज NIC कोनिया. थैंक यू. थैंक यू डॉक्टर डी. थैंक्स डॉक्टर डी. डॉक्टर पूजा, थैंक यू. गुड. ओके, चलो. सो दिस कंप्लीट्स क्वेश्चन नंबर 3. I am surprised to know कि there were more questions in ophthalmology. Or rather, I've been able to correct more questions in ophthalmology, 18 questions, than even Dr. Dilip sir. Oh, that is great. आ जाओ, आ जाओ. A child who has one eye ptosis, his eyelids are affected on side closed while breastfeeding and are open when he is yawning. Open when he is yawning, है ना? यही था. This is Marcus-Gunn jaw winking ptosis, not reflex. Marcus-Gunn jaw winking ptosis, है ना? Gum chewing ptosis, Marcus-Gunn jaw winking ptosis, characteristically seen on breastfeeding पे note करते हैं, है ना? This also we have done in our questions. Visual acuity normal. Yes, that was visual acuity normal. Sorry, I did not get your name, ma'am. लिखा था visual acuity. Question 4, visual acuity normal. यहीं पे इसी में था. Visual acuity normal. Is that what was mentioned here? Okay. Yes, that was an option. Okay. अच्छा, it was in the option. It was in the option. Okay. 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 Good. Good. ठीक है. Nice question. ठीक है. लिखा था ऑप्शन कैम्बर्ड MG मार्कस गन तो हो गया. दूसरा कैम्बर्ड क्या बेटा? कैम्बर्ड आई डिड नॉट गेट कैम्बर्ड. कैम्ब्रैट. पूजा कैम्ब्रैट. व्हाट इज कैम्ब्रैट? कैम्ब्रैट नहीं समझ आया. डॉक्टर नुपुर एंड डॉक्टर पूजा आई गेड मिस एक्सम मोर नॉर्मल विजय लिखा था. ओके. मिक्स एस्टिग्मेटिज्म नॉर्मल विजय लिखा था. अच्छा, एक ऑप्शन नॉर्मल विजय था. ओके, नॉर्मल विजय एक ऑप्शन रहा होगा. ओके, बट नॉर्मल तो नहीं है. ठीक है. सो माइस्थीनिया ग्रेविस वाज वन ऑफ द ऑप्शंस. ओके, माइस्थीनिया ग्रेविस नहीं होगा. माइस्थीनिया ग्रेविस नहीं होगा. दैट विल नॉट बी देयर. ओके, लैम्बर्ट होगा, नहीं होगा. ब्लेफरोफिमोसिस वाज वन ऑप्शन. ब्लेफरोफाइमोसिस भी नहीं होगा. करेक्ट आंसर इज मार्कस-गंज जॉ विंकिंटोसिस. ठीक है. हाँ, I got it, ma'am. Got it, doctor साहब. Got it, I got that. So I'll delete it from here. No, I understood. Okay, so here the answer is Marcus-Gunn jaw winkingtosis. ठीक है. चलो next. Cover uncover test where it can be used except, है ना, यहाँ पर except था. Okay, except. So amblyopia में there is no use of cover uncover test in amblyopia. You can use it in latent squint, manifest squint, and latent nystagmus also. But amblyopia, there is no use of using cover uncover test in amblyopia. Okay, there is no use of third cranial palsy. Okay, so one was third cranial palsy. थर्ड cranial palsy नहीं, वो भी नहीं है क्योंकि उसमें भी open नहीं होगा when yawning. Okay, A was the correct answer. Here the answer is amblyopia. Okay, cover and cover test is not of any use in amblyopia. Okay. No sir, question में normal visual acuity था. Question में normal visual acuity था. Okay. But you can send me that question on my mobile number. Maybe I'll be able to get it in a better manner. Take it off, sir. There was cerebellar nystagmus. No, sir, ये question नहीं था. नहीं, definitely ये question तो था. Dr. Skeletor, this question was definitely there because I got it from lot of students. They have sent me this question कि था. So Yogi Doctor is also saying था. ठीक है. Amblyopia and low visual acuity together. Okay. Amblyopia and amblyopia and low visual acuity, right? And normal visual acuity. ठीक है. और मे बी एक amblyopia and low visual acuity. नहीं बेटा, it is anisometropia only. ठीक है. हाँ, इसमें I also got confused at some point. One of the students sent me कि accept नहीं था. अगर accept नहीं था, so the best answer would be latent squint. अगर accept था, accept नहीं था ऑप्शन में. Okay. Cover and cover test था. So yeah, cover and cover test is characteristically used for the latent squint because there the squint is hidden. So you cover one eye, you uncover to see that squint. Okay, that is characteristically used for latent squint. But अगर we can use it in manifest squint also, we can use it in latent nystagmus also. But amblyopia में तो cover and cover test का कोई रोल नहीं है. Except था. No, sir. Amblyopia and low visual acuity was in cover and अच्छा amblyopia and low visual acuity यहाँ पे कह रहे हो आप. ओके, आप यहाँ पे कह रहे हो. ठीक है, तब भी यहाँ पर कवर अनकवर टेस्ट का कोई रोल नहीं है. नहीं बेटा, डिफिकल्ट नहीं था. आई बिलीव इट वाज वेरी सिंपल एंड व्हाट लॉट ऑफ थिंग्स वी हैव डन इन आवर मैराथन आल्सो, इन आवर प्रीवियस ईयर आल्सो. ठीक है, सो हमने सब कुछ कहा. यस, एक्सेप्ट नहीं था तो लेटेंट, एक्सेप्ट था तो एम्ब्लायोपिया. ठीक है, दैट इज करेक्ट. नाउ ब्लिंक रिफ्लेक्स afferent fiber है ना, दिस ऑल्सो वी हैव डन. ब्लिंक रिफ्लेक्स afferent fiber, दिस ऑल्सो वी हैव डन. और उसमें मैंने बताया था कि कॉर्निया पे टच इज बाय फिफ्थ, afferent इज बाय फिफ्थ एंड efferent इज बाय सेवेंथ. दिस आई हैड वेरी क्लियरली टोल्ड. आई इजीली रिमेंबर कि आई बॉल को क्लोज करने के लिए ऑर्बिकुलरिस का रोल होता है. ठीक है, देयर इज नो रोल ऑफ थर्ड नर्व हियर. ठीक है. हाँ बेटा, कवर एंड कवर एक्सेप्ट था तो हमने मान लिया. आई एम ऑल्सो एग्रीइंग कि एक्सेप्ट था क्योंकि बाकी बच्चों ने एक्सेप्ट. ओनली वन स्टूडेंट सेंट मी कि एक्सेप्ट नहीं था. अदरवाइज मोस्ट ऑफ द स्टूडेंट दैट हैव सेंट मी हैव सेंट कि एक्सेप्ट था. ठीक है, बट वी विल वेट फॉर द फाइनल रिकॉल, डोंट वरी. ठीक है, अगर एक्सेप्ट था तो एम्ब्लायोपिया आंसर है. एक्सेप्ट नहीं था तो लेटेंट स्क्विंट आंसर है. ठीक है, गुड, थैंक यू. हाँ, कॉटन टेस्ट. यस, दिस इज अ कॉटन टेस्ट, ब्लिंक रिफ्लेक्स टेस्ट. Blink reflex test by a cotton wisp. We do it by a cotton wisp. ठीक है, afferent is by 7 or 5th nerve and efferent is by 7th nerve. ठीक है. हाँ, पढ़ा नहीं होगा, कोई बात नहीं, ये तो हमें पता ही है. दिस इज लैक ऑफ थैलमस. यहाँ पे जब हम लैक ऑफ थैलमस करते हैं तब हम बात करते हैं दिस इज इनएबिलिटी टू क्लोज द आई. इनएबिलिटी टू क्लोज आई. This is seen in 7th cranial nerve palsy. This I tell, and this is where I normally tell कि afferent is by 5th nerve. ठीक है, good. अच्छा, अब एक confusion ये है. This is one confusion which I seeing. Some foreign body in the eye Some people are telling most common, some people are telling heterochromia iridium tha question mein. Okay, in both the cases the answer is going to be a iron foreign body. In both the cases the answer is going to be iron foreign body. ठीक है, iron foreign body. Kids image was given for this 7th palsy. Okay, कोई बात नहीं, ठीक है. So this was a image based question. Okay, this was an image based question. Okay, please send me that image. If possible, send me that image. Okay, so iron foreign body is the one which is the most common. Most common था या heterochromia था? Heterochromia था. Okay, so people are saying heterochromia था. तो भी iron foreign body, because iron deposition tends to happen. It leads to siderosis bulbi. It leads to siderosis bulbi where there is pigment deposition. ठीक है, flying foreign body. Okay, so it is a flying foreign body. Okay, flying foreign body कैसे आएगा? Most common chisel and hammer. Chisel and hammer injury. ठीक है, you are hitting something and there is आ रहा हूँ, उस पे भी आ रहा हूँ बेटा. Flying foreign body. So this is good. ठीक है. A person look down and there is proptosis. When the person is bending, the proptosis is increasing. The answer is orbital varices. ठीक है, orbital varices. Any confusion in this question? Any confusion in this question? This was orbital varices. इसके कोई और ऑप्शंस किसी को कंफ्यूजन हुआ हो इस क्वेश्चन में? हाँ डॉक्टर रवीना शाह, आई विल कम टू दैट क्वेश्चन ऑल्सो बेटा जी. What about glass, sir? नहीं बेटा, glass foreign bodies are not very common. Neither are they common nor will they lead to any deposition. ठीक है, they do not cause any pigmentation. Glass is a very inert object. Glass is a very inert object. ठीक है, तो ग्लास में कोई कुछ नहीं होता बेटा. ठीक है, गुड. वाई नॉट ऑर्बिटल एनकेफेलोसील. अच्छा, एक था किसी का एनकेफेलोसील, ऑर्बिटल एनकेफेलोसील का आंसर था एक. तो बेंडिंग में क्यों इंक्रीज होगा बेटा? ऑर्बिटल वायरसिस क्यों नहीं होगा? सेम है आपके PYQ में. हाँ, तो बिल्कुल नहीं, वो नहीं होगा. पेशेंट लुक डाउन, तो ऑर्बिटल वायरसिस है बेटा. दिस इज ऑर्बिटल वायरसिस. वायरसिस आर वीनस स्पेसिस, दे इंक्रीज. ठीक है, नॉन पल्सटाइल दे इंक्रीज. करेक्ट है, ठीक है, चले आगे. ओके, हाइपरथायरॉयडिज्म. अच्छा, एक क्वेश्चन एक चॉइस इसमें हाइपरथायरॉयडिज्म था. वो भी बेंडिंग पे इंक्रीज नहीं होता. ठीक है, ऑर्बिटल सेलुलाइटिस एक आंसर था. ओके, ऑर्बिटल सेलुलाइटिस भी बेंडिंग पे इंक्रीज नहीं होता. ऑर्बिटल सेलुलाइटिस भी बेंडिंग पे इंक्रीज नहीं होता. मूविंग फॉरवर्ड. गुड. विच इज फॉलोइंग इज करेक्ट रिगार्डिंग इनडायरेक्ट. ये भी बिल्कुल हमने मैराथन में भी किया है. इनडायरेक्ट में इन्वर्टेड है ना. इन डायरेक्ट में यू आर क्लोज टू द पेशेंट, इनडायरेक्ट में यू आर अवे फ्रॉम द पेशेंट. अवे फ्रॉम द पेशेंट, तो मैग्निफिकेशन लेस. सो दिस इज द करेक्ट आंसर. मैग्निफिकेशन लेस है ना, यही किया था. हाँ, लाई करनी है. यस, ठीक है, यही किया था, बिल्कुल था. हाँ, ठीक है. नेक्स्ट क्वेश्चन पे आ गए हम लोग. डॉक्टर स्केलेटॉन, डॉक्टर रवीना शाह. नेक्स्ट क्वेश्चन का मैंने साइंस थ्रोम्बोसिस. डॉक्टर मलकनी. लेट अस मूव फॉरवर्ड बेटा, बहुत सारे अभी आपको और भी करने हैं. ठीक है, कुछ भी. सुरेश चौधरी, कुछ भी नहीं बेटा, यही है आंसर. क्वेश्चन यही था, आंसर यही था. इज दिस इन डायटोथाइरोस्कोपी आंसर क्वेश्चन करेक्ट? यू वर ऑल देयर, यू हैव डन दिस क्वेश्चन. 53 डिग्री वाज आल्सो गिवन. 53 डिग्री नहीं बेटा, 53 डिग्री. ओके, उसमें क्या है? 53 डिग्री फील्ड ऑफ विजन, 53 डिग्री फील्ड ऑफ व्यू. ये था डॉक्टर लोकेश. वॉज 53 डिग्री फील्ड ऑफ विजन. 3 to 5 डिग्री मैग्निफिकेशन था. मैग्निफिकेशन 3 to 5 मैग्निफिकेशन है, दैट इज करेक्ट. ओके, ठीक है, दैट इज द करेक्ट आंसर. इरेक्ट एंड इन्वर्टेड, इरेक्ट एंड रियल है. इरेक्ट एंड इन्वर्टेड दोनों नहीं हो सकता डॉक्टर आईगेड. या तो इरेक्ट होगा या इन्वर्टेड होगा. इरेक्ट एंड इन्वर्टेड दोनों नहीं हो सकते. अच्छा, 3x with 53, ठीक है, 3x with 53 भी हो सकता है. 3x with 53 अगर ये था तो ये करेक्ट आंसर है। ठीक है, सम ऑप्शन वॉज 20 इंटू 3 टाइम्स। नहीं बेटा, वो 20 वाला दूसरा था, 20D करके कुछ और था, वो आ रहा हूँ, उस क्वेश्चन पे आ रहा हूँ, आई एम कमिंग टू दैट। 20D वाले पे भी आऊंगा। ठीक है, सो द आंसर इज दिस। नेक्स्ट, पेशेंट लॉस सेम साइड विजन लॉस विद सेंट्रल स्पेयरिंग, है ना। एक ये था, वी हैव डन दिस। विजुअल फील्ड में मैंने कहा भी था कि जरूर एक क्वेश्चन आएगा, सेंट्रल स्पेयरिंग विजुअल फील्ड लॉस, है ना, विद सेंट्रल स्पेयरिंग बोथ साइड विजुअल फील्ड लॉस विथ सेंटर स्पेयरिंग, है ना, ऐसा ही हो गया सेंटर स्पेयरिंग। तो ये क्या हो गया, होमोनिमस हेमियोनोपिया विद मैकुलर स्पेयरिंग। दिस इज होमोनिमस, वो स्पेलिंग गलत है, होमोनिमस हेमियोनोपिया विद मैकुलर स्पेयरिंग, है ना। फास्ट ही कर रहा हूँ, मिशन नोवेयर। आप मेरे को फटाफट रिपीट करा दो, आई डू इट, मिशन नोवेयर, आई नो, आई एम ट्राइंग टू बी। एंड डॉक्टर शिवानी पटेल, वी हैव डन दैट बेटा, आंसर वाज आयरन विथ राइट साइड। अच्छा, विथ राइट साइड, ठीक है, विथ राइट साइड। अगर राइट साइड पे डिफेक्ट, अगर राइट साइड पे डिफेक्ट है तो फील्ड लॉस लेफ्ट साइड होगा, लेफ्ट फील्ड लॉस, इट इज ऑलवेज ऑपोजिट साइड। ठीक है, अगर राइट साइड पे इंजरी है तो फील्ड लॉस लेफ्ट पे होगा, लेफ्ट पे इंजरी है तो राइट पे होगा। हाँ, तो अगर राइट साइड फील्ड लॉस है, डायग्राम ऐसा बन जाएगा बेटा, डायग्राम ऐसा बन जाएगा, बस द डायग्राम वुड चेंज। ठीक है, तो दैट मीन्स कि देयर इज अ लेफ्ट साइड इंजरी। इफ द डायग्राम बिकम्स लाइक दिस, देन दिस इज अ लेफ्ट साइड इंजरी, लेफ्ट इंजरी will lead to a right field defect. हाँ, राइट साइड फील्ड लॉस बोथ मैकुलर स्पेयरिंग, ठीक है। सो द करेक्ट आंसर इज दिस। और कहां पर है ये है एट द ऑक्सीपिटल कॉर्टेक्स, दिस इज एट द ऑक्सीपिटल कॉर्टेक्स, करेक्ट। ओके, डन, गुड, मूव ऑन नेक्स्ट क्वेश्चन। अच्छा, ये इमेज तो नहीं थी ऑब्वियसली, दिस इमेज वाज नॉट देयर। ठीक है, विद लैक्राइमेशन प्रोबिंग वाज डन, एक्स्ट्रा nasal DCR, एंडोस्कोपिक DCR, ये क्या क्वेश्चन था यार? There was some question regarding this. There was some question regarding this. Can you help? दोनों साइड लगेंगे, राइट साइड दोनों विजन में चले गए हैं, दोनों आई, हाँ, तो राइट साइड दोनों आई में चले गए हैं, तो बेटा ऐसे ही हुआ ना, राइट साइड का चले गए हैं दोनों आई में। सी हियर, दिस इज व्हाट आई एम टेलिंग, राइट साइड चले गए हैं दोनों आई में विथ सेंटर स्पेयरिंग। देखो, तो दिस इज व्हाट इज सेंटर स्पेयरिंग, दिस इज व्हाट इज सेंटर स्पेयरिंग, सेंटर इज स्पेयर्ड, ये तो है। विच DCR, इंटरनेशनल DCR और एंडोनेशनल DCR, सही है। चाइल्ड पे देखते हैं प्रोबिंग वाज डन, तो ये उसमें ऐसा कुछ नहीं है, आई थिंक 4 year old लैक्राइमल 7 mm, इसमें लैक्राइमल 7 mm, तो आई वुड डू एक्स्ट्रा नेजल DCR, व्हाई नॉट डू एक्स्ट्रा नेजल DCR? I think we can discuss this question with Dr. Praneeth sir also. Maybe Dr. Praneeth sir has got this question in a better manner. We'll ask him. ठीक है, क्योंकि एंडोनेजल एक्स्ट्रा नेजल मेरे हिसाब से तो एक्स्ट्रा नेजल DCR बन सकता है। ठीक है, आई एम नॉट गॉट दिस क्वेश्चन करेक्टली। कंजक्टाइवल DCR, अच्छा, वन ऑप्शन वाज कंजक्टाइवल DCR, कंजक्टाइवल DCR
Dr. Parineet sir, you can start.
Yes. Thank you, sir. Are you able
Sorry,
to hear?
sorry, Dr. Prince sir.
Sir, you are...
I think my connection got broken, I think.
Sorry, just a minute, sir. I'm removing the share screen.
Just give me, I think, 5-7 questions more left.
Yeah, please.
I'll try to wrap up soon. Just.
Yeah, sure. Take your own time, sir.
Very sorry, very sorry. Okay, so next question, which is true about PG analog? We have got this question. It is safe in pregnancy, helps in decrease in aqueous production. Okay, it is increases uveoscleral outflow. Uveoscleral outflow. This is the correct answer. Okay. And D, I think somebody was saying periorbital. Some उसमें था लास्ट ऑप्शन हिस्ट्री ऑफ 4 ईयर वो एक बार डॉक्टर प्रणीत डिस्कस कर लेंगे एक बार, ठीक है। आई एम लिविंग इट अप टू डॉक्टर प्रणीत। इस पे यूवीएस आउटफ्लो अगर ऑप्शन था तो ये करेक्ट आंसर है बेटा, दिस इज द करेक्ट आंसर, यूवीएस आउटफ्लो। ओके, करेक्ट। नेक्स्ट क्वेश्चन, टिल हाउ मेनी आवर्स आई डोनेशन इज वायबल? इट इज 6 आवर्स, वी हैव डन दिस। ये तो बहुत ही पुराना क्वेश्चन है, वेरी रिपीट क्वेश्चन। इंक्रीज इन यूवेटिस क्लियर आउटफ्लो नहीं था, नॉट एन ऑप्शन। तो क्या ऑप्शन था यार? डॉक्टर वरुण, डॉक्टर रितिका, डॉक्टर साक्षी, प्लीज टेल मी फिर क्या ऑप्शन था, क्योंकि एक्वस प्रोडक्शन भी नहीं है, सेफ इन प्रेगनेंसी। अगर तो लेटानोप्रोस्ट है तो लेटानोप्रोस्ट टॉपिकल तो प्रेगनेंसी में ओके है। लॉन्ग टर्म यूज पिगमेंटेशन, यस, लॉन्ग टर्म यूज विल लीड टू पिगमेंटेशन। लॉन्ग, आप कह रहे हो ये ऑप्शन में नहीं था, तो लॉन्ग टर्म पिगमेंटेशन ये करेक्ट हो जाएगा, ठीक है ना, ये करेक्ट हो जाएगा। पीजी यूज, यस, तो अगर लॉन्ग टर्म पिगमेंटेशन है तो ये करेक्ट हो जाएगा बेटे, ठीक है, करेक्ट है। चलो सर्जरी, सो इट वाज सो कंफ्यूजिंग द क्वेश्चन, है ना। पेरिऑर्बिटल एट्रोफी था एक, पेरिऑर्बिटल एट्रोफी था, एट्रोफी तो नहीं होता, पेरिऑर्बिटल एट्रोफी नहीं होता, ठीक है। लॉन्ग टर्म यूजुअली टू पिगमेंटेशन। हाउ मेनी आवर्स ऑफ आइडोनेशन वायबल? 6 आवर्स, ये तो पुराना क्वेश्चन है। क्लासिक सेंटर्स और रुबेला वर गिवन, है ना। तो एक में एक सॉल्ट एंड पेपर रेटिनोपैथी था, सॉल्ट एंड पेपर रेटिनोपैथी पे एक क्वेश्चन था, एंड द करेक्ट आंसर इज कंजेनिटल रुबेला ना। सो इंक्रीज नहीं था, डिक्रीज था, इंक्रीज नहीं था, डिक्रीज था, डिक्रीज एक्वस प्रोडक्शन ना डिक्रीज करता है ना इंक्रीज करता है, एक्वस प्रोडक्शन पे कोई इफेक्ट नहीं होता इसका पीजी एनालॉग का, ठीक है। पिगमेंटेशन वाज नॉट देयर। डाक्रोसर्जरी यार वो डॉक्टर मैंने प्रणीत के लिए छोड़ दिया, आई हैव लेफ्ट इट फॉर डॉक्टर प्रणीत, छोड़ दो उसको। सॉल्ट एंड पेपर रेटिनोपैथी, कंजेनिटल रुबेला, ये तो कंफ्यूजन नहीं है, देयर इज नो कंफ्यूजन रिगार्डिंग दिस, इट्स एब्सोल्युटली क्लियर क्वेश्चन, ठीक है। चलें नेक्स्ट। हाँ, एक ये क्वेश्चन था, अनवैक्सीनेटेड चाइल्ड विद मीजल्स, फीवर एंड बाइट हॉट स्पॉट, है ना, बाइट हॉट स्पॉट पे एक क्वेश्चन था। Isolate, give vitamin A, isolate institution, give MR vaccine, isolate and give vitamin A. I think this would be the best answer. Triad was given about it. बस ठीक है साई तेजा, absolutely, thank you. So that was good. तो I think इसके अंदर even with measles we give, I think we give MR vaccine, then we isolate and give vitamin A. ऑफ्था के point of view से what is important is you have to give vitamin A for bite hot spot, ठीक है, correct. Next question. Ulcer on inner canthus of eye, ulcer had a roll beaten margin, parasitic appearance, है ना। इनर कैंथस ऑफ आई पे जो सबसे कॉमन है बीसीसी, बेजल सेल कार्सिनोमा, बेजल सेल कार्सिनोमा, है ना। beaded margin, outrolled beaded margin, this is very characteristic of a basal cell carcinoma. हाँ, एक ये था 20 सेंटीमीटर पे नियर विजन है, ठीक है, फार पॉइंट इज इन्फिनिटी। इसका सिंपल सा फॉर्मूला होता है 1 by फोकल लेंथ। ठीक है, 1 by फोकल लेंथ, तो 1 by 20 सेंटीमीटर इज 5। बेसिकली मीटर्स में कर रहे हैं ना, तो 5 डायप्टर इसका करेक्ट आंसर हो जाएगा। चाइल्ड वॉज बिलो पॉवर्टी लाइन, तो भी क्या हो गया, वी विल शेयर बेटा। एक ये क्वेश्चन आया था, ठीक है, दिस वाज एन इमेज बेस्ड क्वेश्चन। ये तो बिल्कुल वही वाली इमेज है जो विच आई कीप शोइंग। ठीक है, दिस इज डायलिसिस, डी शेप pupil, डी shaped pupil. This is the same image that I keep sharing, and this is the same image which came in the exam also. This was again a trauma question. So there were trauma question which I had repeatedly said. Anna? So these were the 18 questions which I had seen. Other question you guys can tell. So most welcome. Send them to me at my mobile number. You can WhatsApp them to me, or you can tag me on the Telegram group. Analysis आया था ना, बिल्कुल ठीक है, yes आया था, ठीक है। I think with this I'll end my session and I'll hand over the session to Dr. Praveen sir. Sorry,
Thank you,
Dr. Praveen,
sir.
to keep you waiting. Very sorry, very
No,
sorry.
sir. Regarding the DCR question, if the block
sir.
is proximal, it is extranasal DCR. If the block is distal, it is endonasal DCR.
Yes,
So
sir.
If the
Yes,
block
sir.
is
I
in the
totally agree.
canaliculate
That's why
side,
I'm saying
then
if the soft stop is at 7 millimeters, then you will do an extranasal DCR. That is why I'm saying.
extranasal. If it is in the lacrimal sac or nasolacrimal duct, then it is endonasal.
Good. Thank you. Thank you, Dr. Praveen sir.
Right,
And
sir.
over to you, please.
Thank you,
I'll
sir.
stop my show. Okay.
Yeah. So dear students, the questions were very easy. All the image-based questions have come from ENT, most of it I feel. And chalo, ek ke baad ek, let us recall these things. So the first question, young female with the merciful anosmia, green-black crusts were seen, and you might have even got more content in the question. But ultimately, the thing is that whenever you have seen the merciful anosmia, it is indicating definitely atrophic rhinitis. Rhinoscleroma में woody nose होता है, और hypertrophic rhinitis में you will have turbinates hypertrophied, and allergic rhinitis में sneezing, watering, itching will be the complaints, right? So this was very easy question, straightforward. Mostly atrophic rhinitis females में होता है, or you will be seeing this green-black crusting as well. And following sign is seen in, what is this sign that you are seeing? The anterior bowing of the posterior maxillary wall. What do you call this? This you call it as Hallman-Miller sign. Very famous. This is seen in JNA, juvenile nasopharyngeal angiofibroma, right? So very easy. And what is the sign shown here? This is your halo sign or target sign or double ring sign, or in your exam it has been given as double target sign. That's okay. This is where do you see this? In case of traumatic CSF rhinorrhea. So in cases of trauma, there will be a central red spot that is caused by blood, and peripherally you will be having it will be surrounded by the halo. So this is like target sign. The shooters you will be seeing there, right? So this is very clearly very easy, right? Double target sign or halo sign, right? And type of tympanoplasty shown in the image. So we were discussing this in our regular classes, and if the graft is directly placed on the foot plate only, this is your foot plate, right? You are not seeing malleus, you are not seeing incus, you are not seeing stapes suprastructure. Directly graft is placed on the foot plate, then it becomes, right, malleus, incus, stapes, and this is directly on the foot plate, right? So very easy, right? So type of tympanoplasty, if this was the image given, then there is definitely type 4. If you were seeing the stapes suprastructure also in the image given in your question, some students said that type 3 was given. If you had seen the stapes suprastructure in the image given in your question paper, then it should be type 3. Most of the students told me that type 4 was given in the exam, right? And elderly female with unilateral hearing loss, lymph nodes were palpable in posterior triangle, and type B tympanogram seen. So this condition, all the clinical features are coinciding with nasopharyngeal carcinoma. So it is a bimodal age distribution, either around 15 years of age or around 60 to 65 years of age, you will be having this. Lymph nodes enlargement you will see in nasopharyngeal carcinoma, not in case of adenoid hypertrophies. and that too posterior triangle involved in nasopharyngeal carcinoma. Painless cervical lymphadenopathy you'll be seeing. Type B tympanogram is due to the eustachian tube block, which is ultimately causing your serous otitis media. So where you'll get a flat curve on impedance, right? So this is your nasopharyngeal carcinoma. More than the hearing loss, you are more concerned about the carcinoma. So radiotherapy becomes the best treatment option if you have to choose one. It's not that grommet is not inserted. Yes, definitely grommet will be inserted. But if at all you have to choose the best option among these two, you have to go for radiotherapy. Carcinoma treatment is more important than your serous otitis media, right? And yeah, neck dissection mostly not required. You just go for radiotherapy, so it will be okay, fine, right? Now, so there was a audiogram given in your exam which was showing conductive hearing loss. I have been telling you a simple way. So 2 lines in the upper part, it indicates a normal audiogram. 2 lines in the upper graph separated with a gap, it indicates conductive hearing loss. 2 lines with the no gap, but in the abnormal area, lower part of the graph, that should be SNHL. 2 lines in the abnormal, or as well as they are having a separator, they are separated by a gap in between them, that becomes the mixed. So hopefully this kind of audiogram might have been given, right? Okay. Yeah, conductive hearing loss peak might have been given, right? So if this was the graph given with airborne gap, bone conduction showing normal, air conduction being affected, that is conductive hearing loss. This is a tuning fork test question, very famous. Previously also asked once. Rini positive on left, negative on right. So by seeing the Rini itself, what you are getting? Rini positive on left means it should be SNHL here, and negative on right means it should be conductive here in the right side, right? But if it is conductive in the right side, Weber should lateralize towards the affected side, right side. But here Weber is lateralizing towards the left side. So what does that mean? The negative which the Rini is being shown here, the Rini is showing here, what the Rini is showing in the negative one is false negative. That happens in your severe unilateral SNHL, sensory neural hearing loss. If it is severe SNHL, so whenever you are doing a Rini for bone conduction, what happens? Whenever you are checking for bone conduction in Rini, the sound waves will travel to opposite side cochlea, and opposite cochlea will hear. Patient will tell that bone conduction is hearable, but air conduction is not hearable. So you will take it as negative. But when you do a Weber, the Weber won't lateralize towards the right side. Weber will lateralize towards the left side. So indicating this side is not conductive. This side is SNHL. It happens in severe SNHL. So the answer is SNHL. And they also have given an extra clue to you. ABC is reduced in right. Absolute bone conduction is reduced in the right side. It simply indicates right side SNHL is there. Even though you didn't understand Rini Weber, if ABC is showing reduced in right side, then it indicates SNHL on the right side. Okay, fine. Now, a child presents with SOB, X-ray shows the following. What is the diagnosis? So you all know this, the subglottic narrowing in the infants, right? So it is seen as steeple-like. So it's called as steeple sign, and it is seen in croup, acute laryngotracheobronchitis. Very easy, straightforward question, right? And the following is seen in a patient of known CSOM complaining of seizures, headache, vomiting, and photophobia. So it's a known case of CSOM. So through the ear, the infection spreads into the most possibility into the brain. It spreads into the temporal lobe. So temporal lobe abscess is the answer here, right? So already you can see in the temporal lobe, the abscess has been already well occupying within the, okay. Sir, someone is asking, without confirming the diagnosis, can we go for radiotherapy in nasopharyngeal carcinoma? No, you have to take a sample specimen, send it for biopsy, histopathological evaluation. Once it confirms it as nasopharyngeal carcinoma, also you need to know the type of carcinoma, verrucous, squamous cell, many types are there, depending on which you can expect the prognosis, how it is going to be. So then only you can go also according to the lymph node status, and you get a scan done and you see the extension of the tumor, stage it, and then accordingly go for the treatment, right? Identify. So what is this sinus? This is maxillary sinus, right? This is maxillary sinus. Here are your ethmoids, and frontal is not present. This is posterior. right? So only unilateral maxillary sinusitis is affected. Sinus is affected, right? So this is a case of maxillary sinusitis. Unilateral maxillary sinusitis, most common reason is your dental infections here. Okay. So dental caries most commonly will cause this unilateral maxillary sinusitis. Identify the marked structure. So the layers of pharyngeal wall, if you take this is your tonsil, and tonsil is first covered by a layer. What is this layer called as? The layer, the immediate layer behind the tonsil. The space, whatever the space you are seeing here is the peritonsillar space in which you have got your paratonsillar vein, tonsillar branch of the facial artery, and the facial layer. What you are seeing here is the first one is your pharyngobasilar fascia, isn't it? After the pharyngobasilar fascia, what are present? Muscle layers. The bed of the tonsil is formed by superior constrictor muscle, and beneath the superior constrictor, here comes your buccopharyngeal fascia. So the answer is buccopharyngeal fascia, isn't it? Okay. So it was not asked the sinus's name. Okay. Mass in middle turbinate, which sinus affect? Okay. Either if mass in the middle meatus, I think. If the mass is there in the middle meatus also, definitely your maxillary sinus, which is opening into the ostium, this is going to get affected more because anti-gravity drainage is most common reason for the maxillary sinuses to get more affected. Even your frontal is draining into the middle meatus, anterior ethmoids are draining into the middle meatus, maxillary is draining into the middle meatus, but maxillary has got anti-gravity drainage. Most common chances, best answer should be maxillary sinusitis, right? And now, 2-year-old child presented with respiratory distress, history of eating peanut was given, clinical examination revealed audible third. So whenever you hear of this word audible third, what does that mean? It is still in the trachea. Foreign body struck in the esophagus at any, either in your upper cardiac sphincter, upper esophageal sphincter or lower esophageal sphincter, it won't move. It won't make any sound. If it is stuck in the larynx also, it won't make any movements. But if it is making any audible thirds during your examination, definitely the foreign body might be present still in the trachea. Okay. You can go for a bronchoscopy and you can remove it, both diagnostic as well as therapeutic. Right? A 2-year child. I don't know whether this question was there. So some students were saying on foreign body, there are 2 questions some students were saying and some students were saying. So as of now, I have included both. So let us see. Okay. If you have any doubts, please do message me. No problem. Anytime you can call or message me. Okay. So a 2-year-old child presented with again respiratory distress, cough and unable to speak after eating. So what is the next best management? So some people are saying Heimlich maneuver, but usually Heimlich maneuver is done in adults, not in children, and that too not in 2-year-old, right? So better thing is already the patient has presented to you, and the next best step is always to go for bronchoscopy, which is both diagnostic as well as therapeutic, right? Okay. No screen. Why no screen? Screen is not there. No, my screen is being shared. Anyone live there? Shubham ji? Mukta ji?
यस सर मैंने सही कर दिया सर.
So many are. अच्छा, कब से गया था screen? Should I go back?
यस सर 1 slide शायद.
This was there?
Yes sir. Yes sir.
Yeah. Is it okay? Fine now? Yeah, fine. Yeah, this is a slight technical error. So where were we? So this question was over. Did you all see the screen earlier? This was there. Yeah, this is okay. This was also over. Buccopharyngeal fascia question was also over. Yeah, 2-year-old child. Yeah, this one. So 2-year-old child presented with respiratory distress, history of eating peanut was given, and audible thud was there. See, whenever a foreign body gets stuck in the esophagus or in the larynx, it will be struck tightly. It won't move here and there. So if the examination is clearly showing you an audible thud, most probable chances of the foreign body will be in the trachea. So, because trachea is a windpipe, so whenever the child is inhaling, exhaling, so slight movement of the foreign body is possible and it can make some audible third sounds, right? Right. Now, so this is another question on 2-year-old child, foreign body again. This child presented with respiratory distress, cough was there and unable to speak after eating. So again, it's a airway foreign body presentation very clearly. And next best management, see, it is bronchoscopy. Someone has asking me whether it could be hemorrhage. Yes, it could be, but usually hemorrhage is done in adults. Okay. So if bronchoscopy is there, then better, because bronchoscopy is diagnostic as well as therapeutic. So it is always better option will be bronchoscopy. Okay. Right. Fine. So should I move ahead? And this sign was given. So usually following a blowout trauma or facial trauma, if any blowout fracture has occurred, the infraorbital wall may get damaged, may get fractured, and the orbital contents may herniate down below. And this will be looking like a teardrop sign or hanging drop sign. Patient will be presenting with diplopia and other symptoms, right? Okay. So this also you were discussing about the DCR option, DCR question. So regarding the DCR question, see, from the medial puncta, there will be canaliculi going, and both canaliculi will be connecting and forming common canaliculus, and it will be connecting to your lacrimal sac. Lacrimal sac will be continuing down as nasolacrimal duct, and this will be opening into the nasal cavity, where it will be opening below the inferior turbinate at inferior meatus with the help of Hasner's valve. So this is your eye, right? Okay, right. Now, if the block is there at the canaliculi level, then you will go for extranasal DCR, right? If the block is at the sac level, lacrimal sac or nasolacrimal duct, then you will go for endonasal DCR. In endonasal DCR, what you are doing? You are opening up the nasolacrimal sac and you are connecting it like this. So if there is a block here also, the tear drops will flow into the nasal cavity like this, right? So very easy. But if a block is there here, or if a block is there here or here, you can't help by doing endonasal DCR, right? Okay. So this is about your ENT questions that have been asked today. So maybe there may be modifications and extra options need to be found out. So please do message, or you can even send me on Telegram. So whatever the options or question modifications are there, please do communicate. Okay. And so, right. So I'll be now sharing the screen to Dr. Srikanth sir, right?
Good evening, sir. Thank you so much. Hello,
Right,
dear
sir.
students. Hello, dear students. Please inform me that audio, video, everything is okay. Please inform me that the share screen is also shared. Hope your all the patterns are fine. All okay. Yes, welcome back, CB agent. Thank you, dear students. How was your exam? How was the anatomy part, beta? I recall the questions. I'm not able to see the screen. Why? The screen is okay, beta. I'm not able to see the screen. Fine. Okay, so
Yes, sir.
I'm
Yes.
starting. Okay. Thank you, Shubham. Screen is okay, no? Okay. So let's start the anatomy questions. Yes. कोई issue नहीं. Yes, Sai Teja, we are going to use our common sense. Okay, I told you at the last time that how to approach for the question. Many questions, many topics. Just one day before we discuss, and I informed these questions are going to ask with the high yielding topic they asked, and more things we are going to look. See here, the general anatomy. What was the question from the general anatomy? Type of the epiphysis shown on tibia and fibula. Such kind of any question, image based question. Yes, options were the pressure, traction, aberrant atavistic epiphysis. Yes, yes, yes. Ram, Ram, Dr. Gurudev. Yes, yes, Sanjay. Ram, Ram, Lal Fool, Neela Fool, anatomy beautiful. So let's start this beautiful session again with this lovely line. कोई तुमसे पूछे कौन हूं मैं तो कह देना कोई खास नहीं, एक दोस्त है कच्चा पक्का सा, एक झूठ है आधा सच्चा सा, कभी हंसने का कभी रोने का, बस एक बहाना अच्छा सा, राहों का ऐसा साथी है जो दूर नहीं और पास नहीं, कोई तुमसे पूछे कौन हूं मैं तो कह देना कोई खास नहीं. So very warm welcome to all of you at this beautiful anatomy recall session. Myself, Dr. Shrikantwa, directly from the Russia, Moscow area. Okay, so this was the question. Arrow on the left side. Okay, so if you are saying arrow on the left side, then fibula was marked. Yes. Samranjit. Okay, arrow was marked either here or here. In both situations, the answer will be the pressure epiphysis. Okay. Yes, due to the pressure, again with the beautiful three-dimensional anatomy, I taught you. This is the again important question. Always the question was marked asked over the joint. This time they asked not directly over the joint, but there is a junction between the diaphysis and the epiphysis. Slightly they displaced, not direct to the PYQ, but indirectly they asked the PYT. So they are asking the question over this part, the tibia and the fibula. Okay, try to understand for this question, sir. They are asking for the our type of the epiphysis. There are the four types of the epiphysis. What are the different four types of the epiphysis? Better, yes, you are able to see. You are able to see. Yes, yes, Rajesh. I'm speaking only in English. I'm speaking only in English. Okay. Yes. So there is a pressure, traction epiphysis at the trochanter and the tubular aberrant epiphysis is usually absent and atavistic at the coracoid process. So whatever the question had been asked, according to this question, answer is the pressure epiphysis. Okay. So let's move. So one question from the general anatomy, always one question. Any kind of the question was yes. Okay, fibula. So I'm removing this one. So you all are saying about the fibula. So I'm marking for yes. You all are saying about the fibula. So here is so answer was the pressure epiphysis. Okay. Okay, sir. So now upper limb. So this is the well predicted question over the nerve. Claw hand was given and fourth, fifth digit was given. So such kind of the image was given. I just put images. This is the complete claw hand, partial claw hand. This is partial claw hand. Definitely the ulnar nerve. Ulnar nerve. Can you tell me what was the D option? Please tell me. Yes, Sanjay, Samranjit, Deminem, Rajesh. Okay, please inform me. I'm not able to see the chat box. Sorry. It was traction. No, traction epiphysis is found. Traction epiphysis is found at the our greater tubercle, lesser tubercle, greater trochanter, lesser trochanter. Okay, AIN. AIN. Okay, even if AIN is given, then answer is the A, ulnar nerve. Okay, AIN was given in the other question also, no? Yes. See here, third fingertip, that is a different question. That is a different question. Okay. Yes, see here, a patient with tingling sensation in the thumb, index, and the middle finger. So this is the our carpal tunnel syndrome case. Okay. Loss of sense on the tip of the thumb. Okay. Tip of thumb. Fine. No images. Okay, no images. So I'm erasing this one. No images. Fine. First three finger were curled and last two finger open. Abhinav, in that situation, if third, in that situation, the answer will be the our yes median nerve. Okay. Tip of the thumb. Few students are saying that tip of the thumb was there. Thumb का कोई question नहीं था. If this carpal tunnel syndrome is there, then answer will be the median nerve. Okay, fifth or fourth finger का था. So if the fourth and roar reaper, if fourth, fifth axillary nerve नहीं था, okay, erase this axillary nerve. I think entry introitious nerve was given. Is it okay? Even if the entry introitious nerve is given, then the answer will be the our yes the carpal tunnel syndrome. Why? Because anterolateral nerve, it is supplying our deep muscles and it is ending before the wrist, no? Okay, fine. Chalo. Next. This is the question related with the surgery. Lateral boundary in given surgical procedure. So just see this area, and I think there is a CA breast surgery. Such kind of the thing was given. So you can see in this image, this is our pectoralis major, and this particular part on the lateral side, sir, this particular part on the lateral side, this is the serratus anterior. So answer in this question, serratus anterior. Okay, is it okay? It was dorsal surface given. Okay. About anesthesia also. Okay, so here, yes, tingling sensation, anesthesia also. Okay. Okay, thank you, Deminem. Okay, na? Fine. Okay, sir. So now come to the next question. So the upper limb, what is the weightage of the upper limb? You can see from the upper limb, generally not be one question, upper limb 1, 2, and the 3. 3 question from the upper limb. इमेज यही थी, बहुत बढ़िया. ओके रोटरी पर चलो आगे बढ़ते हैं. सो नाउ कम टू द अवर लोअर लिम्ब. देयर वाज द समथिंग रेडियोलॉजिकल इमेज. आइडेंटिफाई, देयर वाज वन क्लिनिकल सिचुएशन. आइडेंटिफाई वन वुड वर्कर और एनी सम काइंड ऑफ द सिचुएशन वाज देयर. सो इन दिस इमेज यू कैन सी दिस वन. यस, दिस कंडीशन वाज, दिस इज नथिंग, दिस इज आवर प्री पटेलर बर्सा. So there is a pre-patellar bursitis. Answer is the housemaid knee. And I told you that always Hollywood, Bollywood, Tollywood, all are asked from the anatomy. And at that time, I had told you many times that this is important. And in our classes, yes, tip bursa pani. Do you know? Yes, the question had been asked over the bursa. Yes, bursa. Do you remember? Also this question, can you recall? Sir, there was the bursa. So I told you this song, no? Yes. The another thing. So the questions are asked from the songs, shairis, this all the entertaining. Yes, this is another thing. Yes, so bursa had been asked. Okay, swelling bithi. Okay, the only problem was the language and length of the question will confuse. Okay, yes. Woodworker and swelling present. Okay, fine. What was the C and D? Location, no, I got the review from the students that it was our housemaid knee, clergyman knee. Okay, no issue, signs of everything. Fine. So can you tell me what is the C and D? Housemaid knee. Yes, housemaid knee. This is the pre-patellar bursitis. Students, we are saying that image is approximately similar kind of the image. Carpenter दिया था. Okay, so I am marking the carpenter. Okay, thank you, Lokesh. I will see. Please tag me also there, na, in cerebellum group. Okay, edema. Thank you, Sandeep, and abscess. Okay, Shashi. Thank you. बरसा का ये इमेज नहीं था. Different image, but I got the information similar kind of the image was there. Okay, please inform me, Med Tutor, what image was there. Na? Okay, now there was the another question. This is the PDA related question. Identify the clinical situation. There was the C and D. Okay, but over watching this part, I told you in the anatomy, the valgum and the varum, when there is the adhesion towards the midline, valgum, yes, and when the joint is going away, so this is the varum. Okay, so this was the question over the varum. Okay, there was a question over the varum, and this scene is found in the rickets. Yes. Achha, this was not the image. This was not the image. So can I cut this image? This image was not there. Okay. Okay, so this is the PDF question. Okay, fine. So you will see this in the PDF question, 90 centimeter. Okay, lower limb 40 centimeter. Okay, but even at the platform of the anatomy, you can see the varum and the valgum. Okay, यही इमेज थी. चलो भाई, तो यही इमेज थी. चलो. Okay, यही इमेज थी. Can you tell me the C and D? Same image. Okay. Okay, thank you, thank you. Calcium भी दिया था. Okay, so I am writing the calcium. What deficiency? Vitamin D deficiency. Okay, I am doubtful. Rickets was given. Okay, achondroplasia, that was different question. Okay. Okay, fine, fine. वो अलग question. चलो, this is rickets. So, okay, चलो. So we are right. Now, can you tell me there was the one question over the varicose vein? True statement regarding the image. So lower limb, they ask the question. What are the different question? One question from the general anatomy, 3 question from the upper limb, and the 3 question from the lower limb. 3 question from the lower limb. Yes, varicose vein question was there. And I don't know exact what was the question, but you shouldn't say such kind of the image. Yes, facial nerve. We will come for the facial nerve. I told just one day before yesterday, there was the one beautiful session at the Cerebellum Academy, and I told the cranial nerve is going to ask, and I told the 7th cranial nerve will be asked, and yes, it has been asked. Okay, मैंने कहा था लिख के ले लो 7th nerve आ रहा है, facial nerve आ रहा है. Okay, ablation, something like that, ablation. I told you the varicose vein. I told you the deep venous thrombosis at the platform of the venous drainage of the lower limb. Okay, yes, definitely you can go for the surgery. Okay. So this is the surgery question. Okay, so this is the surgery question. We are not going to discuss here, na? But at the platform of the anatomy, you can go. Okay, sclerotherapy. So true statement regarding the treatment, na? Laser abrasion. Okay, so this is a surgery question. Okay, fine. Laser ablation. Okay, chalo, remove. Now come to the head and neck part. So can you see this is the hit question? Always I'm saying one nerve is definitely going to ask post-auricular numbness with thickened cord-like structure. Similar kind of the image was there, and this is the question from our NEET PG 2000, approximately 18. Sir, what is this? This is the nerve which is running from our area. Sir, anterodivision will supply the our angle of the mandible, shaving area, and it is going towards the ear. So it is saying thickened cord-like structure, post-auricular numbness. So this is the sensory nerve, great auricular nerve. Please inform me the B, C, D. They are right or wrong? Okay, so that is surgery question. No? Yes. Fine. This is the question. Cute. Which one is cute? This image is already asked. No? This is a leprosy condition. This is, yes, beta, this is the leprosy, and I told you the most common nerve in the leprosy which is involved, that is the ulnar nerve, and another is our common peroneal nerve, and third is our great auricular nerve, and which cranial nerve is most commonly involved? So facial nerve, 7th cranial nerve. Okay, Carpenter was given. Okay, miss nowhere. Superficial thrombophlebitis, yes, because it is saying about the numbness, loss of sensation involving the nerve. So easy. Okay, Mandar, getting the point, beta? Okay, no, beta, no, Sandeep, see here, that's why what I told, common sense is the sense which is not common. We have to get open mind. Numbness means loss of sensation is related with the nerve or the vein. If they are asking about the numbness, especially the post-auricular part, yes, go for the nerve. Don't go for the vein, don't go for the node, don't go for this. Exclude this one, na? Agree, beta? Agree? Are you getting the points, everyone? Okay, yes, shaving area, already expected question. Yes, so this is the neck question. Yes, the level of the lymph node. This is the old question. Okay, since 4-5 years, it is not included, but right now, again, it is included. Okay, we will also include this in our learning topic. Beta, already I was teaching this topic, but since many years it was not as so. Again, yes, it is also the question of the surgery, the lymph node level. So remember the level of the lymph node. So first and second, submental, submandibular, then internal jugular vein, upper 1/3, middle 1/3, lower 1/3. Okay, so there is a 2, 3, 4. This time they marked the students. They were marking that they asked that question had been asked about the 3. So I don't know where they marked. Yes. So level of the lymph node. First, submental area. Second, yes, submandibular area. Fine. Then is the internal jugular vein. Upper 1/3, middle 1/3, lower 1/3. Such kind of the area is there. So there is the, yes, you can say the 3, 4, 5. Yes, fifth area. Remember the fifth area is behind the sternocleidomastoid. I will teach you. Don't worry for this. So students, we are saying that arrow was the over third. Arrow was the third. So correct format I need for this one. Okay. Okay, direct answer. Chalo, direct answer. Yes, this is the ENT question also. Identify the marked structure, and there is the marking. There is the marking over the pharyngobasal fascia. The students what they were saying. So answer was the pharyngobasal, which they asked. Fine. Okay. Now come to the question pattern. So the how many questions from the neuroanatomy part? Sir, neuroanatomy part, head neck part 1, then 2, and this was the third question. Okay. No, sir, it was 11. It was second. Okay, fine. It was second. They asked the second. Okay, so I'm marking the second. I'm marking the second. Na? Okay. Here, what the image I received, student also sent for the second. Okay, fine. Second. Red point. Okay. Red point. Chalo bhai, red point tha. Not the arrow. Chalo, आगे बढ़ते हैं. So now the neuroanatomy question. So seventh cranial nerve, facial nerve, similar image. I think this was not the same image. Okay, R3. Thank you. Thank you. Which nerve is damaged? Definitely the Bell's palsy. Okay. Okay. Yes. Now come to the our abdomen and the pelvis part. Name of the pointed structure. Again, this is the our Calot's triangle part. Okay. Same. GTN. What the GTN? Sir, it was, sir, if it was lower palsy or upper, it was infra or supra. Infra or supra. So they ask about the facial nerve, supra and infra. Okay. Yes. Infranuclear is the better answer if such kind of the image was there. No? Infra will be the answer. Yes. And such kind of the image was there. And students are saying the right hepatic artery. There was the arrow over this particular artery, right hepatic artery. Okay, fine. So this is nothing. This is our Calot's triangle topic. Yes. Also, you can say hepatobiliary triangle, but both are different. Remember, the Calot's triangle is not the hepatobiliary triangle. Two different questions. Two questions of the facial. Okay, very nice. Two question of facial nerve. Very good. Can you tell me what type of the question? Post-auricular anesthesia, that was different, no? That was a different question. We already discussed. Now, identify the marked structure. So this was the wife of Salmon boy type question. Till now, there is a lots of the confusion. They ask about the male pelvis and they were giving the option vesicouterine, female. So this is the controversial question. Don't know till now. I'm not able to get the correct option. Pouch of Duxellus again in the female. Morrison pouch is found in the male and female both. But yes, not in this area. And the rectouterine pouch again female. Okay, so this is the dicto same question. Wife of Salmon boy type question. Yes. Okay. So here, no solution. Please tell me if there is the rectovesical pouch. If there is the rectovesical vesicle pouch, then mark this question right. But students are saying, no, sir, this is our rectum. Yes, sir. And this is the vesicle. So this pouch, this space is our recto-vesical pouch. Can you tell me? Male pelvis was there. Yes, this is the male pelvis. We can easily identify. This is the male pelvis, na? Okay. But option, same option or different option? I need this option. Wife of Salmon Boy. None is the answer. Rectovesical. Yes, rectovesical pouch is the answer. Okay, rectovesical pouch is the answer. And if such kind of options are given, then leave this question. Leave this question. Students are saying that, sir, rectovesical was not given. And if the rectovesical is not given, such kind of options are given, then leave this question. It is wrong question pattern. No, it is not the Morrison pouch. Morrison pouch is the hepatorenal pouch, sir. This is the hepatorenal pouch found in between the liver and the kidney. We discussed in our class. Rectovesical was present. Very good, R3. So this is the answer, na? The rectovesical pouch is the answer. Okay, so let's move. Bulbar. There was the one question over the bulbar urethra injury. I was not able to get the option, but yes, one question over the bulbar urethra. विशाल जैन, अब तक सारे क्वेश्चन हो गए, अब बस सेशन खत्म होने वाला है. कोई बात नहीं, इशू कोई बात नहीं. यू कैन सी दिस वन. ओके ओके. कनिका, रेक्टोवेसाइकल नहीं था. हाँ, फ्री का नंबर अब ये तो बेटा हम नहीं बता सकते हैं. यस, आई कैन नॉट से अबाउट दैट बेटा. ओके, रेक्टोवेसाइकल नहीं था. Yes, one picture. So this was the image based question. What was the what were the our different options beta? Can you tell me? Salmon boy. Yes, it is the salmon boy question. Covered in the surgery. Very good, very good. Okay, so fine. So now come to the our embryology part. Okay, so we'll look for this question. I will see and what are the I will recollect. Na? So embryology question. I told that question is going to ask from the neural tube defect CNS development. So this kind of the image was there. Yes, yes, mission where? Tell me beta. This is the open neural tube defect. Anencephaly not, anencephalocyl not, and meningocyl not. So there is a complete opening of this our neural tube part. Okay. Yes, blood in meatus, bulbar urethral injury. Okay. Prosthetic bulbar penile. Okay. Open neural tube. Not the spina bifida. Not the spina bifida. Okay. So there was the one question. Sternocleidomastoid was marked. Any question pharyngeal arches. And if the sternocleidomastoid are, so they can ask the pharyngeal cleft also. Can you help me? Any question over this? Yes, Sanjay. ए वाला ऑप्शन नहीं था. ए वाला ऑप्शन नहीं था, वही तो आंसर था. ए इज करेक्ट. Instead of the anencephaly, spina bifida. Okay. Instead of the anencephaly, spina bifida. Okay, better. Thank you. No question. This question was there. Sternocleidomastoid, yes or no? Okay, तो ऐसा कोई क्वेश्चन नहीं था. चलो, we are dropping ना. Yes. So embryology question. Yes, one question, neural tube defect. Fine. So this was the question. Now the histology. So histology, identify the given image. Students, we are saying the image was given and it was the thymus. Thymus is having the lobulated appearance, and here you will see the small Hessel's corpuscles. So these are the different lobules, and in between, yes, there is a round jalebi like structure. So these are the Hessel's corpuscles. Okay, fine. Yes. Thymus tha. Okay, so the answer was the thymus. No, identify the cell. There was the question and marking over the Purkinje cells. Okay, Neha, that question we discussed. Image of the blastocyst. Okay, I had put one image, but I was not able to recall the options. It may be the question from the Obsgani also. Yes, छलावा ये हम डिस्कस किए बेटा सर. These are the our what you can say molecular layer, then the largest cells are the Purkinje layer, and these are the our granular layer. And I told you that questions are asked from the one question sure from the cerebellum. And always I'm saying now after the launch of the cerebellum, every question from the cerebellum. Okay, yes, all will pass, all you will get the very good number, don't worry. Fine. Okay, sir. Primary lymph node organ was mentioned. Yes. So these are the different questions. Okay, kindly suggest the corrections, exact lines, options for the complete recall. Yes, but there are the few more things. Osteomyelitis complex, I think. So this is the ENT part also. Okay. Yes, integrated question we will see. And there is the question, CA breast image was surgical procedure. So answer was the serratus anterior. Okay, and there was the question about the you can see the anatomy also, and the question over the orthopedics. Okay, exact collection I need. Okay, so there was the dislocation for the entry dislocation. Okay, मिल जाएगा बेटा, मिल जाएगा. You all will crack ना, just be cool complex ना. Okay sir. And damage to the structure due to the lateral laparoscope. So again this is the surgery question. Okay, and classical history. So there was a question over the diaphragmatic hernia. Actually it is the question of the yes clinical pediatrics, but I taught you the diaphragm on which platform you can solve. Yes, there was a photo of the Maker's diverticula also. So again this is related with the our umbilicus, the vitalointestinal duct. So it may be the embryology question, but I was not able to collect the question. Yes. Also, which one is not seen in the Horner syndrome? So this is the again one part in Os palsy. One question I was getting but not able to recall. Yes, Horner syndrome. I taught you this one in the Klumpke's palsy. So please help me if these questions are there. Okay. Yes. So there was the question over the ganglion, or if you are saying sebaceous, if you are saying the lipoma. But yes, remember this is a common site for the ganglion. Okay, and female with the this rat tail sign, the ecclesia cardia had been asked. So I told you the neural crest cells where we discussed about this all. Okay, image of the implantation blastocyst was asked. So these are the few more questions which I am not able to collect. So anatomy questions. Yes, approximately you can say I told you the approximately 18 to 20 question. But if we will do the integration, more questions will be there. Okay, so please inform me what are our different questions, what are the corrections, what are the mistakes there. We will correct, and I will come with the better perfect video for all of you. Okay, so thank you very much. God bless you all. So again at the end, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं. कोशिश है कि सूरत बदलनी चाहिए. तुम्हारे सीने में नहीं तो हमारे सीने में ही सही, हमारे सीने में नहीं तो तुम्हारे सीने में ही सही. कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए. रिमेंबर डियर फ्रेंड्स, क्यों डरे जिंदगी से कि क्या होगा? अरे कुछ नहीं होगा तो कम से कम तजुर्बा होगा. गेटिंग द पॉइंट्स? डोंट हेजिटेट. अब आराम से जाइए, मस्त होकर के जाइए, अच्छे से सोइए, रेस्ट कीजिए. डोंट वरी एट ऑल. ओके, सो थैंक यू वेरी मच. गॉड ब्लेस यू ऑल. आप सभी बहुत बढ़िया से रॉक करेंगे. बी कॉन्फिडेंट. अरे 300 में 150 बस तो लाने हैं. ओके, डेफिनेटली यू विल क्रैक. कूल रहिए, फैमिली को टाइम दीजिए, खुद को टाइम दीजिए. याद रखो बच्चों कि आदमी या तो जीतता है या फिर सीखता है. आदमी हारता कभी नहीं है. आदमी हारता उस दिन है जिस दिन वो कोशिश करना छोड़ देता है. तो एग्जाम को एकदम हवा नहीं बनाना है. अरे एक एग्जाम ही तो है. अगर इस एग्जाम में हम सेलेक्ट हो जाते हैं तो क्या जिंदगी की जंग जो है खत्म हो गई? फिर से एक एग्जाम आएगा, हमको फिर से आगे बढ़ना है. और अगर बाय द वे कुछ अनहोनी हो जाए तो क्या ये जिंदगी का अंत है? ऐसा कुछ नहीं है बेटा, ऐसा कुछ नहीं है. ओके, लाइफ तो चलती थी, चलती ही रहेगी. ओके, तो बी कूल, बी काम, बी रिलैक्स. आदमी या तो जीतता है या फिर सीखता है. आदमी हारता कभी नहीं है. तो हम सभी जीतेंगे. आप जीतोगे, हम जीतेंगे. आप कभी नहीं हार रहे हो. यू आर गेटिंग द सिलेक्शन. बी कूल कॉम्प्लेक्स. ऑल द बेस्ट. गॉड ब्लेस यू ऑल. थैंक यू. Yes, Shubham, I'm over. Can I leave?
Okay, okay, sir. Thank you so much, sir.
Thank you, bhai. Thank you. Thank you.